a course, no. Idea about striking me in this statement, and it's Ministry said they want to investigate the circumstances that led to the reported delay in care. Not just most members in our hospital may have contributed to their course. I'm taking my first thing. Okay, said at least third and fourth point. It makes sense. And what are the security implications? Well, you gotta be proper behind country. All kinds of internal. They are trying to beef up internal security. The police, they have a police post close to the mortuary and all that. All those people were there, and I thought you when you see it. And the security situation has not been improved, and we are not happy about that. And the time here, the tiny second point. Minister, who said there are systems over there. If he doesn't understand, he should get somebody to educate him. And you have a Triage system, so yes, it will be. Don't buy out. The minute can't buy into the showman. Yeah, Doc, I get you, but I think because Triage, Nia, who said, "Oh, yeah, Reno, immediate care, and I said, delayed care as compared to others. If you're sure nobody immediate care, they will attend to you immediately. So, open up by time. I said, others, and I said they will neglect you. They will give you first aid or whatever, but they will attend to other people who need more a year. It doesn't mean that they are delaying whatever. So that statement doesn't make sense to me at all. It doesn't make sense. Whoever wrote that statement doesn't even understand the hospital system. Or a farmer resident. What kind of life is that? You are called disaster when you told your boss I am for statement. Sunday, no, you're man for and then right man for and then.
Right, I will say I'm more kwaba. Na neba life wa chewa haye, but I mean every time I may update current of issues course, but me te wana na adibia important as I said, we the people of this country called Ghana no. As say it sua na di onimni kire wa ofoforo. It seems say the any dia ye wo and I say education ye wo fa doctors and nurses hono. A bread to say you 66 years and you better wo modwuma no ase before ansana ye dey frustrations na ya said that deliberately ya said that ko na ya kodin semfo said ye rough ye I mean now Ghana registered nurses and midwives for council for say omo say ye disrespect. In fact, the minister in charge Kobenemita Kando it seems say or play politics with this issue. But me and you know, and as you and I know, a then you name our hospital say, anytime you are better close to a facility and I say a health facility, no, then you name about nurses and doctors and health professionals, no, personnel, no, then you name, you name me yarena me drew hospital, nurse ni bia be hunu bia sort or some yadia, and I say, as we team us someone sanity, and I say, once who so be share a uniform who are dreaming who is wearing nursing, you know, Janice, I said the OPB or I mean, these are critical matters, and we the people know as you discuss it. So from today, I say you so on say abrofo no almost every mistake BM by ye no asemba near yen hwete na ya to atwene. So today, Udru Hospital now who nursing now, who say once one was wearing nursing, natural say, Omra Messaw Yadia, and I say, Untia was someone. A year because of say, ye lack self education. And I society non, it could be to say, and information service department, civic education, women and you say, Senka, obi to say rough. I will be able to say, yes, say, I mean, psychological or pretenders we in answer for our no person adi army or fight for Ghana and call back home. So, na point and say, and yet the Biana Udru Hospital, who nursing here, I said nursing, no, attended to you and your sanity. Open so soon, I'll be home. So ignorant about the hospital system, so that's your own case. But important say, we are still baby anyhow. In fact, the so-called advanced countries, and your sanity, the so-called advanced countries, no, and your sanity. And just say, oh, sorry, ya udru ya no afro be say, me yare, mo me hwemi, ente sa. You need to respect rules, systems, and procedures. Your country, you know, ye din some fondo. Did ever my rough. what in some phone all because of political, capitalism. Ayet etai, a who here, a see a sunyansa. I see a buness of one doctor see a woman in Tiadodo. Now it will go against us. Will be a complaining, but you need self-education. Uda hospital, and Charles Udruano, nursing Ibia Barrio, and your sanity. Udu hospital be anwa, a so who say, nurses no hono, they operate with instructions. Nurses operate with instructions. Eti, say Rafu case here by ya, to say, and a nurse for no, and no who change ho. Also, logically, a Charles will be obeys our conversation, ya your sound. Secondly, Ebiana wunim, but we as citizens, we can learn. Ti the making. Which one the yen Rafu koye no. A Charles say, why a typical Ghanaian. Typical Ghanaians no so. The Atiana say one day. Onya who say a bianin, so poison won't what in Sabugum, sanity. Now, point and say, minister no, at the end now, koye hono. I was saying, no pay what this says, or koye no. It seems say they are affirming, and I say, almost support to say, systems no nyajuma, but yet, on person almost switch and the koku, health workers and all. So, meanwhile, government now fairly systems, no. Government now fairly systems. And because of the NDC about power and internet, they don't want anyone to talk about this nonsense. And NDC for no, most of them did some fun woman. They are just fooling around. And nothing about my raffle kind. Now I could hospital. Now we did some fun. We be anti cancer. Tell you catch on. Are you very sad? Now one more person musuya de yinsuya say. Me no eden yenim say. Me do hospital. I mean him say enye nurse ni bia na ese o tie me kasa masam wana yenim sa answer me eno me post video na me hwe comment section say nurse fo ni jejina ho omo nhwe ye omo unattended na nurse ni what instruction bia ma na so mahwe e die ntina nurse ni want me ma case bi ho because some cases yen commanding now nurse ni bi ntimi ma o case ho sa te de ye ka kire no nurse ni bi ntumi nsore say ye the patient abeto sorry ya no akono so okohwe no okoma injection. No, these are systems. And maternity abusa from abroad to either countries, you have to your systems, and you need to follow the rules. Eti say ye she trim say and na nurse for no and na nurse for no omo mfa ho no wo no wabusa say a cases bia na nurse ni betimi aba ho ana wabusa sa no ye nyina ye di ho for. So it's about time I see a nyansa. It is our boy and your friend Ralph no or din some phone and a society will be anka. Me ba choba double tap the screen on me ba live watch na asem we na see you be teach him and bibia na say your man nurse for the doctors na be teach him much ye. So in as much as say you too kwine na you see ye near be near the near maybe ha we ye yanka say infantios ni nsua. So na me tell Udru hospital na say unni bibia and bibia na say udi emotionally udi emotions e kosovo nya sa de ye no enya sa ne ye no oduha o say udi case at the hospital nurse ni a wogina ho no say enya ne point say wono na emra ho a o ma ho da ti de ye ka no enche say nurse ni no woye bone dabi nurses and doctors no wo madwuma no procedure systems. It is a the patient but first thing say you benya patient data on taking vitals. Now you're making sure say and then so what the insaka patient we are as so information what the system say asemsi na so ko siw no a what take say oba na ne BP to say no what say not here condition woman san ya admit no. These are all procedures I want ye we basic till they make no but the society no on see the emotions na ya de ye the emotions e be na rafi odin sem fon no I minister no so ono so minister no akogina ona odin sem hu so we say enya politics and ye nipa fofra e ke ho na nkoma peke sa nipa na NDC abanfo kan ya bai nkoma peke nipa no o ti ase so we say tax du gogu hospital na amount for privacy obi a yesi ye ne bia 66 years utimi tam camera na dem hospital obi da ne ba bi kra bia ne ba bi tutu no on cast be video now who screaming. Do you think say ye NBA enya ne bie e ye obetima yes ade no only in this country. So the point and say Moses said he overreacted. Let's be honest. or that be when anyone shed yet the course in ye. The course no country be now. Wow, we have Bearman, the country be I was be up with this answer and phone ready. O Konya sit transit. Now one transit disaster and phone track video me ready. Let us not stop pretend. Yeah, stop that pretense na you know. So MYA. But me ba live at home. Me ba live at Chinty. Yes, I double tap the screen. Na asem we na you be discuss now. Afin many time kakranti. You be live all the time. Na current affairs politics ni you be in wow. But every time no me update page niti I had the reason so. Mr. Wa double tap the page, share page in why. Na yen kan raff for 7 Ghana for you bet me suade. We have to learn from this. It's not also any probably no fees will do hospital or who nurse in yes or and your sanity. Any country would you call to me any country and your sanity. What will say would you do hospital be any other far near Hono, but country chronic now send request. Namusao. It's not true. It's not true. You have to follow the rules, procedures, and systems. Eti say utia video ma omubusa say ye pen ne card. Don't say me card bay. I'm on me card in your man. Can you imagine this? Any power sorry I will say near be or so or a freedom fighter. Can you imagine this? So we hospital. You want you see your data. I will say have there any data wo and not own today. Share. We funny. Country crack Ghana needs to also no so one free ambulance and will do one more walking in or coin and with or corny if you be fan near him. Bobby Dinamiti. And so country be it's only young cross some do. Adia Rafi young cross some and politics into no way sadiano. And your politics into the Jimmy Sano, Moncantrano. There was in a near BSA, any civilized country, over to your Bora hospital, say, condition. Now, call, or more at anyone, no shall see a vibrity. Tell me one. Say, you found tour, yet over to your found tour level. Minimum country crowd also. That was when your PHA we are seeing in an area. In America, NC order, you lie bad. Oh, boy, you lie. You can't do that nonsense. Eti, Obiano bet ma justify this nonsense. No minister, no koswa, no minister, akojina ho, no odwanenum. Meanwhile, ni pano so by ni pano e perpetrator na say, or koso da havoc no, or the jina ho. Eti, your politics near ye nti dabia ye nimbe guase. Ti de meka yo. Eti ya say, wono ti ase say, udu hospital and you who nurse if you are so mess because I'm common. It is that conversation our system when we say a nurse for no who do no more show or be and few. Now when nurse in type of nurse crow you know. One kasami busa. Do you know the kind of nurse I would na? Now what we say nurse for no omu operating whose remit and whose authority. It is today no yen nurses must they operate through the advice and instruction from their doctors. Till they make a so once you know with the emotions and what say nurses no mutri more there be and your sanity because on him so obano about you without instructions na bibi yawa now the human is at risk and the same as doctors. That is why a procedure say udu hospital in as much as every situation a woman one for ambulance amano and I say when you see emergency exit now o man for amane de oba so you make sure say you know information and san ya take vitals ya hunu bibi and san ya de wako. It is even if it's asnet emergency center and you better so be free 911 as ambulance. But so when you walk it through no country and as well walk it through nti o ko kire mo say o de wu nti o mo na mehwe and just sanity. Tell me one country. I say you didn't some food or mine too much. Not rough in them. No what to trust some new hooliganism because some side woody. As who dear ne so fast will be. That's rubbish. Mon country straight away say nonsense. Etai me no society na yenim ye na yenyina yenim education ya e wo form. So and I yet your emotions are near ye wura bia. And ye boom nurse for na bomfiana yes woman ye and yes woman ye and so sanity o wiase bia. In America sanity, London, UK, Germany sanity. The difference in say so when your emergencies are on opa no afre 911 as ambulance so ma be fawo omudu bedu no ma take vitals ascend get all information na tie de yeka no but it's how walk it through any hospital and you adwen say wo case in special and you na be determine your case. The doctors will determine your case and you na be determine so it is nonsense. Adia guy ni ye no nipa ne te o men no minister no wakọ abrantie ni isa say obama police arresting for further investigation. Na minister no wa jobling ni no gina ho. All because of say politics we NDC ni. Na mutwa saboni wewie na de enkora no sase so mu sua na mo kem. Bad precedents. Enyo eti adia rafia ni terrible. Terrible. Eti sade yadwini city no on say wo hwe ne ya wo ye boys ne ye wo ho no utu say nkurasesem ne ye mo nkurasesem no wo madwenim me kan NDC typical NDC for nkurasesem ko a so nkurasesem ko a because no country and yes ankwasesem no etai eti say wo no wo pese wo sua de a wo be federal research say me do hospital nurse ni bay and nurse will attend me in what situation bay no me can wo ka so nkwan no situation nkwan na nurse ni wo hu bi da na ti asese wo hu no sa situation ni bi da but as say pass through the system et say country bebre ka bo bi a ntimi nkofa no say wo kona ka bo bi da wo se wo na wo kopagya no try that and see enti ye system no nyansa ne yensua ne ma bebre ntia ani adwen se ye bibia anye ni nurse fo nye ena nurse fo nye ena nurse fo nye ede so tese obi no fi say ko do hospital an nurse ni abepagya no no okohwe ne nyasa ne tie country na mo so mo ye civilized ye nya sa akra wo mo kra na they have all the systems no enya sa ne tie unya duru ha you obe say kiwa obe di kiw no so obe di kiw no so akwa bi akofa edi a odi ato no so kra ntemembo because said dini ayanyansafo din e na akwa bi akofa to we ko NDC fo na o ntimi nwene no say Ralph na fight for no Ralph we ni fight for dey e fight for kan say ni e de kire my own wadwene nye ohia futo stay here na me finance ngura utiri why eti de tie ne say yemfa emotions enko ba bi a unim ade hu nyansa wo yesa obeda ni Jimmy for said Ralph aye no ade o ye ni ye Jimmy some straight away and NDC for no so a dodo no won Jimmy ni nti no wo musu de kire say yo e wo de on dodo no NDC for dodo no wo Jimmy ni wo ma fa dodo eti wo mu fi say wo ya de papa bi ba ye nkura sesem ogu o man ani mu ase so udru country bia no bia hu sa video no sa na country na do mu ni security services ana adai we o man ba ni o man ba fo kanka ba na mo chekere no NDC for enuti NDC ni bia o support bia de okohu obi no support no pe we NDC ni a utimi nwene ena na ni mie watu kan akura so a o kono hye kona bi wo hunu hwe on de mi cheri etai eti ayi we ye ayi Ghana Registered Nurses Midwives Council one secretary we realize here Dr. Chum Tenkran we realize serious in fact o kache kwabena mita kando say as a health minister the obey ho ne hwehwe ni mu yenti kakra
contributed to the course no
nyansa bia ni tatebulum obi I've taken my it's the first thing okay first at least first third and fourth point it makes sense and what are the security implications here on the atu akwam well you guys be papa bi an country don't kind so well I mean internal they are trying to beef up internal security the police they have a police post close to the mortuary and all that all those people were there and I thought they were in see and you know the security situation has not been improved and we are not happy about that at the time here me tiny second point no minister no who said there are systems over there if he doesn't understand he should get somebody to educate him and you make sure say triage system no so yes it obi don't buy a house me can't buy in the shame
yeah doc I get you but I think because
triage Nia instead of Oyari no immediate care and I say delayed care as compared to others. If you are not immediate care, they will attend to you immediately. So open by time, others, and they will neglect you. They will give you first aid or whatever, but they will attend to other people who need more a year. It doesn't mean that they are delaying whatever. So that statement doesn't make sense to me at all. It doesn't make sense. Whoever wrote that statement doesn't even understand the hospital system. Or a farmer resident. What kind of life is that? Meanwhile, you are called to be started when you are told about the young statement. Sunday, no, you are going for and then right man before to call. And then you are going and the hospital director. What delay? Now what banner a month for yari that who can a fracture base of scar near Fenda. Yes, we are the passing one. No, you know how I can say the system delay. What kind of delay? There was no such delay. They went strictly by the lay down protocol. And then just tell Ralph now that's the teacher. Obviously, a fracture based scar near Fenda. What's your name? Then they use the minister. I think what is even more annoying is what the minister did. His statements run contrary to his posture. Rap now, or not body and phone, look at the pictures on social media. He affectionately embraced the rap guy, somebody who has been fingered as the perpetrator of that in your crime. You embraced him, and then the guy whispered into his ear, then he was smiling. Whether it was setting or whatever, how did the guy go to know that the minister had come there? Oh, rush about immediately.
Yeah, Doc, I get your point, but
So listen. Doctor Michiapa, next time me preview pictures with, but me you know me update no. Me ba live watch it. Odi yen kasa. Because story no air trend is you need probably be aware of this issue. Doctor Michiao. So the point is say, in as much as say young microphone be no and get the right thing no. We also yes citizens we need to do the right thing. Me say me pe one country I be catch me say we walking through the health facility no or any country. We call ya ni ahwe. Udu wa say me pa to mi wo mo me hwe me no ma ba be hwe but one country crash me apart from say officer we yare ofi a obefa ambulance and so obefa 911 tie me eye no na se esua na de a raf koye ye no eye ade a wo destroy the system. In fact why expose nipa bi privacy e hospital wo kra senke ye country bi a motete so no a anka lawsuit e de a kire ba minister no de wakotena wo cheche ne pa no anka lawsuit e de a kire ba tie de me gwe enka ye koko obi beti koko wo ho and na se esua say your country bia enka bi be hedai obi betwa ebetwa abe wo ho because owie ya obeka ko video no why exposing the privacy sanity yensua nyansa mfiri niam bebre mu otiase yensua nyansa mfiri niam be emotions yemfa nyade yemfa emotions nyade sabo abrante na ade a wo ye na etai ade a rafo no wo ye na etai minim ni kind of a new power when you went just so courage you are rather destroying the system. This guy rather destroying the system and want me you do any resource. It would hear a doctor ya was say a dear minister no koye and crown south a any time kra secretary na or kasama Ghana register and midwives council. What would you cry? Because the minister no so the okojina say minister onik any capacity. Just political, boot licking kiss my ass niema tantani bi no ye no. Because you are saying say any pebe side and we should find them. Wanimu ho any nipa na green leader no e baaye na o chia no ha ge no. Just a wu you mahi. So now, almost 48 hours. So ma arrest Ralph no now they'll give them the showdown. Send your panel. Jack, one professionals who you can intimidate them. After maybe you know, not individuals be innocent, no more by so far. Other than by way and confer a reacted to my ban, or my braining minimum question, sir. Now when you be no NDC need to be causing be Raphael, yeah, he's fighting for the system. The guys rather destroying the system. A uncivilized way, no, you know. And I'm able to say, we NDC now the any country. Tell me, say, oh, walk it through any health facility. Udru ha say me na me ya hwan e na me ya de ni maba mo nhwa me na me yu ne nhwe so obetimi amisbehave wo ha ne nhwa de ada ne yedi nsamfon sa e na nurse ni nye e na nurse 40 say uro hospital unim nurse ni no ogina ho no ni capacity kura. Do you know say enye nurse ni bia na udru ha obe so patient? Would you know that? We don't know. We don't want to learn. Yet the emotions and solve problems in this country are very sad. And yet so to say eti yentiase ni yensua say health workers no amowo facility ho no enye case ba ya no mu ba be so yenye ne saa na wo de busa ho say accident case bi aba doctor in charge e ma ho na nurse ni ko ho na BBC a wo ka say doctor no be defend nurse na na omadwum no omunye ne saa. So that's why nurses operate with what? Instructions. Nurses operate with instructions. Sanity suya sade no yengina first no bia wo di emotion but and then no ukura smartphone te say wonya smart kra na use your smartphone and find out. I had the reason so your friend what this year ba Yet asemi entenipa. Dear Rafu ye you know, we the people no as ye catcher and say enough is na anya sa ebeto to aso afebo say nurse for no they will run for their life. They will go for safety. Afi ade so mo ye kro mo nye. I said doctor say yes. Also I had an accident and I was diagnosed of concision traumatic brain injury with it, even with it. Now, a doctor or trust him to us or tribute to us that was not triage as minor. Yes, now say Doctor Triage, you say even though say yeah, koye surgery in Saniama, or we have the answer say cry. Just say you have to stay calm and be the lane. QSO this all. Jack, yes, I'm with it, and then you pick a request on. Na mintie bi say aya no mo say na abruche de udru ade abehwe and na de de ade arafu ya mafo be so justify yempene country ni enim bebre so doctor boko de
Reason, Bachoboko, I don't know my signal no strength.
I'm sure was all right, but I still now work about yentiwa.
Yeah, I think it's the first time I make issue with because when it came and I was like, let's wait for a statement from the Ministry of Health and the Ghana National Medical Council and whatsoever. Now, I'm saying whenever you begin to speak the truth, people might think that you are being political or you are being
as usual.
So I decided to keep mute on it. I think the incident that happened at the hospital from both sides, is unacceptable. Or moreover, looking at the bone of contention, which is in Raf, I felt to say he overreacted and most of the things went wrong, which he needs to accept it. Sebi, in as much as your system no a year you might say obi minds then we need to also learn the system, how the system operates and how the system works. UK na memewo. Irrespective of now free rubbish for mama spinal cord mo bubu ama bema okusuo mo apai kra na. It is first come first serve. Moreover, even first come first serve is based on the severity of the incident. Me accident on the 6th of September 2024. And after I had the accident, it was very terrible. And that was the first time a Bruni doctor. It was sorry because I know upon looking at car, it tells you how severe the accident was. Even with that, I was diagnosed of concussion and traumatic brain injury because at that moment, according to my wife, na menkai me date of birth. Menkai. Omu bisa masema maternity say brain dead, Even on that aspect of it,
Doc me ba I want to I will say the dog who can send request na yemusa exact hospital wo you ka wo dru ha na ya na wo do na ye send request na bra why
me patron ka metimi akasa ka kra
doctor na akasa oy ma patron nya bote yama doctor make point na why o make point na afi wabem I want to send request na bra why misinformation am that Ghana phone. Doctor Kasana Mitio.
So I went to Salisbury Hospital. I'm giving you the facts and you can check. But I went to the Salisbury Hospital on the 6th of January 2024. When I went there, upon clearly seeing, say, so when I had the accident, because of adrenaline, my adrenaline was high. So when they came to check up on me, I was fine. My pulses, everything was fine. It was when I went home. Miku Jarena, my wife, is a mujafu hunimoba. Okay, that means either I was having internal bleeding, I was having a head injury.
Okay.
Quickly, they rushed me. And at the hospital, they could see clearly the blood coming from my nose and stuff. According to my wife, and my date of birth, even it took them about 25 to 30 minutes. Because the nurse said they are treating series of emergency cases.
Okay.
Hence, he should keep an eye on me.
Okay.
If the situation is getting worse. There's a door bell be on pressing. Much what you're saying. At that moment, my wife was furious. I understood it. And
Yeah.
I think so on that
Normal.
point, that is where Ralph also acted. My wife was furious, but the person she went with, no, calm her and said, no, my dear, and there's nothing they can do. Because also cry oba and I'm pounds no being so to one the three more pipe. And you know, yent minka say and you know, ukuni nya beman chenobia. Someone advised her. She kept her nerves, although Nikunu was situation. So all of a sudden, Nanka may you your phone. Means may you answer your phone. Now video.
No screen, no be video.
No open video. No, at that moment, you know, it is a total breach of privacy. It is a total breach of privacy. We are all learned. There's something called the General Data Protection Regulation, GDPR. Unimwa koko ready. In the whole world, untimi nyesadi you know. Mobekaya COVID by you know. Some people took that opportunity, went to certain hospital in the UK, trying to video say the hospital have become ghost towns. Some also videoed about neglect and for Ecoso Hospital from their point of view. Later, the Ministry of Health came and condemned all those videos and asked Ecoso. Why? Because we will to you at any point in time. I understand Ralph's situation because one on one emoji pramono, adrenaline and costro. Probably he's quite nervous. He has also seen people almost so but if you don't control that nerves, you know, at that moment, you will overreact. Hence, and more action be a person take it they go wrong. We've seen people who have secretly videoed people, but you don't see them coming out. They go through the right channel. In as much as we want Ghana to be like Abrocheno, we also have to learn how they also do their things. Because if there is delay of medical attention, I think it needs to be reasonable. Why there is a delay on the reasonable, your friend said. But could be I'm sure you know, I think say will be a better ambulance in is honum or say for about 30 minutes or so. Paramedics back say before the person is taken from the VA all the way to the A&E, you know, they try to stabilize the person's condition before getting to the A&E. So who knows? Depending on that A&E or that ambulance anymore. Who knows at that moment he has been stabilized with that ambulance anymore. And we all have witnessed it. It's me kofo be wow. They didn't be do hospital and they say an adna man for name and so not that or that anymore.
Okay.
Yeah. But who knows? Say it had been stabilized. You know, say Kobase you could see said now explanations if free hospitals ho Nano is more or less like trying to counter what Ralph did. If I think, say, after taking these videos and Ankoye there, there could have been right channels, these things could have been solved rather than the friend say, na ekosono. And I think so. Anna, my explanation be if it is true, yeah, they were saying, say, it was based on the triage systems now. Omoyede, Omowo, Ewu Kruman. Which I understand the triage system where sometimes it's being categorized. Your friend is saying, you'll be a more friend A, B, C, D, where all condition now, what you say is serious, you know. Obidia
crash, no.
So, no, the your battery as D. Maybe a old dear now, you buy at that time, you know, nay, D, no. I die, you bet me a movie I could see. I think that for one more explanation, on the buy, they are trying to use their medical condition to, you know, undermine whatever you did, you know. Sometimes the boss say now one control emotions are. Okay, yeah. Remember, they can say most of they are professional bodies.
Yeah.
It is when they judge and lawyer in your same. But we are win that because
Obiat in a drum brofo.
What's in a drum brofo or in a drum brofo by you. And the young friends see dear kakra.
That's right.
Dear Esino. Who got to be also pay means, with the best why because boys in a rural hospital, no. Menya sure say omo so ba ho bia no mo jeji na ho no, they were patients. They were not. They were not patient. And the hospital is for patients. And met me aka say wa ye bra na no se meboa no ukọ A&E a eye either wo na wo the patient ni ba any pen wo access to it. You be catch you be catch you. Eye wo na wo the patient ni ba any pe and e kọ A&E. Any
In
other
fact, comment search ni probably even UK baby away. Yes, one can walk you through A&E hona. You can spend no less than 3 hours.
Yeah, there 3 hours. Minia, me say me ba ko bo man ko to ni namu fitiri yeah. A feature hono. It took us 6 hours 45 minutes.
Look at that.
They are not more yani ice pack. That is why people are saying, especially UK's health system is shit. Especially if you're using the NHS now. You can spend, me say, Minia, carpenter ni bi ye juma na nsa paye. Moje bramno. It take more than 3 hours to be seen at the A&E. Salisbury Hospital. Salisbury. And yes, I may chant true. Mrs. Salisbury Hospital. I was southwest of England. Birmingham Hospital, Queen Elizabeth Hospital, that meaning we come also. One of the biggest hospitals. Oh, Birmingham, yeah. Obinya acute liver function. A diagnosis of acute liver function. Or more transfer nipa from Northampton all the way to Birmingham to meet a specialist. The reason in the ambulance, I was spending more than 4 hours in the ambulance before he was taken to the ward.
Wow, sure.
At that time, my Bible I was like, health system, man, all that they said was the person was stabilized on the way coming. Because ambulance, on paramedics, remember the ambulance is more or less like a mini hospital on its own, providing a first aid, a certain level of first aid. And Sunday didn't drew A&E no was stabilized on. Until expire that means that the condition is very terrible. It is all got to be the ambulance no see more. Sometimes think about it. Okay, then what is the purpose of the ambulance? And the ambulance in here say
okay, Doc, me that's one. My entire union be more outside around the world and why? What they just so we never be down my wife. Right. Bevelin, we didn't Bevelin on. I mean, and come here, dear, no, education room, emotions room, but now yeah, watching as you be from me. Mammy has no situation if I.
Me pacho mate. There may person be so me track across say. And some miss UK a doctor canning in cause and na me sister yare kakra. Or yare no. Me na me wo fie. Or yare no a oda ho no. Omu bisa or no or yare no oda ho no kra ni date of birth ni ade ono no ontimi pega ne mumpo. Ni e bisa no ntimi kra me bufu yi kakra. Am say na ya free ambulance or say ya free ambulance e bawo. But omu bisa no mu bisa questions no mu bisa and what you saying and fana to her na ye ni say na ntimi kra me bu befu say I mean your doctor and I mean your nurse most me fana to her I mean your ebesi de na maye me nya sabi o yale what you say sabi na o yare kakra wonya your front na your front say o fie na emoji tu no enye easy asu no mu bisa no ti me kwa na me the telephone almost say bisa no say ni date of birth on one eso can be o.
That's right.
On one eso can be it is something in the doctor born a tougher
and him what the entire medical practitioners a person information no we say aduma no moye no most of times no emra kan hu it is ya dey am nya some information because there's cameras
ono ko ebetimi ayin adi
what you say it is as na court on be video ni say patient na dey kan we kire ye that's why every time we prefer sound information no so secure no is that one from us here obeka so na dey no push we
yes
me am for funny
odo me say me ebi wo kwa me beat questions ni bi wa me timi bi say na e dey no be so mu bi say because o ma adwuma wanya wo ni pakwa no kwa wo duty no wo mfa ho kwa ye betimi yi wadi
oh yeah
what you say tati Assembly nyina no doctor beka ni nyina nanka me pesa me beka sa but
It's UK hono enye no kure say uduru hospital na doctor ya nurse ni ya ban
Reason.
enye no kure sa
enye no
Reason.
presa ye beje u date of birth
Reason one who photo that be there
appointment
when now situation in your own doctor
Reason me koda who say no. My wife catch me say me da who say ya more than 3 hours na doctor be and nurse be am me.
What the ha 3 hours say the situation ya that way. Wow.
I'm telling me I swear on my steer enemy man me can wasem.
Wow.
Me da who say
Beverly Kafra, and na say 3 hours now.
So my wife was worried at that time.
Okay.
With the horse, no be a man in chain. You can, as you can see, no say na me da home. I think the young friends won't see me so all that they did the other year. Later on, no make sure said they wanted to stabilize me neck.
yes yeah no there no correct
Na ebia na you udine say tricolo was say asking the patient info is better than card wa hwu brofo na won ti ase na card no info no what is the difference brofo na won ti ana
em so won ti ase
brofo na won ti ase na say
Reason.
your date of birth and whatever
ase
they wanted me pacho sister me ba
reason me pacho
they wanted a picture.
Yo Beverly okay me da say why ya no asaba me da say doctor for the who can see yan person as well.
Yeah, they wanted the condition of accident, the impact, you know. They wanted to see say if it was a 100% collision, and I be a 50%. Now, I want me phone so.
I don't know my wife say me like understanding what send request bra na e be lecture me na me tie the work and say wetin be team intelligence na why I say na yesua de why doctor kasa na
no de wo hu TV so and no oka
yeah
de wo hu TV
you can say
reason binti obetter trust say you lack understanding
so reason what they said they say they wanted to assess your friend is say the impact because say any ambulance they me buy they don't have proper records.
Okay.
But you tell me me catch my wife money they me call because of not me bleeding. And they wanted to see the impact whether it was 100% head-on collision and I say 50% maybe a car in chain baby to assess me injury na me because at that time I might be suffering from a friend is saying internal bleeding. Now, more per me phone password, my wife need me password.
Okay.
Until some my wife the password me more no, they cannot move on. It's there some my wife friend me ba na me ban so try figure no mo kai say me password and them phone so that time in date of birth. That was when after that you know, omo assessment be break koso yeah na ye medical fields.
And no be na ye for the year say omo ye lazy, omo ye hwan
lazy.
I mean, we the people, you have a problem. In fact, this country, you have a problem. Yantias, yes, sir. Dog, me da se wuri gina ham. Meba, nana kwadwo, nana.
Yeah,
I want to ya. I'm so about to nana kwadwo. My yama kwadwo why? Yanya frek why? Aha. Nana kwadwo.
Yeah,
between Ralph and the hospital, no, or case, no, send out a very case.
Me usta na me usta. I think last week, I think I made the mother Echo Hospital. Na ye di can booking no because nine. Now when you say answer na me den Echo Hospital no, me catch the man. I was say yam kwai na me say ye kwai be to was kwadwo. I was say me di can bookie answer be. To me the ice block at to 29 so almost 1 week. I'm a bookie answer na ye de me mama Echo me de me mama Echo Hospital. Na unim bibi mama e catch us say wo hospital e wo abrochi US na so wo fiti ya wo ya na e hwe omo ya trofo omo boa omo kan bro omo kan
no omo na Ghana for
sa omo ya trofo na obeka ya Sarafi na omo yes face the country ko see barrier wo kwam ambulance di obi besin a Rafi ka say Ghana for jimi for ebi wu a na ye den the same Saraf saga
emwa we
Ghana form wa we na saga na me saga we minim no odunkwa oye jimi wodunkwa one ba ko bi ka ho one NDC ni guy bi odunkwa ono so ye friend nat sa nat ne so ko odunkwa government hospital e ko say niema was time NDC winning election e wo Ghana Enti Saraf we onye nipa bia na NDC fo na so ne so ama na di san kwase asem we o de freedom kwa o o de freedom kwa o ena odi edi na mu ana sa party na ne party a obe join eno ne party obe join o mo be so no so ama na di nkwase asem because MPP fo will not tolerate such
sa video na wo ka no yentie
Mon fancha me Ralph no Ghana mwa bebrebe we
ore kasa me kasa na me fa original voice number me ni ore kasa
me say obi catch o say oba abrochire ha na say wo fiti ya say wo call hospital na wo call hospital na say wo call ya ye behwe wa oboa at least we say utimi book an appointment say either say 3 days 4 days 1 week near the be ma ansa na obekọ hospital ama unless say emergency wo the ambulance na call ya then they will treat you enti so bi catch o say na de oye na right enti say onipa bi wo honoma on person bi behu ana say nipa bi wo honoma afi na doctors na stabilizing or relaxing wakoye sa de we ya ebe ha na how will you know ofiti ya no waso
kan say yegyina no yegyina na nipadodo na da so that I mean I keep thinking say you dream said that we do hospital na nurse ni Ghana ni nurse no ese obeye wa to no wa sia
sebe abodam sem
you kra smartphone today no first no last 30 years no obetu di sansen phone no what justify by then untimi justify and nurse ni bi ogina obi na ese
utimi kosi barrier wo kwam ka che ni pase ye de obi ko hospital na Ghana fo mwa we ebi wu ana ye de na wo chen sa emwa na wo chen sa mwa na wo say sa time nipa na wo so mo ye mwa no wo sa boy we wo chen sa ankrofo no wu ana ye de na onim say sa ebre bi Sam George enso koye de say okoye sa niam we bi ema your friend say doctor insiasa rekache ne say omompa ye no wanyare anko hospital
okay
na sa boy we na me ye Ghana doctors and me nurses ka mompa ye say sa boy we won yare no waba hospital because oba hospital mutimi ja de kwan because nipa jimi fo say eni kwan so otene nipa utimi bi wa no ka kire Ghana fo say nipa mmoa we bi wu ana ye de wo ye nipa chen sebe omo a wo hwe sama mo ye sam fix the country no omo mo wu ye no na onim say sada no nipa be 4 say 5 ne wu ye sada no mo ye no Sabari no omo fix the country no musu nipa more than 4 say 5 ne wu ye
say up or I once one year political campaign any
that time no be any say guy we fight for
omo win the encourage
na me start time omo yes ade we na say na mo sa boy we mo nim boy we wodu nipa jimi nipa wa bodam from dunkwa we na mo ye the hero guy we boy we me say okodunkwa sector me radina
and oh yeah enipa nurse for prepare omo ko prepare omo nyina bi na omo de abeto no omo sa omo ko prepare nurse for nyina bi na woni maso oka che nurse for say bibi to no a omo be sra omo be kwa sra omo anadwo and where this where nurse a threatening omo life
exactly
na yete ho ade arafo why freedom fighter
no say bibi to on what for
for na brabo na te what me freedom sa akoyi
because you useless guy
rubbish
onye ni papa woni aim na sebe bodamfo bi no ne namu anu wa be people enti wono wo say life kwa sa lifestyle na odi freedom kwa na no odi abepie nkran
okay
tema mo bi ka bi
wa da say ayi wa ha abontu ya wo ho
no, I
mean, you can udru na nurse for na abe so many area.
Oh, David, you can no is ona ojima no kusi boni.
Okay, mami nti wana.
It is not true no. I was talking about the minister no react na me ka say this how baby. I said the baby change. Say the life no be akita ne de ba. It is a wo bana wo minister, ona president kura na say enye protocol maybe the president into near be work to honor yeah ba show other thing also some because by nature no be our life one life to live it is a do be so near premier because we are president and kwa nya ba ko na wona ni wo ba go someone say any bbm any ato abama no aba betira o ti dey mention ba ni me kan say ha no wo be buku as Yeah. No can on the enemy can say, Sunday, Ghana, ye raise your only post. Open chair will be our assassin with you. Now, appointment in a winner, and so we are to a bar, my party, and Cabina. Say, anybody more can say, you don't know go to your police news is ready every month.
I want to never say that. Not
Again, the
for
same
police.
person. Now, say, excuse me, say, NBC, na say, the also talk about some personality we are the year man. Obi on farm right here, man. Your name is Ebu Oman. MAE. Then you must say this was out here. And can see a look at the one he can pass as I say, almost pay to me, come what me. Oh, my Yapra, say, was say, almost sacrificing the power, almost sacrificing the attitude. I will be playgrounds are going to see, I've been a wusu. And now, present a go. Almost as a good water didn't go for gold. Almost your 2 go for the wusu. Oh, what be chow. Sometimes the Kasa and fair Casabi, and we are pretty for among them. About one I am born. 7 years, your friends are caught on the budget, and said the uncle. Nayana, what would go with the politicians letting the Brennan who use your tea?
Okay.
Politics no more, you know, who did you Madame and an immediate politics no. I see a look at the animal of your campaign.
And I mean, you stay or focus on, you say you're educating, especially. Ayana, but I have no fear woman is a cool me Makotu Nigeria ni Maya near the war Birmingham. That I mean by Liverpool and Copa. In Bahar 29, no carries about 31st. We see Liverpool because could be 31st asset, but you can't start. That I mean, you to Birmingham, the Metropolitan Hospital, and you did 2 years. Name me no Baku, Manchester, and Baku, a call Nigeria, December. Ye, no, I'm coffee, cotton, your money, near the man. They buy Liverpool and call 31st, and I'm going to be uncle. On the 1st February, my friend or fat. And I'm supposed to be a colleague girlfriend. And on the 2nd, and I'm sure we'll call for her. Say, I didn't think I'm a friend of a man message of a McCoy, what's in him paying you. And I'm called 2 months, I may have almost real ambulance. About a fan. Yeah, Nabuja, okay, it's a Nabuja, or when you're Nabuja, or when you're Nabuja, because they follow that day, and I know, say, and come back. And to me, I'm the following day, and I'll back to Liverpool. Say, I see the CNC, no, be because the money you know be in check and then you be on any all land in Casaro studio. Our system is a Ghana. Wow, we can say another Africa, we can say minimum more money access, no many bush for Casa. Send a police and also check room near Momona, or say, or many records from what we bush. They up to date to be answer washing. Okay, our system was said you're more canon, and yet as easy as it is. Well, Buku Adiana, and yet emergency and accident. Okay.
Take it almost 3 months. What they're supposed to give me and family, and they're gonna quite full of Ghana. Doctor, you bet we have an officer here. After I'm one package. I have overfollow protocol.
Okay.
Engineers are there, they are not making one thing in my city.
Matuasi, I want you, you know, some baby from Bon, baby, situation, you know, dear Ralph, yeah, necessary, and I said Ralph, and I said, man.
Me America.
Okay.
Nah, I'm say 2-3 years ago, Mrs. Tabapu 19 years. Yeah, on to can koto. And you may be run. Within 5 minutes, the answer call, Pampa Madea, when you accident. Nemo must wait shot. No more japa. Ambulance. Pooh, you didn't call hospital. You could do 8 o'clock in the nurses and doctors ban on now about 2 a.m. And you'll be the video be rough video need to YouTube. And like I say, Ghana nurses, Nyansa a friend in Nyansa, or Munibi, any doctors. Say emergency about no Mujina ho, will be ahead. And I'm a true comment and I say, they should come to America and see. My nephew didn't call hospital. Then no more switch 8 p.m. you drew home. Nurses and doctors be 2 a.m. abrante ne moje tunama ni shirt ehye na afọ yeyi ye de fufra hye no
enti
afọ
wo wadwene mu de nka wo sususe ka muduru ho na nanka ya be fa no na ya hwe no nanka wakofie ntem desa
perfect but our man is sad because ye koye no ye hwe ho no enema asisi ho no kwa ye de nkra na ye kitikiti bi
okay
emergency se ho na ye de ndi esu akra obi nan ni dompe na pie wo soro accident
kaish
obi ko saa niema no mo hwa o mo hunu se saa niema ni mo more ehia attention more than ye de na ye de aba no enti bibi wo hon ma de rafo yen in a way sometimes no oboa ama sanity aba krom in a way but onya botre ebu ho ya ne kwa so ano bo digidi e be revre no aye jimini sabi o na djuma no aye na aye kwase adwuma
na mo no se bibi nkoyi a mutimi fa phone na ma video bia o bia de abeto abonte ana
emergency kwana no kra wontumi nwuram
emergency kwana no okra wontumi nwuram ho
wontumi nwuram udru point bia e beka chese stay back ni ade ne ko ye hia information bia na o ma frɛ no maga chese we need the person's name, the person date of birth, blah blah blah, address and so forth and so forth. Now, you provide it. Ebia ni kunu wo ho, ni ba wo ho, ni nua wo ho, ni re wo ho, ni girlfriend, boyfriend wo ho. Somebody who is close to that person. Na yaji information. But untumi monwrem na nka police mbeso a wonko tu ma wonko dem be 10 years.
Enti sa wo hwe a whole regional hospital, rich hospital na manantie ne we dimirika wura ha na camera di ha.
The reason the American say your hospitals no security any your friend is saying a police for you may more year one and you're very weak, very weak. A whole big institution, big hospital like this, security be a new kwana no
country
security be a police back say any kwana no crawl be check it stop it sa boys no mu borom na sebi obi ba no yes so agitated no treat you and a bru and can you ever can say ABS no ha
no afi say ye na ye to nwom ye ni be susie
me come aka be 5 steps am ye drew more ni sa pepe agreement say ya eni patre ho na pom omo ohon ye dimrika ne san ye ti ba fi enti ne ma bi wo hon ma de o ye ne kwa so ano no ba se wanfa nyansa sabio onfa nchami wanfa nyansa nto anfa nyeni
so that boy no Ralph no or you the right thing in the wrong way or
perfect
he's doing the right thing in the wrong way
wanfa nyansa wanya wako na se mi hwe video bi oni na market ni mu ni street ni mu obi ato anunsu ato bottle oso bottle nkra nya ono nanum eda ba bi na wafa e na lady kasa nya maame no na eka wujimi ababo waso babu sisi a why what right do you have
now abu obi now we
because your party is
in say case ni na say wo kobu obi I mean say what say case ni kra
because his party is in power me papa ye NDC ni me na me NDC ni me papa standing for member of parliament e wo ye krom Odotobri constituency one Amasia Central at a meal's time me papa ko standi e ma me no ko campaign to me ni jina stage so e kasa ye e convincing ko for so monto ma me papa but e bedum NDC form me papa abokokra oyare oti hu ichel mi bisa se NDC ni be na hwehwe papa no
I be omo pe wa wo ye be mo ye to nka politics dem
Ghana no wa hwehwe no
omo fa ho be
obi no wa hwehwe no ya ye bibi a wo bia ya politicize me na me teacher ni bako chese bibi wo hono mo a me ye teacher ni no eye but obi otenchen NDC ni otenchen me hu say MPP aban ana hwan aban enti de ekọ ninye meanwhile to ade na ekọ so it's for the benefit of everybody verification by me can to say of street so you will see no child on the street selling first no bo hu obi ana bibi suje no ogina kwam PK not on one free education by me hu akole house help kra na hu de ti ebenya bi obi akoso
and Ghana for the papa party NDC for na be the free SHS kwa ya de boni bi eti o ya de 100% ne mu 80% ye ya e fa na enye pass o one go school a 100 80 over 100 was one pass e hwan ya amame ye go school no say ye go school see ye market results na exams ba na 80 over 100 on pass e
what pass when
that's right it is a
A
free sectors and you pardon one to me go school na say e mu kakra bi entimi ye anya ni ya na ya politicizing say as the boni bia
the
ye bi da
reason akola bi no my class me chere na de ni din e kwa kwa fa so twa ba St. Louis me huda ni din kro ntumi ntro ya try exams kro na on copy obi de no de no ahwe ti no atro h no ahwe no atro e no ahwe no atro so be read the whole sentence egu ni tim de atro no nyin but obe wie school no she became a very polished beautiful young lady.
Okay, but I say,
She
we focus now. Mean
omonya aketesia wo mfie enti raf na adwuma na oye no
right.
nyansa kwa onfe nyansa nto ho fanye na abrochire hospital no o ma ha emma because say 5 minutes ya show 1 hour ya show Ghana body omo ya de unwe tuwa 50 minutes
right
Ghana hospital omo ya de 30 minutes no be show 45 minutes
omo ya de pa ai omo ya de
pa
ya said that civilians no ya said that ni ma yes ya
yeah bomb abaso pa o my idea
that's right
but ekroma America ha
right I mama da say wo de gina so mama ba gina so ayi wo ho say quiz okay disappoint
to me
disappoint ya mama nti boko de
nyame adom
na kwa be dia kwhye ho
Yewum. I don't know doctor.
Kwa be dia ko champion man.
That's all say ye ba ye ni na mu ni ade
wa ye de wa ya de but
Lumba hoy ni mpanifo nyina wa
ya de new force eno ano no ebrepa ho kwadwofo system ebrepa ho ma obi a so ebefa kakra and this NPP for my Jackie country until said baby adun de we there.
The reason asem yi a obi a means nyame adum US ha also ya can experience. The difference about that day we mun say it comes back to systems. Reason my men can cruncher say the rafu air de bia to say the mamene can or the emotions and some kind of a personal lifestyle we won't mean say obi na share na you no they said obi ka say onim no some he no
obi so onim no dun kwa ba bi kura
correct any trait
we hear your sansem fun
correct any trait and any trait no so no we be hu say system no eso so side so coming to politicians say oh yes side we na ye betagi so ye NDC ni a problem ba NDC for beba begina wachi is the system and the asset is our precedence we are to o dey ma men confirmation say wo dey ye NDC ni MPP asem o ye hwe say MPP fo ya so mo kokka ansem ye chi o mo yi se fanti comedy se hwan ye chi ni ye ja ni wo dey politicians na chechire ni ye you hwe ye yi no wa beti sem a woka so what tin sem a woka
o se dey
body no say owo ho no kra no ye man VIP treatment ye man some burger be ye man chicken and chips okoda air condition
me customer on
that is it you know it's more to people out there say all you have to do is align yourself with some politician and do whatever you can. I'm telling you this Ralph Ade a ordinary person be na nkazongo boy be na ye we no be anim na affiliation picking it dada. But because of our affiliation no we've seen them with these men no nothing will happen. That come back to the system I can say abrochi. O corner say even o grievances cry the hospital have a way I be approach you omo. There's no way say abrochi wa kwa wunya grievances. The system ne yadwuma nurses wo ho yadwuma so still obetumi akọ me call me nya trauma sa ma de atwa me sa ma de hospital. Me call ye no can you imagine say ye de obi aba all ye ne practicals that week you know ono ne ba ne be pam me sa. Reason I'm telling you this thing.
Whoa.
Akwa me say makwa emergency. That day no ye di obi aba na we amfa anya practicals e be dey no so atumi asua bibi ye di obi a oye ne clinicals be pam mensa later no I have to now file a case against and sign on me this explanation say it was unfortunate na emergency and they needed somebody to take care of me at that time no that's where nana because on call hospital any pe to that ono aye ready say omo tena hospital Ebi ni host and by sir. But me come back to system. Ya lani yempeni no di abata ye ho. And anything that we are doing, we nim say ya Ralph or ya deal we from opposition. Ya chini biya penny no sa time na this in the opposition. They find lawyers to go and find ways and means to take him out. And nana ono na ba na de no besru. That is how
I mean this is see this is funny. Say mabaya bano ebese ni mabebre o. Sorry, me MPP nintino MPP aba me kodin semfo. Na ne me gum ye aguma ban na mu ase ana say. Me ye sure say me pa ban na sem de.
Intina make sure say omo opposition kra no they were able to do it inti there na kira say na ban ba obesuro bibi.
Obesuro bibi.
Obesuro she. Boys you no mu call ye say ye inti that is why me Tigana make us me align me ho. I can support whatever I want to support, but I say me demonstration na makojina me koye we no way because obi a wu nim ne direct na bibi ni obeba begina mama no sa na asifo ye bo o mo ye prepare o ma enkosi hwi o mo be fa kire me na me ye dwon multimedia ye media man I MPP time circle o mo koye demonstration ye bo no be see the guy cannot work or da ho ofie so these things has been happening enye ne. People align themselves with parties.
Very terrible.
They align themselves with parties and they will continue to do this. It's about system. Senka system bi wo ho. Ade wo koye ye hia minister bia ye hia we bia no an say CIA, FBI, BNI, me akofa. But this time no county police kro no ya report o if you now ya be found that. And you have to be social media. So that comes back to systems until our system change. And politicians will continue to manipulate the system because a be favor they want people to be on the street to do their bid. And no nema rough any other people will continue to do. And no nema fancy comedy any other people will continue to do because women say hey, no matter what, the party opposition, the party of power, whatever they do, they will have people that will come back. I feel sorry for the nurses and other people because civil servant to Ghana and Africa there it's like sometimes we catch you say unya kwanya now they will fame because nothing you will do there. That's it. Okay. That's how the whole thing is.
Right. Medase odi jina so mame medase. Are you ho? Say kwejo ho.
Yes boss, me pa cho me wa say.
Aha, boko.
Nyame adomo na mo so e.
Na o che ya no mo Rafa de okoye ya se bi wa ya de won fight for the system. Minim say good work country for so a. Udu hospital a hu nurse ni bia na obesa ya de ana.
Me pa cho there be nye sanity.
Na de me wo US. Ye Ghana na manfo pese wo twa sa atoro ni ntino. Ene boy na ya de. Ade ya boy ni ye wa ya de.
Ene kwa won se wuntu kwan a hu se de tie. Me ankasa me victim say me wo US won. Na me fi Ghana be dru US no. Aja guy maroro me ho an awo wura me mu. Na just me ho me ensiso.
Okay.
Me ho me ensiso. Make quickly I just said me call emergency. You find a Win hospital. Okay. Emergency one me call no. Na kam expect this at least en ka bia me ho me ensiso de en ka me dru na nka omfa nso kura nsi me so na so mo be kura keke. Na so leave. Hwe no kwanya me anim ni. Na me we nga Ghana nka o ma hwe me. Asma me kan say we nga Ghana nka o ma hwe me. Messi me tenase more than 3 hours. Na friend me say Mr. say na one na eba be hwe me. One na eba. We eba no be taking vitals no ko. We eba no just say after more than 2 hours after obi ansi ho bi o. I'm sure we den ka Ghana e fa better o. But just say Ghana no ye ni
so we say nke Ghana anka obe o say ka obe ye o na se fo kura se fo e no mo fa me ho enyo sa na ye
my be kura penda. My be kura. Okay. Entino Kano. Rafa de na oye request all the so fight ma Ghanaians and also fight for Ghana youth and as Ghana in a whole nikwa na. O de yes no nya botre. Because say Kano. Oh. Enya sa na tell baby ah. Okay. Em ka me a victim. More than 3 hours no be am I. me both me so me sorry nko because me bre oh
Yeah.
that it enti ne ye be stress Ghana nurses ye be mo mabaso o adwuma pa amoye but sometimes you know ye o say before you do ho pa chan brofo no and I should studies ade no
That
be before you do ho chan brofo no
abro asam ododo no ka de bro ni de so ma de friend ododo ono de ya
oh say that
cross one cross no ano no
thank
confirm
you sanity enti no ye be say the rough yen wa anyade but opese enka won try bibi say at least or what mama Ghanaians na say Ghana youth no say bra at least we are nurse ni we are teacher ni we are any government worker na say adwuma bia mu bia wo de tima be de ebe ye adwuma no ni approach no anko yi but enka or fight the right course in the extreme why
right okay what just me ba be so assembly are you all
matter
awokra oh
Yeah, me wa hase.
awo
Yes.
minim sa wo ye kuro Ghana mu ana se wo kuro bia so am ba bia wo no nurse ni wo koya no wo hwe wo na se ye hafo nurse wo no mutiri mo den de rafo koyi
Yo, me pacho me da ase. We were US na. Nyame timi aka ne say it depending on situation out there ba. The obia or the ambulance beba no. Ambulance is the first and only the way would the call emergency room we have priority. Internet found also be in a car about emergency room. So for us, you are not breathing. Who bleeding profusely like mojano, they have to stop the bleeding. It depending on the severity of your case.
okay
Any the show.
okay
It's yes who do her first in intino. Yeah, barber show no. But it depended say ambulance 3 ba. Na baako ain't mean breathe here. They will start CPR right away.
okay
Se baako breathe na ono ni bleed ya. Ye besha nia on breathe in first. Na nia o bleed na ba. Na wo na wo ba ya o akoma yare no. Onso ya show. You get it. So it goes according to the severity of the case. And another thing that I wanted to also add and say, it also was systems and were laws and practice laws are a protected nurses, doctors, and at the same time protect who the patient. In the infant is what by emergency room. What by see I can't breathe any idea. They check your CO2 or ma check it who say oxygen level you okay. Because now you are stable. The fact is that we are stable, like you are stable. Me Fambra Ghana. Your nurses know they are doing the best that they can. However, Meka said my brother had had a good intention, but his strategy and his approach was wrong. One, nipa na no da hono. All bleeding, they came to stop the bleeding, right?
Yes.
Almost stop bleeding now. You are stable.
okay
Se wo buy na wuntumi home and now you needed CPR and no man CPR na wu da ho a. That's a different thing. Then that is a malpractice. The patient comes first. Show first.
that's right
And those are the things. And just as we are talking about, America and Crobia was before they take you a picture, you need to get consent. Won't to mean conquer for camera and conquer Jina hospital be and conquer nurses be they could sue you.
okay
But in Ghana, I think it's people have the mindset that nurses for yet or when you're caring or when you're waiting. He's trying to prove a point.
and
by going to show say
okay so emrano will be tested once will be tested yeah because say patient be sorry no pick us a video no tested law no who say loss
yes because when we some consent and some will charm me into the picture
yeah
what you see and also no oba no nipa ne da ho no no mete so mo kase no oni your friend is saying oni card and oni
I'm person information yeah
but that is where the problem comes because hospital ewa abrochira in so wo card uni card they would take care of you and then they would find ways you have to pay. There's a system to me kase because say nipa ni insurance intino the person should die. The person's life matters.
But okay, yes, I said me musa wasem patient bia you bet on ba admit no you taking patient vital ni data e hospital
Oh yeah, they have to take it because
okay, so what is the difference from Ghana for now? Let's use the word card. It's not the same information which they want to get before they admit you. Yes, I need the same thing.
Okay, let me give you an instance as well. Senipa ne ba no nye oye not responsive and I say ontumi nkasa. What are you going to do? Are you going to save the person and then get the information, or you're going to wait for the say obi nkonkofa information in Bransa?
Well, obi so confirm I say my say no see UK or any other country. Also just say they will make sure say the person others the person be casa or they will get the information from the next person.
So it boils down to the person have to be stabilized for you to get the information. Okay. You are not breathing out. How am I going to get the information from you if you are unconscious?
Okay. But on the report, I said they a group never say once you man information
okay, information what is the next step? Are we treating the person while we wait for it, or we are waiting for the documents before we treat the person?
But as I
so that is where the difference is. Severe. And then I make us say it depends on what you go to the hospital with.
So which means civilians, civilians, said the nurses and doctors, cases in yes,
Debbie,
exactly.
And yes, civilians, yes. And so doctor,
okay.
Yes.
Or pause, also maybe your heart. But check your blood pressure, no, we okay. On your debut, there's nothing that the person can do.
So with civilians, the emotion. If I say, no girlfriend or no boyfriend, and be an unconscious man, so now if you say, now pressure about, so if I say, be crowd bar, but doctor not necessarily buy, and over here, and who say, no, we'll be sustaining life for maybe 2 hours, 3 hours.
Thank you. It's in the war now, but on the medical side, dear, whatever he has to do to stabilize the patient, has been done and it's complete. And Adeba Konsua, the reason Mecca Ghana me who say a big problem, they say ye knew how to do your friend is saying emergency care, like CPR, like first aid care. We don't have that knowledge. As I say dear, every school, especially from JSS.
You are rather saying to the masses, not the health professionals, masses now working.
Masses, and even the health professionals, how to properly.
Slow down. Medical professionals now most of them cannot perform CPR.
May say proper CPR.
Oh, sir, proper no.
Yeah, chest compression. Oh, yeah, CPR. How many breaths to how many compressions? So obinya kata, the immediate thing is say to apply, pressure. So obi F go into seizure. Somebody, they will leave the person there, but sometimes you have to time it to know.
I'm a suspect to be a health professional. Now they're working. So colleagues in Ghana and him they working and who experience in that.
Me kase woman nim because me nim omo senya. I'm sure say a standard across board. But me say enye bibia like me who say guy obi catch the boy and say bieweni men kata weni no you have to check say is he go like or pass it out what is going on.
When the name must instructions
I don't know say na a doctor will say that because at the point on so jai no so pay.
Can is it going to be realistic say a doctor will just order and also obey question and obey instruct patient say be when you say just individuals on the
it could be say na individuals ni bi but say ni individual kra na ya to what extent and an individual ejina unstable patient
so that's the borders on security.
Just as me and say, who do emergency room honoma? If your case is severe now, more parents and I say whoever brought you, they will stand outside. You, the patient, will go in. Somebody will come and talk to you outside. Into no yama patient, no. What you say, they are doing their clinical, work. Omo ye de somo ye. Ombeba unche no because I say okay, patients ni say and then no somebody have to talk. you get it. Into no maybe the American say I wish to say we will learn certain things because me who say accident crazy Ghana and your accident be an ebesi ebe tam nipa ni cho de na kogu kan because the dim say you've broken a bone, maybe no you are suffocating on your blood. We don't know anything. Don't see as well. Then they walk that from the distance where do be feel to the time I do be hospital. But that crucial moment can kill you.
Baba unim.
The reason, but my main cancer can.
Abotre good abo. Mr. Why yema yenu aba naka waba why na wada ma esa na ya manya fet wo why wada the whole
na make us so Mr. If you are no can I see entry na person me chair ni say.
Ba ya che.
Sa
so ache pa.
Ai o de me ba memo achire good abo memo achire wo nya abotre ai
na make us so. You keep mentioning na make us.
Oh kafra yo hwana na person okasa.
Barbara.
You just want me ba. One say na ye nua ba na e ka bibi sa ono ye awo
Yeah.
There was a time na me was China. Na wo call mu schools na why week bia na ye kire mo twice. Ayi for ne ba Red Cross for no ma ba. Enkodan ke to albosi ya mo bia to na omo
Yes.
Akora ni so na ye decide idea ni share ni tiri mo.
Yes.
Eti ya kire wo mo sa no mo dia kodu middle school ho.
Yes. So, maminka one thing here, obi nya stroke. Na se wo onye allergic to aspirin. Minim se Ghana for bebre nim sa de we ya. Offer aspirin when onya sa we na it will reduce the severity of the stroke no. Enti no tem bi omo ka se udu certain age bia na wonya allergic to aspirin always bia take aspirin. Because a bois for your blood circulation here, they want and your man kitten be or a fear be a mono, as a set or beer to me who say, oh, fear now, papa in your stroker. What are you going to do? So, Nama Bontino be in your seizure. What are you going to do? So what you see, and this basic thing, just as you said, they said China no much romono. SSC started from school. In Kwalan kitten as I see they chair woman, send your beya by the time obedu set by the time obedu university no. Ojina Bontina so who so be ewo crisis more. Onimnia obeye.
Oh yes.
So what you
see. To be an crank and get to almost save colli or many free school, Omujina and Diagro and Corana. Almost save now, almost be performance.
Yes, and I mean, you have been a or you are not on blood thinner. For blood thinner. Now, when you're allergic to aspirin, as so be our aspirin when you fear, especially on penny for you need it because Nipani go into Nipani go into any heart way beer. That is what will save that person's life.
Okay, I would just I would just I mean, in depth analysis, you know, mommy. The roast, the roast. Not to say, I want to see a nurse of one year, one hospital, one found, or be a negligence, and now, or I behind, and now one more. Somebody now rough, I could distance and Funya and the Eka. Oh, you're rough here, you want to say.
Mimi Abema, Medawase, for the opportunity given. Share my nurse in New Ghana. My nurse in New Ghana, in Tinia Omokain. Makes me they were experience on whatever goes on in the hospital. I've been a nurse.
Ghana wanted to attempt on what community can you?
Oh, me the obedi matama and shana problem there.
Dear Rafi, nurse for the most one, and answer the BNC.
Asamba kwa meti me aka say omanya ye timu a ye politicize our education and health. The politicizing of the education sector and the health sector. And I'm away na etimiamba.
Wow.
So we ba brochure. Most of them now are brochure. Mrs. Tayoka, I believe she's a nurse. I understand her and I know whatever she's talking about. Say, oba brochure. Nurses womu categories. Sana Ghana nurses womu categories. A brochure ENT nurse and emergency unit. Say okobua. Say okoye juma wo emergency. It doesn't happen.
As a ENT no which one or mom shall son ni nyasa.
Any as a
Wominim ene wohinim.
Okay.
So
It is me about say Ghana ni no a oye ignorant wo hu so once wo say uniform no nko ano wo nim say nurse ni hu mi wan fi mi ene wa yi nani enso na ebi ko ye ENT ni
nurses no wo obia ne nadwuma ne amasa confusion yi nyina still yentimi ntwa so da e wo Ghana no eye say mimi madwen na me kire no because my adwuma wo remote area da.
Okay.
And say a no accident ba. Who general ward o maternity midwives. You will see the ENT nurse there. You see psychiatry nurse there. Everybody is coming on board to help.
Okay.
So what you say? Obie baba be somu na wa ye bi. Sa ye nyina ye nsom na ye nya no. Eno na ewura Ghana floating.
Oh.
Yes. Hospital na ewo ho na accident unit any some ward bi wo ho ma otimi say ebi wo ebedru awia kwa na ebi mu ho akire obi timi free ni unit na wa beboa ni nyina emra mu no etiamra.
Okay.
Asa wo kwa boa no mpo bi si a wo nurse ni no wo ho be kire but Ghana for nurses wo sa abadaye no
that soft heart no ono ankasa de na adwene bia be ka adwuma no.
Oh, mami mua at least me yi gos kra na ana me yi cotton kra na. So what you say?
Na me we dey me ntwa no na me tie guy bi am say no Ghana na abufuhyo si ya no de akotena because your friend papa nurse was say sometimes omo kra timi blood transfusion from one doctor nurses no no assist patient.
Nurses, especially nurses with blood group O positive and negative. Me colleague oba no you pregnant. Or donating the blood or O negative, or donating the blood, pregnant woman or donating the savvy will be.
Wow.
Wow, no so.
Hey, oh, hey, nurse for 1 year there.
Ebi muya niema bebre. Na chese, unse ye mu bebre so sebi. Menka se adwuma no mu ni. Eni enstra de honhom de. Eye su a ewo nipa mu dada.
Okay.
E na ode akọ school no. Odi akwaje ntete enti so obi ani nso ade a na odi akọ na adwuma mu a eno nko.
Okay.
Na mom adwuma ne yo no na wose ye ma yani Ghana fo ma yani kọ ho nurse fo ma yani kọ ho se nurse ni a owo ye me fa de se ba bia asem isi ye. How would you know say those because there were nurses I believe say no mo ye your friend is saying record nurses or whatever. Almost taking records and I say almost receptional nurses. But maybe they were thinking say I was so almost quiet say Juma.
Yeah, because we have video now. Right from where the camera see almost so which we don't know or more activity or more say they qualify to attend to the patient or what, but people are when they don't care.
Enti Ghana no me bra say e was mimi hu ni se ne wo say ye no say wo say ye man nurse ni bia eye na dwuma krata na ye wie school ye de ma ye wo kodi appointment ye de ma wo no na wo say nka ye hweso na ye de ye adwuma sa krata na wo so wo hweso na wo de ye adwuma so wo ye certificate nurse anka wo de ne so wo de ye koye procedure na wa hyehye enema no wo train so wudi na chi enema nkaka bi oboa patient ma oye say but se wo ko remote areas certificate nurses omo ye adwuma 24 hours
ye gina so ache
Melody me ba so sisi
okay
Melody oba me ba so sisi
procedures any say omo ye nyina ye de ahye wo mo kon so ye de ahye wo mo kon so enti nipa no na ye kasa Ridge a very big hospital e was say nurse ni bia ye na dwuma sa ne tie nurse ni bia was so ye na dwuma sa ne
ayi we say we ye nurse ni wo ho we ye nurse ni
me a nurse
okay who examine situation videos now here from the room no ana omode patient na to bed and so to the reception one and nurse for ni gina no de wani bu na say I mean yeah constructive analysis say na bibi koswa there na wodi wani hu ya and kwesa na nurses ni ye omo show negligence attitude and I say Osha na bibiansi e na ya na
room ho a me share room ho a client na da ho no na ya stabilize the client no one of them na me who say ya bandage ne nine cry ya mobilize no infusions so the other one now as another they were standing around him
no
almost
wo no mo
that particular client no so no I believe also me who say infusion eh den esini so say be fufuro bi wo ho I believe so mama no pain medications any ade that is the reason why no mo room wa da bed so ehu enti sa de na oye no mpo no it distracts the nurses it distracts say me my na make us my adwuma or remote area da obinya accident the whole town ebeba be go emergency room o so who yes suturing mpo suturing is supposed to be done at the theater but na ye nurses na ye na ye because pressure na egu hospital no so na doors doctors na pressure na doors omo ye consulting omo ye surgery omo ye say internet nurses na ye suturing most of the suturing are me find say enye very serious say what say dey no theater na nurses na ye den nti client na oda ho no na ya mobilize ya stabilize no na nka ohia rest and I say they na all ye no crampo no etimi ma nipa ni pain no na okom no ekosro anxiety etimi ku nipa raf they na all ye wo ho no e ma client ni po hu say owu because of one ye best say me ademi wu ana because the moment obi benya accident no e two things e ye ne say obewu and now be survive.
Okay. Me ba jina ho. Rose good jina ho ma me ba wai jina ho. Melody also bra ma me ntie e te say.
Bacho ye na say.
Wo ye nurse ni ana.
Bacho ai.
Video no hwe bi.
Ma hwe bi pa.
Me pese my investigation I do when you hwe no. Nurse for na wo Ghana ne omunya papa na say boy no ye sa no wanya de.
Bacho omo ye papa pa. The problem is make us free Canada.
Okay.
Chrome ha. So we are now come emergency because omo nim say emergency nti no wo bedu gate na no. Na doc nurse ni gina ho. Obe check your temperature who say ebi our temperature no nye high because enkofo ho bebre. Because enkofo ho bebre e bi dey say serious chebi. Enti obedi ka hwe wo mo dey ne serious no. Ti so mo check on be ma ba bi atena. Mete say na bra bi ka say oh ye bebusa wa wo yale no say within the say in this animal. Sometimes you say obu a wonte brofo kra.
Okay.
Say India for ne sanko for obu a wonte brofo. Enti no ebi ade ode ne bae no so otimi kasa o bebusa de ode ne bae no obu okra so no otimi nkasa. Enti o mbedi ka che ko bu so ode ne nye serious o mama o ba bi atena. Ebi okra ba ka hospital no na akonya kra na otisi because sleep na doso.
Okay.
Yeah, my bed o. Ebu akonya na do betena so. Na wo twen. Because nipa ne doso. Na Ghana de no. The omo can ask oh Ghana de Ghana. Of course Ghana unless we bo money inside. O money inside so and because say any this for ne doso. Say next for doso. And obi ani de oh yeah. Yeah, my raf no crane no na say yeah my boys in because we do get there because say jina ho. No munji patient in room because of my shortness into no obi access to enter the emergency. It's not like Basano. It's just a bit Ghana nurse for no
Mamisawe. Based on the video, you say Ralph no yes say I'm ready when I say you find a card emra wrong sentence for requested that information on
there be also mubisa Ralph no because no as a politics to know yeah no. Politics no day yes.
In every situation our hospital no some information whether card or information necessary need to request that na.
Yes, also mubisa because o man be so much me ho
ejuma. You use card biem. Sisi bibia ye computerized e wo Ghana.
Na ni ade na nurse for no Ralph ne ka say
on say you stabilize no. So go and give the information. So when I would in the buy common information send ye be ya ade bia ya ya ma ne bia no
Okay.
doctor for ba obetimi abeto even poso mo frɛ okwa akotwa scan o okoye den o sisi ano se ukotwa scan na se one pass through the limb system omu hu no ma ya ama sisi ye ntimi ntwra ade engu paper so ma wo fa akotwa scan ni nyina has to go through the same system.
Okay.
So I'm
Melody. Eti we no ye said yo mu ye ya no mu say abro chira ka du ani ahwe ka no kra Mr. Canada ho no wo yare na wa mfa ambulance na wa mfa wa na wa walk in na uduru ho ya ne ya be fa ne ye kohwe kwa sa ne te.
No, that one there is not true. Na de ana e ba sa ne say okay ebu a unuru Canada ha na minim US there Canada ha no. So uduru ebu abedu gate na no nurse ni gina obe check your temperature na hu say wo de ne nye high o fi o mama konya atena so no omo kobo omo de ha eye high because wo no ebi kra wo na wo hu ni say wu ono hu ni sa o hu ni say wu into okobo ade o wu no ena nipa ne dɔɔso ebi okra wo tu wo hu say wa yale o so ni amo akonya ti ho na wote so na wo twen because wo de no hu ni say baby obetima wu sa moment no
Kase ambulance impoba ufia. The kind of questions ebe bisa wo no.
Be bisa wo. And sometimes eno no omo bisa wo e prepare o man say be ya onko for bu a hu kura tumi de ne call off. Ejebu a omo bisa wo questions na wa answer na wa adwene like wa adwene baso. Say bia obu a I am hihye kura e tu bisa da asema no hwe wani din so nya bia hwe ne no.
Na we no mbabi am okra de asifri don water yetimi video ateneta mom ho no obetimi aye hospital videos ade abeto abonten.
No, you can't do that.
Untimi nya sa ho.
Yeah, untimi nya sa.
Security be mo be delete right real quick. Security be
no, untimi nya sa. Real quick. Untimi nya sa. What because a rough no because as your politics. I don't mean no because so we call hospital. Uni mo hwe ho de na anim. Uni bibia. Wo tiatia mo he nipa no kro bi obakasa bra bibi ya nana. Kro mo obakasa are you okay? Like you know, obakasa say you okay because only the reason why tia wo tiatia mu na obakasa bibi kra ya wo ankasa na wo tiatia mu. Because wo nipa na confused okay na tiatia mu sa are you okay? You know, obabebusa wo. Because we wouldn't share found also go approach obi a the good way nye he twi camera na nipa bufas na nurse for no okay ebia na hu so wo no ni sa ho o ni se nipa na wo tiatia mu he no ebia bakọ no kra no hia para
okay eti I that's what Melody me that's so no let us
nyame sure
yo a good wo
Tell me what
harmonies. Yeah, we didn't a good harmonies on.
Good hormones.
Hey. Sir Louis. Hey, Sir Louis.
Okay.
I nurse for another son. I good me bawai.
Okay, you.
Sir Louis na boko.
Okonana.
Na Sir Louis. 66 years now we ye ni ye the boy ye. Now share minister no so do your course now share. What one you blame no see this situation.
Matie de no bieka be yemfa medical for the ntonchen. Germany, so Germany now hospital. That's the only appointment and there's no even way a doctor, right?
Okay.
And a guy na kasa per se na kasa no. And the same guy and we demonstration among for a hospital or block you so mo hospital no. Because Ghana for and I Jimmy Fubu was move Ghana. The same guy it me hospital.
Okay, Mammy Montreal man for the beer, the Okan want to sabre any career.
Yeah.
What says that? What's the reason of the boss? People are dying. What do you want? What are you doing? What are you making? Obi one day. And I'll buy him. I remember I said I was making that sense. It doesn't make sense to me. Can't traffic. Whatever person. What I was saying will come at the gun. Bra. Go hospital. What's the come at the gun? Why you try that way?
On the process of comment that Ghana for more baby. If you are
an idiot person like this,
yeah,
hospital, echo block hospital say, and then or trick camera, as will be so. Okay, first of all, if for privacy, and yajuba, privacy, only to be walking to police station, and go take camera, go video, even a criminal ourselves. A criminal cry now, police station. phone enko video criminal police says na oko hospital a oko duru ho no obi da ho nipa na oda ho no onye abusuani ana wonnim the situation e nipa na ba ho obi wo ho a oba ye kwa nana ebu akoboko no ba so many things obi nipa go hospital obi wa ya body too different thing altogether ana next from ho no obi wo so no because obi wa yi card obi wo ha oye ne efese ohwe ani obi wo hwe aso a different kind of people in the hospital and you go rem na who situation no e so confront to more authority no now some say and then e koso before we be here what my what be for video and that camera could show be so and video because of so feel say oh yeah and this me you are tiny god you're untouchable you can fool around the same foolish he go to your hospital as gonna from what we be who and follow home.
But what you say? Nipa no ye ne sa no so no. Yeso olusu ni ba no olusu no.
Kwase bi say. Na am for social media. Kase ayra na me wona na hwan ya. Let's face the fact. What the guy did, the guy is ill. The guy is stupid. And the guy is a fool. Because won't be come be enko years I don't know even in near ward diaspora no. Won't be go run nurse, won't be go hospital and another ward, a friends in US, Canada, another beer, camera. It's never allowed anywhere. That is what we are talking about. It's not about Ghana nurses. What the guy did is what we are talking about. Nurses from 1 year. Who do nurse now? Who need the professional or the hospital? Who need a card? Or still be. I don't because different word. Education of nurse now nurse near nam walk who name whatever brought the person over there.
They don't fail to attend to patients. Bra you as had him say never share.
Hospital.
We do hospital. I said that's in Babylon. Sadian and Pesse, yen around the world. No, say yen microphone for at fault. I mean, no cressa would do ya nurse in Yabel. Auntie, a dear emotions in Cormoson.
Bro, hospital Germany. Hospital Germany. We could do hospital horror.
Hey, we say hospital where public space. Hey, we are sure. So a hospital know your public space. Really?
There are people who doesn't know whatever they're talking about out of politics.
When schools
because hospital Germany Nana it takes 6 hours.
You can go to the hospital and be
6 hours. Yeah, far hokra and I'll one book appointment. Obia show. So we can open Germany. Now in the appointment, say be a name hospital. Obi a few. Now work in cell hospital.
Prince Nani, what's in Europe? No, a allowed hospital by Europe. Bet me the cameras. I could try hospitals there. Public speak. Bobby Dina may track on your radio. Why Prince? What's in Europe? I allow say bet me video. A hospital.
There are people.
Bobby Dina can track. Why? Men can't say go to Bobby Dina. Even not track. Why?
Now because when so blue Europe for. I don't blame them. Many of them are illiterates. Many of them are illiterates. Or call who say heavy my court on 2 quadra. Yeni are different countries there by honor. You say also one of the poor system crowds here. Oh call all rough what's not about Japan. Oh call about any country you have been to no. Here for now call Germany and now what to war with my fuck camera. I call hospital so we could trap patient all video. Number 2 public domain.
No, what post?
I want to world different country. I want to one country. Say me country we na me country cameras will be so. A patient on your bushoni. And I even going there even to video a patient there. Our country way.
It's nice. When obi person press charges na say lawsuit bet obi bet masankwa case we move.
No.
Patient be down as for per month one. No one turn dey 10 years go be for video no. What person case no?
Obeti hospital no esu Ralph no so because hospital no didn't protect on the privacy. And Ralph no overstepped. Yeah, obeti esu hospital no.
Na adme bia na dem ra hospital ahụ. Your midwives mo na hwe awofo. What I say? You be so be oyi cats. Obi a na adwuma wo ye o. Unni nipa no, the tiny pa no jo unni adwuma wo ye o. And don't because we're nurse no is not helping. I'm bringing a juma. And the BBI politics, the same foolish guy here. Oh, have been a tiny god. He's just doing anything anyhow in Ghana. Or call parliament. Could you jam for testimony how I saw video on this ticker of Parliament House.
Oh yeah, sometimes ago, yeah.
Can just walk into Parliament House
Some of the
and just misbehave.
situations is here Emma Sabio. We ye Ghana new we ye nurse new Ghana. Now we drop her. That's a chance be the wa. What catch our number for you said they should all come. What jump for when you know because
stupid.
They are working in vain. Met me a come salary and I'm a Jew Ghana and son of me babu her. For 13 years, salary new 4,000. 13 good years in nursing. 13 good years.
Now, what do you do? Any panel minister and say, or is it still to investigation and perpetrator? And anybody?
Wow, as a minister.
I mean, this problem is that shame, papa.
Just foolish God guy like this in public.
Oh, you shame. This guy as a minister,
as a minister of state. This stupid guy can embrace you in public. Whatever he's doing, you know, it's untouchable in public.
The way I was Hagen now, and no, Lavi Davi Hagen, no, meaning he's in support of whatever he did.
What the fuck is going on in Ghana there? Then a friend said, nurse, doctor is in the same position like a soldier. I want barracks. Only walk into barracks. I go fuck camera. So the news.
Man was salary and 3,500. Nurses nibiji 2,500. Nurses for Ghana. I did 2,500. Meanwhile, a crumb hand say, just one day you can make 2,500.
Whatever, maybe. I wrote to them about where you allow more, where you are Ghana for them about a good war.
I tell me what happened.
A good nightness in Yana.
I try me next New America.
Oh, America. Now, more where you can, what Ghana for to say. I baby out through ya near the show, America near the no cresse, or be a one for what down no, yeah, doctors and choir nurses never can. As Russian to say.
I'm trying to say, but the medical confess and say, well, who feels so shy will be able to be room of a young Cassiasan. Adia, Bray ye, America, who crowd, so we do emergency why the way what nurses for more like the way more dimina aircraft no more. Unto Emma Wajimumpo. Emma Waj, and our sister, my one sister also here with Emma Wajibra. Emma Waj.
A whole security now.
Me say, would you want to get Nana Emma Wajim? Because you're saying now, but you're not wanting one another be room. Emma Wajim. So by your side, because we should the way like just say. Anyways. But another thing, say, took more money for me to cope with the day. Share as nurses or be our basic training, whether we cardo, a friend is saying, midwife, whatever specialty you are in, you have basic training. I think, say, it's high time, say, sir, or be one man, not the Babetna, where we saw a trained doctor for hours, no, be attending to no. At least we just said, at least. So about vital signs, the vitals, just vitals, and pune who are the crayon. Me kai said 2009, me call Ghana, na me kwa war panis, I yellow fever panino. Me kwa mami be the ba abba. Utu misa akwani ya na mami na fan ordinary tony ni way. And a nurses for no be the laptop biaba laptop like 19 could do laptop be. And no diaba no mu na ko laptop no ho wa sa mami ne ba botu sa mami no like ne ba na so I mean you could see that the child was not okay.
Okay.
And no mu na laptop no ho so to be honest with you I was very upset when me call hono ne me di omuduma nya me anim ni. And then the one lady free Ghana na and that even pissed me off. That word just even pissed me off. Mind you, me
have to hold them accountable.
Accountability. And I'm saying, me babe wo we you, me babe wo short keke. Me babe we dey emergency. Ka tell me man wan hwe me. And I'm saying me babe wo short na me dey emergency. Me na hwe me. Na ma me na ote honum na ne ba na yare na. Me wa me beto wa ma me nso so but because I spoke out into no. But we so me nye we your friend say me nye Ghana me free Ghana hands no me hwe me. Look a
good way. On say we for focus, but in the situation about were the nurses behaving the way you were talking or was not because among 4% who basically okay, and nurses no, I on concern about the situation.
To
But
me, looking at the video, that's how I saw it.
Doctors and nurses no, I on concern.
Looking at the video,
why never to me apprentice say they are in charge to take care of the patient. One never determine.
okay, Mpacho. Looking at the video, me, I said they were unconcerned. To be honest,
really?
I'll tell you why. Yes, I'll tell you why. Patients, like me, fans accidents about why hey, fine. Me who some 3 ladies be omujina hon ma me kwampo me nim say if obi card obi card nurse ni wakosko yi card me nim da say obi job we no e friend saying Ghana.
Baby mommy, where's also the ekuro nyina na TV. Na say hospital.
Me nim da say me nurse ni Ghana me nim da say
na say na October me am MPP for no year. Digital system no na code into the system, but most places no system no money they still use the traditional system.
I mean that's the card nurses for
other countries we don't use nurses when it comes to
card
taking in patients. Yes,
mo baby am tete and mo kofa and mo kokra ba ye ha sa digital system no
nurses need to do it.
Anya baby
I didn't know me nim that, but when in the same time they say even if say or a card nurse in bra, I'm sure they have the basic your friend say ABC. What I say, the basic ABC you have it, and you say if say a emergency and about card. No, if you're that time if there's you are not required a card, you be card yes, jump in and help. It's in an emergency situation we all go. Me, I've been a medical surgical nurse for almost 9 years now. I started from labor and delivery. Now. Problem they say you more labor and living yet it means transfer the work like a different floor. You can flow to a different floor. Yeah. But what happens is me call floor honoma because me feel labor and living there but so me so ni majuma.
Yeah.
A bit of me my nurse ni for 10 years ni I have vital because me concern you will be. They will find something else.
Wait a minute about one say can Fiji or UK what say those who will check your card are not nurses, but nurses and nurse practitioners, but hospital staffs. So you can even say, if you are a woman, you are nurse for and so way.
Well, if they're not, and of course, maybe like I said, what was
so why is that? You use to as a yardstick to defend or to justify the attitude of
we are not using as a yardstick. We are not. I'm not using as a yardstick. Me, me come experience sharing. Say me my experience how they we are. Ubeje say when I see that video, I'll start judging.
Because if you have to open,
that's me pain. When who feels to share, anybody can come in and act nonsense over there. America has said you will never even sometimes you your phone. Oh, you so for now do see. Yeah, but you see some nurses take almost nurses station now Ghana hon will be one me see me nurse ni bi or say a midwife wa quiet bed wa cover patients ni bed ni bi Ghana hon no this ya to no access bed that night you see me bed I'm coming to sleep maybe I break no but I don't know I can't judge her but don't me yes abra so be who say because you don't care because you don't care so what I don't know. You have say sisters almost more abrochi ya because we met bear witness ha no wo phone kra wo yi a wo patient wo you o phone pa wo suro ebi won man akwa she ebi won nice say obi amayo
sai se bibia wo Ghana enti se o obi shemra kra na GRN ne shemra mpo na minister de mra foforo be ba be kanta cross no.
Yeah.
Director not so Canadian. Director no.
Sister, Brahma, me can say me chomi wana for miensa. Omo ni sa UK we ni sa US ni no ko Ghana. Obeje di say me na for no o ko share UK for almost 3 years ni. Omo da so ti omo ka Ghana for omo da so jo omo nurses pay wo Ghana. Unim de ntia. Omo manager one e was o ka che government say e man say free. Sa units way into replacing no one kind just can no money be
ghost names answer ghost names
or just can no money be and guess what they are always going to work short thinking say nipa 5 na floor at that time no maybe nipa 3 na floor at that time
right
and wait how are we helping to the bia next one there's no accountability me maybe I'm here to my bra me man quite want me clock in because me thumb print na clock in
so obayo ne na ye
me bayo na me clock in ye man fa badge kra badge mpo no aka say oji me badge ko swipe ma me ye sa de no me thumb print me fa me thumb print ankwa ma ankwa
but ye nyan do but a situation at hand na de Wonu you rate Ghana for nurses in the what year no obemo mo percentage
Oh,
say.
the omu de me de me ni anya omu na me rate system na me rate they means me rate omu de omu ye nipa they came
Na
to
you
meet
said
the
ye to said yes nurses na wo mo na emmo mo ho but
no,
Ghana
no,
for
they
nurses
came
ya
to
na
meet
makoto
the
na buja.
system. Yeah, they came to meet the system, and then the almost fall victim of it. They came to meet the a lady was so or what for now utminya patient 30. One person on the patient 30.
Dollars of me chelpa, dollars of Yakwaba.
One person on the patient 30.
Sister good.
30.
Omo wie rage for front. Not before so we be enter a floor no na we swipe and sign we room. What happened? Ah,
So
so
say
we get me for
maintenance culture across so assess system asset
that
dino.
time no omo wie rage omo maintain ni wie ye omo ye wie ye no so we wo floor bia na say be fan say oh orange wontimi nko another floor sene ene obi betimi asori na akotena baby na bia akobọ nkomo o
Including como how?
because social unit no so there should be enough nurses there.
Ayi Amriba say you are asking a wise question.
Men can the question because what he's saying doesn't make no sense.
I some person man who say office what train answer say but in as much as a nurse ni or nurse will take care does not mean say would Jimmy ba or mess why.
Of course.
Yeah, nyana why. Amriba and nurse ni wonye donkey wana wonye domat why. Aha, insu say nyansa no. But sister about now.
Me drop pieces here. Me drop pieces.
Okay, good for this now young couple.
Say accountability now. Any year, even not even nurses for Ghana kasa we don't obi any accountability. Obi aye do. E woni mre mu ntin se nye no anka brawe like I said. Ontumi nkowura ho no because abroche ontumi nye saade no. Ukwa nurse not first we na we share security first and some of our nurse ni na wa be show da be jo card ukwa wa to na tade so wa born watch look clean obi wo no ko eduku bi team Ghana ni bi ti no bra what say aya wo meti duku bi
team na ye nua ba bi kura kire wo say indisciplined disorganizing you too much for your system
too much duku the duku team and no kwatono me say mrofu yi kwa most emergency na ye mrofu na akwa abakoto most of them emergency mrofu be ko wa to ni uniform so just wa ye ne ho kama okwa respect pra woni muntumi nkoye nkwase asem ho bra muntumi nkoye enti no me de manu asi but
that's why good here that's why
muntu obi afo so bi muntu nurses
yama ye yenti nurse for na dwuma se de ye kwa yemfa emotions enko nyo nurse bia na o de wo ya de kwa so wo hwe eno ye 1 key ase nyina yesu ya ayi me da say good me da say wanyama sika o se kru wo
me wo ho
ma me net say
the reason boko
na we no ye nurse for ne doctors na wo mo capacity no down and say akwa no sa raf no wo ye overreaction na ma na dia be
both number one
say ma me ntie o chinchire mo
ura America emergency ukwa ura do ni ma say glass door room on the left no maybe I mean na me ye adwuma no police ni network with a badge ho na wobeko na medical assistant for no I ask you within your purpose of coming there even emergency into me ya no day wo ID na abonsa then you go and sit there and say na triage nurse no ebefrɛ or no frɛ no be take you vital signs into you kotena ho a o take you ya no amu akotena ho no o tell you pressure ne whatever wait near the we are no amu akotena sane ya from moko inside the building we room na inside the building no say ye bia ma wa untimi nko iti baby a ukoya obusa outside the ntina bo na be mia wo ne desk na se na door na bia ma no room akọ emergency when they call you can't just walk there into number 1 security breach me who video nim na ukọ honom na se nurse na do be ko no odo be ko okibiko baby ayi no wo no do akosi wo mpaso odo kosi wo mpaso then they take whatever you have on the shoes ni ade no ye ma plastic bag now the no agum na wusi ho se bibia obi hia robe na the robe na ma wo ho no ato meka ne se curtain nim na wa change na odampa ne so
only obi ne buyer. If any year be na train waiting room now on because emergency room hono, they don't have space for people. It's just for sick people. And say you sure we had the floor and no be bit my best round. Tofon. Ti me pese me busa say akra ni ewura mu no. Was there a police officer at bay? All the time there's a police officer. So if there wasn't a police officer there, Omari or honum. Eye den no timi wura mu ko echire baby a nipa da kra sabio se omo ma ni CPR whatever it is, no timi the camera. And then right back so na onya ya utimi film people in a hospital because people come to the hospital when they are mostly vulnerable, they are in pain. Most of the time their brain are not functioning because of the condition at which they are in. Timbese mi hu sa chaotic scene now creating was highly unnecessary. It was not necessary at all. Now you can say some nurses no ABTO even here in America. Say nurse are signing a man or no do because bed no so no akoshe omo omoti honum no omoti nursing station honum. Some people are working, and even here, sometimes you see people on their phone, but it's not like Ghana. Now, say, oh boy, oh Leah, say we here help her. Even when your nurse is not available, those sitting at the nursing station, someone will come and ask why you call for help. It's me entrance, no, it's me problem, pa. I would see me call honoma. What could distracting omunina or more we are. Saa gidigidi nurse ni eye yi ni nyina no obi ti hono ma e bia wa kwhwe the patient e bi no chop report menim how Ghana
the shift to cry over
Ghana for the any day
nurse ni na ye bo no na wapon a wo kofie wapon ne se wo ye hand washing e wo entrance guy the problem nyina ne say me colleague bi adwuma wo ho o say ya ye ono ne de na wie o na omo wie ye no no mo say ono mom enko to say sisi me fan say ya ye use computerized way ye beka say ko book appointment enti ono mom enko je card na say enko book appointment na o say nurse ni enka ne ho ne nko and the nurses refused say no de enye omo adwuma. That is why he got angry.
That's why inside say obe follow the instruction from the nurses no so one yet. Hospital for follow instruction from the nurses. Yama ohima kose krumfa na nsi. Ohima akasa.
Oba hospital osi wepra. According to you, you are bleeding. You do not have the sense at that time, to pick a phone and do recordings. Because you want people to attend to the wound and dress it. So what were you doing with the phone?
Creating unnecessary.
Why do you think you have to go to the nurses station? You don't know what each of them are doing over there. Check vital signs. They are waiting to be called to see a doctor. You don't know that. You don't know the system how it's run there. It's the nurse will tell you to sit here. You go and take all the gadgets, for avoidance of those. The equipment is the dressing, the gloves, whatever, the gloves, or bed check away. Besides that, near take you vital signs in the BBA. No about bed dressing and no crowd on you openly or do quack baby, I be assign it to you. No, near cover up. It's not something that somebody should see. It's minima the frontier or no timid in the phone in an hosa. Because I didn't know, may understand the Ghana for Abuja seminar, but Ghana for nurses, I will tell you, majority of them, their attitude towards work is appalling.
Okay. That's it. Many nurse phone be no and me
experience. Me ba Ghana. I'm no longer a nurse here. Me ba Ghana and I'm doing Papa Call Hospital, Kumasi. Oko change when your friend is in bladder into Oshe catheter. And according to them, no, changing once a month, which I think say no, you can get a UTI. I mean, it should be quite frequent, but almost system. So when me call they me who ye, nurse na all change catheter no. I'm telling you, onim the all ye. And I'm sitting there, and who say my dad is in pain. I'm like, okay, first of all, let me do this. And then almost, and I'm so yeah, family, no. I am running my home. I say so show family. But here's the case. I'm also sitting there, seeing that my dad also is in pain.
Hey, na obi a
Wow.
akosua adwuma no a eno no eno wonim ye.
Oh, me pacho, and yeah, omo nurse or bekache, nye bibia no be enemy. I'll tell you.
Ah. And na say
Me, I
practicals ye no
work
kre.
only. I started with emergency nursing, and then I moved to urology. That's all I was doing, changing catheters. This is my expertise. Me, I'm changing catheter. That's my job. It comes organically, like me. And no one's home. Me papa used to 16, no I offer 18, which is different size. The whole thing is annoying to me.
Oberap adinama wa berap tam.
But so
Oh,
you said me about in that moment you are and you know we better the next so onim do the onim the entire
Hey,
sa
who say onim onu according to me amete ono no so onim do ye ba me amete ono so hwa ade na. Enya sa na ye no. What was the misukalo? In fact, I have to agitate, which was wrong on my side, and I'm like, okay, I need to have a gel first of all. Then I have to coach her because they won't let you touch patient no in your job, which I agree. It's then I have to kind of teach her. Say,
as of that time, no your patient, carer, and I won't better nurse in the 1 year.
Say I have to let them know. Me want my phone, so me say, okay, I'm
really?
doing this.
Now, they will listen to you.
They were nice about it. Then I'm like, no, you have to hold the tips. Say, we did jail no. Say those who pians those who had in sa. Oh, yes, I did go through pain. No, baby, not all bleed. He's not supposed to bleed. You have to clean the tip first. Just say the whole thing. Or alcohol, me say no, that would be painful. I was like, this is me and papa.
There is a person sometimes, yes, sometimes they will listen.
Yeah, and you know I am frustrated, but I have to.
And most of the time,
switching with me team say I have to calm my nerves.
When to say I feel now what baffle from laziness about no. Say obi me am fan is a national service na necessary rotational nurses. What baffle from I was say yɛkyerɛ no but who say adwuma bia ba then because say ɔno nso pɛ sɛ osua then we will be pushing the jobs onto them.
Hey, but we didn't come on and say the number one for scared to say so we tell going up just practicing.
Nana mama can sem kakra their sister ne can say their sister ne can about ne papa no about nursing. Sometimes your health sector nabi me dress wound na they all can say Ghana nurses need doctors, some of them sometimes they are negligent and they cause you all these things, but let's not forget say whatever goes on in Ghana me America goes on in America. You could get a nurse who doesn't know anything in America, but yes, the person calls herself a nurse.
That is true too.
Nothing.
And so a friend no one nurse. Because I free African no.
Oh yes.
I am per se. Yeah, who this one will cover this one, this one will cover that one, this one will come in, and then the case is solved and everything is covered. Okay. But Ghana no I say you need so obey you woman. It goes on in here in America. So as much as I condemn people, no, don't let's paint the foreigners as they know everything. Everything is correct. Everything is right. Everything is not all right in America.
No, but sister, one thing they say, remember, say,
everything is not all right in America.
It is their own true. When I was in New York, New York is a lot.
All change catheter. All change catheter. I said, "Oh, can walk fast." Oh, Papa, you size 9. another size, whatever, cover another size 8. I've
16.
seen it here too. Somebody uses size 4, or cover size 5, size 6. So somebody needed to prompt her before she, oh no, I forgot. No, cause it's time. Sometimes, it's because the system in this country works. That is why we think everything is okay in here. But the system in Ghana, yeah, politicizing in such a way, say, way back, MPP, way back, NDC. Now, yeah, kwesimentin maybe, and I hear you Ghana.
Oh, me pass me we
Now,
na see for
right.
additional media who ya ne say
Meba,
when
mama hima, ohima for na nsi o na yenya clear picture ni.
I was trained in Ghana. Now, we call school. Who says I will abroach her? And near man dosu. Obi enye be yet practicals. Obi enye be. And move your mobile discarding in your more the next way. I'm mobile saying you suffer from. But here we are in Ghana. You back up practical room. No. And near man, yes, say. Would they be say, would they be besides and near man, yes, say. And to be a cramp now. I dear answer hands to machineries no be our Ghana. At the trainer, yet
Anything I'm gonna say system no. System no.
Book need they know.
But skills ni ho.
And near man, you be here, Jumano.
Exactly.
In this case, and the entity blame you and someone and you.
Me na me teacher ni kakra wo Ghana. Me student yare ye pa. Or ye surgery na Stampede BC school one obi tia na yase. And I started so bleeding from where they cut. So we had to rush her to Confanoche. And near naba system naba doctor be their kogu or no private hospital.
Look at this.
Corruption.
And that is what is going on in Ghana.
Oh, but your money na mean 70 those.
Okay, abana odia kakra abana kakra na fe yam midwife go down.
They come by and say they okay. The head nurse na no hono. When I explained to her, said this Mejumano. Timan saw the way in, but I tutored the lady nurse and Omokachem so head nurse and they were bayana. And secondly, they were short of staff. And also another thing that me it's you by the winter timer. Now aba volunteering. And on a catch him say you can volunteer. Na waba na so betimi we expertise so abeboa wo mo hono na te said the mo kano gloves common gloves crying problem gloves so
obiasa go ne uniform
me private hospital
me 2016 me am volunteer e wo confirm eniema me hu ye no cleaning detergent. Omutimi fa ko omufie.
Sister.
Cleaning detergent oh.
It's true.
Aban no.
It's true.
Ono. Na omukuta voltic bottle no. No obi afie. Me say they go for me
she correct.
Oh, di coffee oh. Aban na to abeku honom no. Cleaning we say as low obi fa gloves na musa say what are you going to do with the gloves?
And if you can, me and open me pick intelligence, we say, if be alleged, say, because Kabramita can't do by as a health minister, no, or call Tamale say, what we are going to phobia the war. I say, a young creative since I need files no we be ready. It's normal. I'm not going to redeem it. Say,
it's normal. It's normal, pal.
Yes, I'm not going to redeem it. Say, it might be a setup for them to go in there and do something at our regional hospital.
Who do cleaning in the hospital?
Mean
But some are being paid 300 cedis.
So if you don't like the
300 cedis. So obi be ye juma 300. And na mo we no ton no.
And on this me
piece of 1 gallon I would say 1 gallon no.
Okay, mama hima o say ku fa na no si o hima fa no si.
Me de manusi no. Delivery ward. Wo maybe I'm a volunteer. What I saw there, as a woman, I felt so sad. this is not the patient, the attitude of the nurses.
Oh.
I'm not even going to miss words here. When you are in pain, labor, no, you are having contractions here and there. Your body, you feel like somebody is putting a hit you, say you was with hammer. So the pain here is excruciating. And that is where you need the most care and comfort, encouragement. They don't provide that. And I'll never forget it. And could have bunny, nurses from my white, no, could have bunny and a 14 years old. The money man said, that is not your effing business. Your business is to treat her as a patient at that time.
Nurses, I tap those words, no good.
Those words.
Hey.
Those words, oh.
Hey. It
wasn't. They should just go and see, say, what dilated, say, no. They are sitting there unconcerned.
Very unbothered. Very unbothered.
Very, very unbothered. Me so meet now. Me both. Me can't talk about now. And me a pap mommy.
Whoa.
It's me and they're not guy near. Now, what trim had you? I mean, talk about me cocoa. Because I was like, that's a me at that time. No, you become so reactive. You are not. All you are thinking is deep and bibi and munyan say bibi and we are not thinking about even what you are doing. Who is a walk mama bebo? No musi hono. Kekemu. Go free move ya.
And then the Mukadi, Nana said, the guy, no, Rafni was right to react in this way.
They were you see custom. Yeah, can say. I said, Raf, the guy right to say,
no. What's that? You make me patch up.
Also, you may be as
me reasons are guy no in new so yes, sir.
Right.
And the will be say I say why no I can say both. That is what I said. I'm not excusing the behavior.
Okay.
Only Mpasa Abrocha and continue yes I no. He's aware of that.
Oh God, 10 years.
Ghana and a minimum security at post no hospital now minimum where were they because they shouldn't even go beyond certain points.
I can't say until you be in that situation in Ghana hospital, no, you will understand that boy Raf what he did, no.
I just share with you my experience.
In as much as skirmishes woman, Akabulan, there's no justification. Say you can go to
that wasn't right
facility to do that.
Yes,
no way.
That wasn't right.
No way.
And no there.
There's no justification. So over hospital, not even camera. I see. Who exposes other patients to privacy?
Momo him for an
and I make her say, Maka guy inside the way I am addressing the hospital staffs, no, especially the nurses.
What and just home because maybe ministers who would just say you no maybe why would it now? Midwife who was here midwife.
Yeah.
To say
yeah, me at the moment also.
And to Ojia war.
Media or Messiah or guy in so.
Okay, who are you crew might be a gun and Biana?
No, Kolebu.
So the Yana society, no, you chastise him with your bomb, what she nurse for moon, with your own concern, negligence, more insensitive. Said your video near call, one was what video nibi.
My share video nibina, very sad.
Are they?
And like very sad being a nurse or a midwife in Ghana. And my dean Metieti and Kofo be brand some more platform so na we a nurse ni wa Ghana na what's in some if you're more matu quine ekika and some like ya was saying na you to quine be
yeah
was saying na you free Ghana because ya say when they are saying it generalize it
yeah
generalize it say yenyi nurses 100 in siwa 100% and 100% na enyina ena enye anase ye rude anase enye o medwuma
Yeah.
yi. We sacrifice a lot. We give our all, but we are
The
not appreciated.
improvise. The improvise.
We are always insulted. And to say, "Oh, di matem, ubetina internet so edi matem." Na word some show psychologically no. It's saying me
Just what the cat say what we no cry
psychologically
and
na
say
join it is saying.
Oh.
And I say me yi makumem kran po dia show a me de be show. One thing I was here when I say, when you come to the hospital, and you'll be a who no in scrub, when you come to the hospital, Obaba hospital, no, be a cleaner, or just scrub. Pachoma menka saying ye. Obi a cleaner, or just scrub. Obi a cook, or just scrub. Obi a chef, or just scrub. Obi a lab see, or just scrub. And you'll be a who ni biana chese, or your nurse ni. Obi a cleaner, but no.
Midwife.
Pacho
Michelle Payne no ba educate ye. Video na hwe mu no. Nurse for na hu omo ho no. Omo ye ehemfo a na nipa say, pese omo gina on concern na omo focus on omo use omo. Omo ye ehemfo a.
Yes. Me pacho. They were in scrap. And you can't say nipa we ye nurse ni anasa onye nurse ni. Me pacho what ya say.
Yeah.
And I ba hospital and so obia when the juma oye.
Okay.
And the funny say, oba no, what better say clean a beach na wa or she scrap. Now be did in attempts or your nurse in he be cancel so your nurse nya. Now say na wo patchy. And Ralph no, oba no, or say he spent 1 hour there. And the 1 hour no, they attended to him. Omo man we omo man koto we ya can say se gozo se same by ya omo they attended to the wound. And you kind of saying they were talking about the card. And yes, the card that trust wo. Say everything is digitalized. Lens and I use. So before her, you bet me enya wo bibi no. Me, I was pregnant. I work at Kolebu and me call Kolebu hona say me call antenatal. I was asked to go and bring my card. My card enya me antenatal card o. Card that ye do you can say o number atoso. What you say? Enti sa number no eno ye bottle system ne so a ohu information ebeba. And Oba hospital, you need that card because before a doctor will attend to you, no, me ankasana me yes staff me work Kolebu maternity no, me call antenatal no. You catch me say me go for sa card. I was having my antenatal card, but you catch me say me go for me sa card number. And yes, our doctor ne say on me until say I bring the card. And he fan or be inputting me information. And I session I wash me no. And he no be putting me information. He's not going to write it for me. So if they ask them to go and bring a card, and I say uncle chakada, and just say uncle fa card them rama so.
Oh, now
yeah,
inputting
into the system.
Traditional card and ibina ko fa card brand bi na nya no abi.
Yes, and your traditional card. And your limbs way no. You're not they call limbs in the so.
Oma link it with your health insurance. And it's a one for
yes.
Yes. Health insurance away.
They can't attend to you.
Insurance card now. Omo bet me I go into the system. And also who cross our card now with health insurance. Who bet me I go hospital be our Ghana with that card.
Yes. And when they show
so card now, man, we question. And to be a can't you pull the patient's information with the mifans and patrimony you see? Needing date of birth. And then the baby will feel like some. Can't you pull it with some sort of demographics other than that?
Me partial se nipa no ye unconscious oni obi ne baaye. What you say? Oni obi ne baaye. Enti nipa no ene ye be sticky for all those information from the person. Enti ye sticky for all those information from the person
Midwife.
Pacho me.
Mr. O dey say what me so Kolebu Is there a system be as a see a name no kasa say obi ba onkura bibia but otimi bɔ ne date of birth ni din bi bibi wɔ ha Ghana se see a kolebu betimi abɔ say okay we papa ye bo we etimi agi ne date obi aba bibi sa ho
Mpacho, so what ba say ya connect your mom connect Ghana card to your NHS. Aha. And she said, "Won't need NHS ne kwampo no wa connect Ghana card to the NHS na. Your bo will NHS number na to the system na. Ni asama card, kolebu card.
me question is me say onipa na ba patient no. Was me nkura hwe. Catch say what bi o say wa hunu. Is there a way bi a kolebu betimi abɔ enipa ne detail bi ama yenya information or yebeka say ye bo yenya information bi bibi sa ho.
Crash the ayanya information bia.
Oh really?
I just want to do information ebe my.
Okay,
na wo ni card ye be ye bia ma.
Me ba obi di ni din birth date of birth, telephone number, and passport number ma muntimi enfa hwe bibi ama nipa no.
This year me
unless say a Ghana card.
What if the person cannot talk? Person, what if
exactly? That's the person cannot talk. The person maybe the person came with somebody.
No, what if they didn't come?
No.
What if they didn't come with anybody, my dear? What if they didn't come with anybody?
Enti debio asem we ya mu busa nurse ni. Ebe the nurse ni no ehunu sa no ma we ya mu busa
no. So
because system na nurse ni the developing system no. Software na mo kwa asem ya. Software na mo kwa mu busa nurse ni developing software. Nurse ni no software na ye develop ya brand no dey. Develop software. Sisi na ye busa nurse ni ye busa software no ho nsem no. Ebe the nurse ni na time ye.
Duty. Your records for omo share card ho asem. Me pacho what you say.
Okay.
And see, the first point of contact is to go to the records to get your card. And sana waba say check your vitals, your triage. And before emergency for win your triage, your red, yellow, and green. Ebin so no 1, 2, 3. It's red no. Omo de any severe. Yellow, middle, and a green. Omo de any shada nye serious. Into omo ye red no. Omo na ye rush attend to them. And some yellow for number, and some green for number. And so when you red that the focus wouldn't be on you at that time.
Now you're right now on the card.
Yeah, way no. Ocha video no. So osha na ebi mo da patients ni bi wo ho no ma na infusion esi omoso.
Yes.
They had already attended to them. Pacho what is their make?
Yeah.
And no Ralph Nelson so no machine. No nti onkoyi obi card embra no onkoji obi card embra no and they all those in there man here dey
mami busa na question kiti oba you can say me say yes you generalize it and some no ha say people are sharing their experiences and it's so good to say we have at least health workers are on more platform you so one you say something say ese mu nyina mutu kwan na ni who be generalize na especially when who say asema kan me I disagree highly disappointed not that I'm disappointed in when you made that statement say obi adi watem and waba honum it was psyche kura when who obi ti baby no adi watem nurse no about officer which is hospital ho na wo hwe nipa kro no kura wa adwi mu ti sen a wo de be hwe ni ye wo nipa no wo be yi wa adwi mu ipacho ye adwuma hospital no obi abu me ba ya che no na edi na ba it is not my job to judge them at that time my job to administer me profession no help no nhia no e ho na ma adwen wo dia wadi watem at that time is not what we are thinking of doing my job. Oh, you see where the difference is. Obagana. Because obi time baby adi matem enu aba. Wa ma house on mbesese oba oyare medjuma se nurse ese mehwe no. Enu na em medjuma.
Me say
That
sometimes to do one
professionalism
Me
e
pacho.
no
e wo
feel
form.
bitch.
Yes, me pacho.
Nana.
They're okay, no. Me get to the okay.
Midwife say,
But what I was saying is saying.
Mama nurse, my midwife,
yes, me ask you a question. Okay, I said not Ralph. I'm attending to Ralph, but not obliged. They I'm attending to no obliged.
You should
I want me baby, Mr. One. Esa na ya fair to midwife.
That midwife me see for me so me person.
Me pacho.
Or can midwife as a more king. Hospital, baby, I can hospital is different from when you go to the emergency. There are two different scenarios. Because emergency no be a whole bar, the condition they didn't buy, trauma and they didn't buy, who go boost on a card.
The other year.
Who attended to the person. And we are two different things here. Come on.
That be was a woman walk. I am so woman walk grounds on the
Me pacho. Me kasano. So me can't triage. Me can't see a triage patient. Before we attend to them. Triage no, and I mechanic say, ye wo omwa se nipa no oba o assess no. O assess the condition of the patient. O check nipa ni BP. O check name. You check all the vitals. O share na appearance. O examine no. Oh, set nipa ni responsive or unresponsive. Ebia like o share those in their mani we are no categorizing. Ye were red. Ye were green. And you were yellow, red, green, orange. And red, yellow, green. Into red no, almost the end is severe no. And a yellow ya middle, and a green a year last. Into so what attended to them you no ya red no, or no the end is severe. So you attend to some patients no first before you go to the oye yellow, and I said before you go to the oye green. That is what the first thing I hear you can't say emergency was a woba emergency one ma.
Okay.
Oh yeah.
Midwife. Media Rachel. We situation we a patient no why day. Now my omo here any day.
This guy looks stable to you.
Some patients no. According to Obiana or no say ma attended to some patients no. Well, and you know say oba emergency to see I'm finding say emergency say so ba e ho no ma patients need that one no relatives no ebi ba ho omu di wa akwaniaba se wanye we ya se wan cover ho no na wan kan kire say bia mamo mba ho no ye say anasisi ya they want to be by the side of their relative
the rules in the hospital ho anase nipa na violating rules no
rules are but they violate it. And they say, and then me kofa patients ye koye obi you can say myomectomy fibroid operation and ye kofa ne buy. Into me kofa ne buy no. Now was say me setting up infusion on the patient. Me didn't so see the so ne and dry and was say ye twice or anything at the man. And I know sound or sound that oxygen so. Until before say me de oxygen no ebesi ne so no e was me checking na home that's the saturation e was me checking e was me checking the saturation ni hu say ne home ne ye den etisen me ye say me de machine ne me ko fa machine na ba e de abesi ne so ape e ho na ni kun ban madam on fancy ne so on for oxygen ne so no starting say wo kasa well enti oye me a obeying.
Now say, Meba. Now say, you okay? You was 66 years old. Now say, you intimate design class. Baby, and nurse here na juma no. Visitor to me, mama frustrated. You intimate news stage.
What can't you say? Me patch na bonte mami hwe patient ni wi ansa na wa bemu no. Eno kra o titi watem.
Na police for no more.
Really? 68 years. Wait a minute, bro innocent. 68 years. Really?
Now what police go ban ehun so go na ho no.
Na police for. Na police for.
Police security.
Police for no. A children no from mobile, but no more security back. Ba want to manage. Actually, na police for the buy.
Security for no.
Security ne dey no betimi aye.
Munya botre me ba.
Pese me can say be sister.
Nana me ba. Mummy nyane kakraka ayi ene de ayi nurse for no o madwa munya botre. Ayi
Confanochi emergency as a sports stadium. Confanochi emergency.
Omo to be frag BPT.
Me say from pie. Omo be di watem.
Madam, that midwife na some na okan. Me nyini ndi achinye. Some initial make some catch and say be papa. Oyare ya the catheter shini. You call emergency. You did next me attempt to say next in any dear. As a moja and nami. Maybe a teacher ni me nurse ni. But omo juma no omo is equally to a teacher for na ye. A juma ye. That's all pa.
Yes, human beings. So
you cannot add your emotions to this job, oh my dear. You cannot add your emotions to this job.
I am not adding emotions to it, but I just want to address something.
Any emotions, so
I just want to address something. You have no idea about the condition that your relative is in. You don't know what, you don't have any idea. And somebody is trying to help you. Then you stand afar and throw tantrums and throw insults.
Psychologically, okay, very bad. But point is,
mistake keep into any different situation.
From boy, dear TNA, near me about big check say, once was accepted over here, maybe see you do after say then, and won't think I say no stop with man.
To me, add the emotions to it.
That's right.
You need sound mind.
You need concentration. You need sound mind.
I'm here to Western region. Western region,
America has a America, your friend is saying, system no be generative be amount. Me accident, April, yeah. Yeah, the me control emergency. Before I be na ambulance, no, I give information na. And you could do one. I feel no almost some information in my nest, maybe a record side. I'm gonna enter information into the computer. And who said whether I've been there, this is my condition, this is what I have, and what do we
do. My dear.
It's the same thing in Ghana.
Create a name for you.
It's the same thing in Ghana.
If it's an emergency,
ambulance never. Ambulance never. Before the ambulance never do one. They are sending information.
One after the other.
Yes, system no name. Yes, yes, system. It's about time. Lecture or it's about time.
There isn't. Me make it general. You say.
30 seconds. Mami, I
appreciate your necessary.
There isn't. Whether Ghana or abroad, you can make a choice and say. They say because of AI, ChatGPT, and Kofun Suyadia. And to go more than Koyare, now for that water. It's who ye and men Koyare, accidents. May say when I make a natural. Whether America, Europe, and if I almost AI.
Records na same no. The rules make us about the records are same no. Na minim senia. Ibedru according to mu we ani ref physics senia it go at insanity organa. Can going to I've gone to the emergency department before. I had an emergency at home. Me fry ambulance. Ambulance because I'll be there in 30 minutes. If ambulance not 5 a.m. How much ambulance will be due 8 a.m. Anopa.
Almost about 3.5 hours. Yes, sir.
Yes,
exactly. I was state bank.
Sister, it is there. But we defend the America.
Ma mo nya mo ho sa mo tie ye.
But we defend the America. American Sasanya mo pesa mo chere. American Sasanya mo pesa mo chere no. But we defend the America.
I'm not defending
ambulance. It doesn't matter where the state is. It is everywhere. It is everywhere in America.
Nana, ehifa.
UK.
Oh, okay.
UK on.
Yeah.
Okay.
Okay.
It's ambulance nearby, you know. Ambulance nearby. Ambulance from your place is about just 5 stop with the bus. Just 5 stop with the bus. So ambulance nearby, you know. Ombe family. I don't can catch him some morphine. And because I have a brain allergy, you know, because I'm say emergency case. Me can't say me penny extravagant. I mean to me the infant course. So I didn't know was a mama morphine back. What I'm saying, I'm second one. I rejected it because I have a right to refuse medication. Into me reject it. And when we get there, they made me because I am not butcher for your dad. I want to the sense of Ghana and have butcher. Pedro say I register with the NHS. But also GP, also register with GP. I didn't know sir. Into maybe say question how many times na ye call emergency unit permanent hospital or emergency unit and you hospital order.
I class say yes, UK is really bad. I see UK.
Was so register. But with some question say Ghana for I am Ghana will be hospital be about register and you say I am hospital to me come records the order. These questions now. Bisa, Macroma so be drew up a it opens to call GP, my GP show. I also register with the GP. One register with the GP, now GP new information via. And semi register with
even GP no kra wanya issue just a offer near book you appointment. Yes, oh sorry, I know sorry pam.
Say crown. Me no kala say crown. I book him for scan. I'm catching 6 weeks nature me from catching say the minya but you send me later and by up to date.
Okay, ati ohwa yem famra ye fie no ohwa sama na midwife o ka say asa ye bu bibia gu nurse for no so but ye hu omo say wo mo ye ye no wo ka no wo di ka na say nurse for no so ha adwen wo Ghana.
Me be say question back o. The obi Yariba hospital na say doctor in diagnosing na nurse ni minya den.
According
to our pledge, sister, me according to our pledge, it's in our pledge.
Mamusa question. Oda Mamusa question we. Midwife war.
Reason.
Say we be back for hospital first. In your first appearance, no. Doctors na mamu ko take ni pan vitals and say you more nurses more responsibility. Patient more esa mu take sa records no to. Answer na doctor ba.
No patients never was here taking the vitals. Inti ye taking a vital say we are na doctor ne ba na wahwe no inti the doctor no ebeka say yenye no eno na yenye beye
inti after ya mutimi ya mutimi de mo pay vitals na mutimi de mo pay
science so what
yes vitals no and eno ne yenye de pay and the note the nurses knows the care plan and monitoring
admission knows everything Miss Remo
Okay. Instead of diagnosing, no medications are now feed ye serve medications no. So with all the monitoring na no, so also be free hospital when you know. Ye be monitor na kwesi say obe free hospital.
Okay.
Me patch me question, Miss.
Question. What is question?
Patch me question is say. Patrick, midwife, you made mention. Well, your midwife, I wasn't. But mo say we are vitals. We are. I will say we train. So I mean, someone say, "Obi coming in with chest pain. Chest pain is a critical thing. It's a time sensitive disease. I mean, the problem. A time sensitive. And I say we could be bad with some sort of clot. And I say stroke. Ne say me find say a clot ne cause stroke na. Yeah, you will know be one ma they are time sensitive after it passes some time. What the is there no for instance standard or there's be one ma? Yes, see patients way back with chest pain, mani morphine, mani aspirin, you say right away coach. Like there is there no
Okay. Me pacho. Unim hospital hono. There are some things and your responsibility okoye na sa asemba ho a ya chi wutuma e ye won kwa wasema.
So that means there is no standard way like that in Ghana. There is no
There is
standard.
standard and on America said the standard precautions near there e wo honom no. Say nya
follow
me
protocol.
duty. Yes. Say nya me duty say me ya. Say jobi wo na doctor and prescribe ye.
Okay.
Na me kofama no. Na say bibi ye patient na.
I mean, wasem. And I will rather say basically.
I'm not saying that. I'm just saying, say there is no like to say me juma or labor and delivery. Say obi ba na say me fans obi ba be wona ni way ni your friends and the first obi onya hypertension and the blood pressure I from her. There is a standard order I work on. A treaty most emergencies. Okay, my first way it's a written order over there. Say was something to me performing. Normal thing, just like that. That I don't need an order.
Professionals. They stand on their own. They take decision by themselves. That is it. That is what delivery. No. To me take a decision.
Yes.
Said this person.
No, you cannot take my dear. Correct yourself. There has to be a standard order. Has to be an order.
Midwife
is different.
Now, but
yes,
midwifery side is different.
Midwives are prescribers.
Midwifery side is
different from nursing. Yes,
without the doctor.
Yes.
Me pacho, why is that to say bia obi aba na ni BP high? Yam fan say bia pre-eclampsia and I say those yamana. We have a protocol there.
That's all I'm asking.
What you say? No, ye be follow. Ebia, I was so many max sulfate. See, I was say ebia after 4 hours. I was so many way. And I say bia say yeah, na fe depend protocol and so and also the intervals. I was at this time which I can BP, which I keep BP now. I was through say I was so many this amount of and I said right. That yes, that thing is there. Say no there was away, but enye bibiana ubetimi aye.
Okay.
Mami Musa, last question, midwife. Ghana for ni bi kasa wa ha say mo nurse for no bebre no adwuma bebre mo omu nim ye. Ujitum say nurse for no bebre adwuma bi omu nya de but omu wo ho pa. Ebi wo hunu bi sa pen.
Me pacho, when say me di kan start say me kasa. Me can say your grace of nurses, and when you come to the field and so you were student nurses you were rotation nurses you were staff nurses you were senior nurses you were nursing officers you were senior nursing officers you great and nti obi wo ho a oye new a enema bi wo ho a onse denim or picking kakaka nti enyina yesuasua even the overall boss cramp no onu nso sua bibi efiri ye ho
na why na ya na enipa wo sua bibi ye man full responsibility to perform because ohima ka say me say no obi hye ni papa katita in fact onu kura as a visitor na air director no bibi sa no one na ma orders
onu can say onu anka sample ohun say no ma short staff most of the time no.
Yes,
I quite remember when I was working ye nipa two timi kwa night we pediatric unit and kwala ho adwuma yo na nipa 2 with 46 clients 46 kwala 46 nipa 2 na mo night no
emergency aba attend to the person who did
kwala ho adwuma ye din pa akwala ho ye list mistake obewu.
And
Matibu, I want to question na minsi bi na min kwasi o na min kofa mi.
Ghana say you do
Dr. Guy Abasis here.
You do biba emergency critical situation. What is the protocol in addressing that person?
I believe say big hospital like Rage Uko Confanochi any so for instance big hospitals now. Emergency units be our friend is saying ward
doctors
medical doctor.
around
beauty Sophie beauty send request why what they send request beauty
duty nurses duty enti say bibi ba say say emergency no bi wo ho ma oba ade bi wo ho a enhye da enya ade bia nurse ni
my question no you didn't get my question. Let's say somebody is airlifted from an accident and you did not back a trauma big one. What is the protocol in stabilizing the person? Or emergency.
Okay. And the doctors in the match they patch out.
Okay,
responsibility of it. I'm any
yo me da se pa yo
me patch my men come last week na me
the whole scene na me musa doctor guy for obetuma is question
na me can say near rap here no wanye ni yie under no circumstances say ye beji atum say oye ni yie
okay
baby na me ye adwuma accident ba obi ebua bi efiefo ti mi ba na o matu agu ye so me mpesa me bo hospital ni din o mutimi tugu nurses so bia pamuche omumpio bitim kasa me bobo it got to a time say mema nurses no omo mu no e yo madwen say efiefo ne de sa force ne ba o mba wuro omo shirt agu ani omo de asi ani that is when it started minimizing me mpesa me bo hospital because my year adwuma wo ho me year adwuma wo ho 10 years. It got to a point a mema na ye say wa wo beba be din kwase asem no wo de client beba be din kwase asem no wo ye bema wo to aye beto afei ehase ese brase etutura asem ne wo Ghana na dose dodo yemfa protocol ntutu akwam obi say yese memma visiting hours kra ye ni so wo Ghana adan ye ni so
bibia e basa for this year
me da say nyina ye emrana ye ni so no ya politicizing health no
thank
you
no okay okay hello that's why Dr. Guy but akwaba na no obi bisa ye wa hima bisa bibi wa ha menim sa na so pese oyi na no ho me pese matase ho na me pese o de me ba ma yentio okay thank you for the opportunity no okay ebano a year medicine okay healthcare no a teamwork ote the mechanism enti ebano teamwork na sometimes grano your nurses be or right based on almost level of experience no any old doctor and experience no when ti omo na one we are be mistake a collective team enti wo hwe Ghana also Ghana no yeah baby my people say why but what person means you can mean siba you na me fa bin frase omra why Ghana no wo hwe nursing hierarchy na ye ni bi say bia obi a advanced provider say bi obetima be nurse practitioner nipa no betima practice independently right enti the woman is say nursing school no omo model omo use no the friend the nursing model you need to follow the protocols no what you say and in medicine no, we use the medical model right now and so say dan temo no nursing model no medical model me say on say medical school training no is very rigorous a normally does okay and you know be can you can say okwa ko hu obi a e was book appointment in way say yes and no e through obe true obe bia but on say Ghana no appointment scheduling system kra na nya adwuma because you don't have a standard measurement like or treat maybe as a standard electronic medical record you America say me or America into America no you see they say epic right epic and a more like as you say a gold standard as all hospitals no almost transition to what you say I o make epic why also about yakwaba yo I mean akasa epic no and then the standard of treatment obi aye we say or obi aye say obi person okọ sa
now I doctor the okay can sa epic Ghana ho no bibi sa wo mu ni bibi afra na epic ho
okay Ghana no on say medical we say electronic medical record no I think say
use it, but once they make use of paper no more. So budget card no one when
And because of traditional system now, your team, it's a digital system. We have
records department anyway say no. Abroche no your friend in health information management, right? Your IT professionals or your clinical analyst or health informatician or I'm gonna handle all those aspects no. Make a notice here. Into the year can RAF the anyway, make be pages. So now they were discussing about that topic no. First of all, no, RAF no, only you say your friend be we say HIPAA violation. HIPAA nature say who need the right to say one patient to crown will be around the crown obe so camera there two be so. Yes, what violate will be what will be we say right. What did they make an answer? Now yes, you must hear who say RAF no. I won't say oh share we say now at the end of the day no. You funny say granted no. Any mucha actually trap. What you say? It's any mucha na actually channel. RAF na nyadi, but then no, what is the leadership no doing? Leadership no, me nkoka say health minister. Health minister no so what important role also play. First of all, what is the leadership of the hospital no area? What is the administration doing? Say they make a note here. You will crow a ukuma, yes, no bed syndrome. No because of ambulance, UK ne we say no way say. What you say? Your conditions be or her. Okay, say emergency situations no. And anything now about butcher, you one nurse or no specializing in what emergency medicine into a ER nurse. Into any form of trauma, BR, and no say you look around. There be America says, so America, Obi by a bone to Obi, you waste to be a BR there's rush. Oh, yeah, we say, so what the American say. But yeah, chromo. First of all, no, let's blame it on leadership. Leadership are failing. Okay, secondly, I have always been of the opinion, say, I then now for BR or yes statistics, right? No acquire law, say unquire minister, we say health minister. To me, no, it doesn't make sense. When the entire to me, it doesn't make sense. No. Okay, Omobeka say, oh, our team are briefing. No, say you're briefing. Say me say no. Oko family now minister for health. Ghana. I've been on the grassroots before. What you say? Enti mete omo consensus na se. And the technicalities no mete ase. Enti I will be able to better address those omo yedin. Omo switch them no down.
And you answer my question. Me say currently what is the protocol for emergency trauma in Ghana?
Okay. Order me bomb.
In Ghana. Please be specific. I don't want to.
Doctor, only Ghana to be a doctor.
Order me bomb.
Who bet so only Ghana? Who knew your system? And I wait to make a question now.
Meaning system, me back.
As I said, we saw Ghana on your emergency response for
emergency response. What is emergency response? Emergency response a collective effort. First of all, ambulance, fire service, police, emergency response unit.
Yes. Somebody came in an accident and he had the number. What is the protocol to that person stabilizing the case?
Okay, stabilization of the case, no. Say, we say, first of all, no. I was saying, and I make a say, on say, the way, say, man, what the two bus, let me teach you. The way I practice medicine, Ghana, is different from Abrochiro.
I understand. That's why I'm asking. Ghana currently, what do they do?
Ghana. Me
I'm asking Ghana, dear. Currently, what do they do?
Okay, currently, no. In case of emergency about right. First of all, no, the nurse no needs to stabilize the patient. Also, no be because will be better when you chest pain, when you angina pectoris. Angina no crown is it stable? And I say is it an unstable angina? What's the mechanism? Protocols now in place, no. Nurse no only training the pain baby because a do baby. What is the pathogenesis? No, that angina and deba is doctor never manas the root cause analysis. No, on the manas a bit my day. Administer nitroglycerin. What is the mechanism? But then no, Ghana the way training nurses is different. America you training nurse no see and your manas say. What is the mechanism? I go to training one.
And you no cry. What's this emergency like accident?
Yes. I don't know if you say Ghana
but specific. What's it accident?
May specific. That's my issue.
Once it's an accident by Ghana, we call everybody.
Accident by Ghana. All the medical team. So be able to
clean a crab movie.
Yes.
Starting with emergency one. Teach you one kasano. Yen try say emergency aba doctor bi any ward nti yen hwe ma no there be. Eba na say omo bedru a even cleaner or hospital ho kan e friend baby.
On who be Jim, yes.
Obia or hospital
Also, what you say, Emsa Muamu Casari, Emsa Munimun Ghana for Ghana system as
Ghana system. Boga, some of my head more
and so you hear oxygen.
Yes, you are civilians, every hospital, open your fair idea. Erama, what's to say? Oh, dear, Doctor General, Erama, what's to say?
Accidents.
Marty, you, that's about
accident about hospital. You pray for help. Who call for help? Obia clean and procure hospital one kanu free ni. Enti no obi kuta form a offer free. Nkofo say doctor ni hospital one obi free doctor, obi free nurses omu wo fie. Obi free nurses awapon. Mumra na mumbeboa. Enti wo your nurse na wo ho no you don't sit down and wait for a doctor so umra no ma attack. Or emergency aba. You start with something. Obi bleeding. Or one arrest bleeding. Obi in kasa obi come. Your own kasa no obi or no ma. We bleeding if you baby a MPM wunhu. You hear oxygen. Nurses start with oxygen protocol. E hospital bia. Yen train doctor say omra no start oxygen protocol. Nursing is all about protocol. Accident to Roma. We bia ye be answer na doctor ba sana you hear theater no. Akoye the cases of doctors. Tutu nurses yes tutu.
Farida, what you down? A down by area of hospital, but one by walk on your bonnet. Also, guys are rough for both nurses. No, more
anyway, so babu nurse no because.
Oh, Farida, and down
this year, Manenkasa, you see why I asked the question.
Oh, this year, the Manenkasa.
The when you open skill. Nurses have come. I'm a bleeding, I will bleeding. No, I stop it. Unless when you're internal bleeding, or no cover started with oxygen, vital signs, and some doctors have a fanako theater.
Do they do it?
It is the nurses number seti bibia up doctor by no shatari kuta second no ye juma. If you hospital juma, the majority of it are nurses.
Thank you for saying that. And until I before no, this is what I say. One they were so much interested in and a card and they have to do emergency. When you bring trauma, you don't need a card system.
Okay. So there's a lot of patients. Necessarily we follow traditional line.
A lot of John Doe a friend in a hospital.
And I said, Ghana and I'm a
no UK, but
UK also UK.
Pacho, and I'm a person me cast me US home. So we banner say when you're unconscious, no one to mean don't mean can shy. You name the person John Doe. In Tuko Hospital, there are a lot of John Does.
Oh, sir, I don't see a code US home.
Yes, in Tuko.
You don't know the person's identity.
You don't know identity. You just name them John Doe. John Doe now, my friend now to say.
Emergency bar.
Yeli that's and your nurse for the photo. Yanchi, the actual
is bad. Emergency bar, nya fe na kofa records any pana bana fe na kofa card system. No. E wonu twani nyina agu.
Thank you.
Later any pana almost stabilizing no and so now the for the process of onkoje card akohwe ne records ne ade. Ena
reason mistake yeah what platform
know your condition. So what I say who the emergency Ghana nurses bibia and Ghana nurses krano adia ye kire wo mo no enye bi na ye kire wo abrochire because UK nurses no ya chichem in different categories into obi nurse or UK so on onim category kra pass Ghana a general nursing Ghana a general nursing yeah UK nurses go on
means take cannula crowd.
Okay, the next 2 minutes. Situation now, so what do you say?
Ma me da se pan se menya kwenya we se me hye dia me fa mu e fa sa particular region hospital no
ebesi nne kra me gususu enti me hu dia rafie enye se me support you enye se me support dia rafie me midwife ni am free Ghana because of what happened enti me ntimi kra mpatese bi me call me sister courage kwa we ho no ko ne antenatal bibia wo me hwe me sister mato we antenatal book no ma entwa yie de ekoso mu eto de bi on fa nkyere me ade mia oba ho a me ne nte nti se me hu ana mafa na mahwe me kan ka me sister rage an oto aso call na me ka tin so sister mo munya ucs osi do ka meet me awo sister condition we be bia kono mo munya cs awodu ye me sister mbom ya manye pa na me sister atam ne bag ni bibia courage hospital ono ano nante call ward no okọ early stage kra no ni kunu call ye de betia ne omo ma me sister ni coach labor for days so ye friend me sister so na ye ntene nka sa na ni kunu ni so se me sister ni se ma omo frɛ yansa. The doctors told him that he can give birth. But me so me a midwife, seeing the condition, me say sister, uko CS wow. But they gave her false hope and all call ye. And no crown to any pan call ye, I won't be moons any pano. I didn't remember. I was a muchana muyi. Much my sister called labor into labor for 3 days at that rich hospital. And ni uterus pie, Mudiko theatre ko ye. Mode ne baye, ebusiane ba so ye kwhwe no musi dabi. You people didn't allow any of them to enter. My mom was outside. Oh, suye. At the long run, ye beti and say, Mose my sister we say funu and I'm the breye. Ye nente, the last person who ne pe ni kunu. E funu and I'm the breye, ancha wow. And a rich hospital, doctor, ni met me a bonidin. And I say, oh, dear. Rich war sponsorship be ye de akwala ne beto so enti mu de mamu nsoro bibi ni a na ode nkrata ne ma mi anti bi sa time me sma wo fresh am wo fie na ode nkrata ne ma mi anti bi sa na it was the cause of death na ode amano onu so ni ma kenkan no fi said was the akwala no scholarship enti ye be bie mu wie na ye hu ye no mo si okay ye sie mu ni wi that was early this year January asema wo na ye sie mu ni wi ye call back to Ridge Hospital no Yakoye no doctor ne say oni ewie wanka hwe ogina phone so ombra na yehu ni kra he didn't even come to us. We were standing there when he walked out of obetwem when am yan say doctor ni nye ye friend we mfie no twem koye. Ena yewie na yesi ye pese yehu panyin no. Do you know that they prevented us from seeing panyin no? And I'm catching said the hospital na me ya bodam. Even his antenatal book CZ book no the book was with them because they know what they did in the book. I told my parents that make sure my sister book no enko yenti fa book na bet me atwe se hu bibia yes hwehwe book na book no wom ho ye friendness we o se ye de akoye ye de koye review na me say masa unkoye mu review or whatever na enye book no be you just need the photocopy give the book to us. They knew we would take that thing to court. They knew they knew, so they didn't want to give the book no so doctor penny and also okay they call they didn't even call him. He said that day he was in the hospital. Nobody called him to tell him that there was an emergency case. Say they even hid the case from him where into Yeba hospital no more pamoye no more pese or bet take case in the crama or maswayashi.
It's also
baby
beauty falls under medical jurisprudence. What you say? Medical jurisprudence no negligence now we say no. Who is enforcing the law for them to to be punished?
That is it.
Antenna was on no antenna no.
That is it. Me say, the only you have to name who rough issue and never can me so now that trauma. My sister 29 years
Beauty. What sister ANC card no? What me explain it what sister the reason tia we here change of hospital and I say reason tia we here CS. What me explain it?
I did. My sister knows me this bobe bone kakra.
And so on so I asked them.
I did, but when he goes to the hospital, the doctors convince him. What they are saying, I don't know what was the issue of they preventing from doing CS. But then now, when we went to the hospital, no, to say They didn't show
because
abadaye
you don't have any documentation to prove. Say, also,
So
electronic medical
say,
record no.
the entire when you say every patient, it doesn't matter the condition. As a patient record, as a G.
There is a all documented BBR. I say no. Also, Oko we say now. Oko note na clinical note now. You go to counter, right? So you have to document everything. And oral document here no. Then you sign on accept. It is so sign everything now. You know what you say? Oko you know. Note now. I bet you at this time say no. Oh, now we are so there is
usha book ni mu a they share me ani say omo monitor labor ni sa na labor ni ko wie wo CS ni. They didn't indicate. Later on na yensaka book they didn't indicate say labor ni ko wie CS. Omo ye note ni say they monitored labor and the person died. They didn't indicate that case ni ko wie wo theater. They didn't indicate anything of that sort.
Okay.
What's the book no na indication here there until no here CS.
O say
who ni book no. Na indications here there until no here CS.
I wouldn't want to spell that out on social media.
Okay, so point in me ba. And the same rage hono. Obi the rage akoko. Wa wini 3 million Ghana cedi.
Yeah.
And within week case this last year.
Oh, this year. Uche,
yes.
No crown. Why would ni panic court no? Unless nipa no we no I mean a person of influence. What's the make can say? The legalities, the fees and sanyo man. Any person crown bona. Also Ghana no.
And you say I'm too court and amu. Yes, science book no one person with the letter yen sakaye. Ya kofa lawyer no. Sikana all born. And o catch say ye bekwa. Was a Range Hospital is a big hospital. Win case fala. And yes,
you can win, Papa.
You can win. Simple. One
yes,
win. Seriously.
Anna or boss Sikano. So the family were contemplating about them, and maybe they should go for it. I told them that I'm a healthcare provider. They should let us go. Young court in the basic BNCC. Mechanical about in penny for
lawyers crana they will
blah blah blah
percentage.
But seriously, on this particular case, and the lawyer and catcher saying nipa newu into no a CN or see a CN so need to be very difficult. And ko we and I was say ye
I know the country uti a system na affiliate because patient no ne record no say electronic medical recorder. Any power we bibia take ye bia no
and doctor, do you know what I noticed from a ANC book and bufu ye kese opo ANC bi omo hwe na that sign stage no omo mbo omo sign wo nti nipa no hwe ne kra ne sign no that is not
that means that ye free be on say all the documentation should be attributable need to so utesia I was say who nipa or signing that document
when medical record in her book or her medical book, cause of death, Nipoyan Saka, and yet me say na ya bibi. And on matro say, Obi standing in for CS, was a doctor Nipo me beboni diwa. Or no was so yes, and Obi standing in for no. So that was what. So they were hiding all this thing from us. Me catching me parents be as a young hospital, they are not willing. But seriously, maybe they have to now and they made me pay scammy case near the 5 years.
Yes. At any time.
They will rapture uterus there.
Yeah,
yes, no, 50-50. But they can rapture the uterus no labor bed. But they never quit theater no 1 hour to survive. And he say be we for her we find no. CS in the 50-50.
Okay.
No
the aspirant. Oh.
Yeah,
the aspiring. Okay. Yeah. Videos in the course. Who have video in viral?
Seriously, our hospital system no munye serious. My yes yen can cray. Hospital system.
But still, still, 35 million. The same hospital system, so now save mom every day. So there might be a scam somewhere.
It's true. Yeah, and your money in per se, and your money in
right.
But that particular rich hospital, I think say if I was saying investigations.
As well, investigation or some home.
Obia the upper was our hospital. Obia, my greatest surprise was the nurses, the doctors, they were preventing us from seeing the medical soup. Let us say, question mark, why won't you let us see the person?
Okay, so this time around, no, so I mean, BBC is a facts social media, how which there's a lot of avenues of it media addressing the situation. So, more being NCC, obet at an officer, but 757 MTA now the story a brave, now me story say put a legitimate proof. You have a punching the panel by force. So,
yeah, scholarship near kola scholarship for muka nyo musi o mon kan hwe man nesi wan kache na me kache me anti say why a big mistake mukoye no all these things were supposed to be on documents wase wan ka hwe abwegwe twa fire so te say dia onku nipa ama enwumre bia yesu de bia me ka say nto wa wom
but in life, Crasso can say, yeah, can so. Okohe have workers no salary, or work, I mean, approach over crab hotel. If we are see a DJ any munan and nam, or the immunity. Aspiring. Oh, now so point in it here.
Oh, me de me rem na think say on him bisa protocols in Ghana, right? Me ko school companoche. Na also me juma companoche am say juma mentia. And to them, is specific to those hospitals. Before I said the ANE Kasiana President Kofobiano at the end of his term, they have something called casualty. So once I would do OPD, free confanochi run about one I would be an taxi rank, minimum said that's all what they are. Now Rema, that is where an ambulance is in. I know one yet the patrol.
I found Mammy Milton. Okay, Casa.
I know no honano and a casualty into one and your friend a casualty. No casualty and I say emergencies in the bar. All hands approaching via arrest bleeding. Opposite casualty no on your right. I want a casualty like theater now emergency surgeries accident and a horn crown. To wake cry Dr. Punia obey ye say what I know ye juma. Yes. Intino say a basana obia as nurses Ghana it's me suture. Even Oma no musha pink in the crown. Sometimes they are able to do that because Ghana nobody pays attention to scope of practice. So
just Ghana hospitals no nurses for no follow mum adwuma sabi our responsibility babo
yes and never be any kwanse be a nurse ye crown who is checking that.
Now why na mom do sa stage no wo hwa hwa your practice one yes
because nobody is paying attention.
Hospital administration because there's no code of we say conduct and one at the end of the day no on say American we say maybe before be joint we say commission. They come to the hospital, they make sure say, are you guys, conforming to regulatory compliance? What's the mechanism? And today, a leadership failure from the hospital administration first, and then I call health ministry.
And to know say a basana casualty hono, and no more try to arrest bleeding. If you are bed stabilize the bone, be a here, say a call a theater hono, but almost stabilizing and sana. You're really end. Tell me, OR nurses no swajimo. So until your hands-on approach, never other cases is sebia will be a banana. Meme ko share school as well. Name ho by actually they brought triage nurses. Triage nurses na your ma. Omo be determine ni person ko doctor right away. Wo betimi atena ho kakra. Wo betimi atwen. No kakra no. So the triage nurses no. Bypass yen kwaje card no sane man say a bus they see and need says and nipa doctor no right away. They bypass card system no and they say be a could line or consulting room you might show right away. As nurses we use something called ABCs. So airway, breathing and circulation. It's a one show and sana. So what banner we ya now betina ho a obetina ho sa ba obi wo asthma no rem na wontimi nhomia ye fra bibi status asthmaticus just say one man aduro kra nya yie na say e bia nebulizer treatment ye de man na so nipa no rem na triage nurses no e be fa nipa no e de na kwa hu doctor no right away. Men like I say I'm saying baby the American no is specific to mostly confanoche. And later on, no, I see as accident and emergency na a war at your no, a barrack side, no. They divided my home man said I knew but they divided it into a beer red, I think yellow and I think green. So until red being like very, very urgent, you know. And it's still now not triage system, you know, a year juma medicine will be about brochure bemu catholic goes to the scope of practice, you know. So into no be in America, say your level of nurses, your LPNs, and your RNs. Ade a RN betimi aye no. LPN intimi enye. So some simple dressing because say a simple dressing. But because say a central line e kwa wakoma ho no. Yeah, my level LPN enye, ye be my RN no. And I dressing because of technique, infection control, and it's anyama. Me mo me as will be a my nurse or Ghana dam. Yeah, na me ya. So moody nurses at Tamaya. I have to be frank. So
before I will be free Ghana no. Na already mon nurse for now na ye can be competence na more competent na say na ye mambisa.
We were very, very competent.
Very competent.
At the end says so I has me a nurse, right? I do nursing education as well. At the end say you have continuous education. We have in services, we have customer care in service. Today a whole thing. And
but say now work Ghana now to be say nurse for negligence.
Yeah. And then there is true. It's true.
Now and question na more bad attitude. Most of you bad attitude.
And most of us, we have very competent, compassionate nurses.
All this year, the all the woman say, Uti. Back in the day, no. Not nursing school, we say.
Nursing as someone think I'm
a question because I'm not complaining about the attitude of our nurses.
They want to say, audition. They won't me patrol.
Doctor Nyabotre.
The guy who money in the point.
Doctor Nyabotre. Mama obey no Uncle we are on Afi Obiaba. What we say before I sana be free Ghana no hospital na one. Reporter na nipa nsema ye kan fam no. Ya sheda na ye kuku store.
No. It be true. I dare they say the perception about Ghana nurses and say you muadi, which is to some level may be true. Maybe also me school conference. And I lived in the hospital. I want to met for 3 years. And so me kwa na me nurse, me student nurse kwa no. Ebo nurse bo house no say obekwa akokasa no. They will be treat too. It be very, very nice. It be a well knowledgeable or may competent. So I remember say Dr. Bikachem of a nurse be down for just because there was a sickle cell patient to be our sickle cell patient to be our buy. Also buy no in crisis or share no doctors in the first no and say or insert IV and or handing IV fluids to keep the blood and all vessels in the patent like say and clotting who's a message but so until people are competent, they understand protocols. So
Mamusa, there might be a time when nurse ni pa want me perform CPR. What would be happening?
To be honest with you, me work a be who confanochi. So I was a nurse there, but at that time, emergency response when it comes to CPR it wasn't something we were so keen. I have to be honest. Me and certain knowledge. But as time went on, my first encounter with CPR was American health team and mobile and how to do it. But it wasn't really part of the entity in nursing school.
Okay.
So, yeah. CPR, minimum certification, so I have say, me every 2 years we have to do CPR.
Basic life support.
So,
listen, boss, me can be na me drop.
Mama can be na me koda
I fair idea of a man on way me bawo. beauty now so ka de wi an doctor guy so akasa na mako uzo abwajo
na me say
yo okay I'm fine maybe also beauty kasa kakra bi
nurses ne specifically wo so ban a ye de te Ghana no ye mu binum ho a enye so ye kwa abrohye ye different. Sometimes we complain about salary, but sometimes me hu ni say ye nipa su ene ne ban. Me kai time me year service once a woman hospital nurses ni bi wo ha the way obesu di clients bi ni relative atem me kwa me jona me ra ho.
Wow.
Awo ende ampa o mu to me didi o mo atem papa na clients so di mo to no their first so. But the back wa me hu ye ni say sanka ye private hospital na ye wo dia anka nipa ni di ebufu ehia wa anka obeka say oh madam me pacho but san say enye ye di enite no o di ebufu ba na wo so di ebufu ehia no
because e abadwuma wo fa hu e abadwuma
so even say ya ton ade mpo no bi di ebufu ba o find ways and means say oh obe krokro nipa na manakoma ba but say enye wo dia na nipa ne de ba na wo so di hia no me wo ye same attitude no ye kwa abrochi a ye ntesa bisa ho say
ono be yiwadi e ono ye report e be yiwadi
yes the report
me wo Japan no me hwe na no me yare na me course so me hwe Ghana hospital system na me timo say there is a question mark from the ministers from ye just from
that is what I wanted to talk about. So,
even to yen nipa na nkasa attitude nurses na kasa your problem and yes me wo mu bi me ye tie free ye wo problem papa say o yale na say wo baby na say wan kan kire mo say wo ye nurse treatment ni different na no me catch madam for be say onyem or ko we ma ne kan kire mo say
na me ka kire no yeah onyema
onye me ma ne kan kire mo say ye midwife okoye ba o say hey Sophie asema wo kan no komisi yo me kan ye nkrofo asema mo fi say ebia me tan yo mo ana bibisa but it's not that ni nyina ejina yesu ni ye ban wo hwe ne aketua ni so
and what the mom say you never generalize it
I'm not generalizing there are good ones
abuse is not
the woman here say
there are great nurses around
abotre me ba to ye doctor now so correct ni bibia na wo do
me summarize bibi the woman say Ghana nursing school no on say nursing nyina be dintinti mine somewhere around 2005 more time akofo e dey say you buy single spine we ni say anyoma right enti the woman say first no obi wo ho a right oko nursing school no onim say e be man allowance e no obi oba be nya adwuma. So the person, no say when they're calling you, you need to be very, very empathetic. Empathy in such a way, say patient banana tier ya, so what would you know? As a feel crumble, say what I would hear them, ebeyoya. What's the we could call Tioya? Most of them went in for the money. And to almost a school now, who say, what's a scanner? See a mouth can now do to us, you know, I and aside request, can be answered again. And to one come because say you were so passionate about the profession. Can't the make an answer. But we will come say with the hope say sika wom na we school abenya dwuma. That's it. I'm telling you.
Oh yeah.
At the end of the day no.
Yeah, doctor kan dey no kure na. Ye call training college ni be na work class so nursing and what's up beba.
Yeah, me ba. Also body. What name can be cry? You so Graham so also body.
Hello. Pacho me wa hase.
Yeah, me kasa. Okay, Graham.
Graham no. Pacho.
Also body. Me ba. Also body. Mr. Mami 1 minute. I lady on. What did I say? No, what did I say? An over to.
You mean me or him?
Graham, over to.
Na me last person to obesha me chidi no so obeto me no.
Aha, nti Graham me ba why? Uzo baje. Wadama share the situation on mami nti do buy.
Kakra bia me kan say bia kan ewum. Ya che ya adwuma fa. Ya hwa de wa ha. I'm saying bi mo ntia see generalize issue with the whole nurses. Ade ne say nursing no eye call. also unya obi a unya tema manipa ansa na akora that field no
why na yes justification at all
uni say nipa ho ade na akwa nipa yare say nipa ni hitua na facial expression kwa na say therapy man no we are nipa be kasa no say therapy man no reception abe nipa no say therapy man no e say me ko hotel say my brem ko pe be ada na reception is not only attitude or the man no kire me hotel kra me ba beda
okay
say headache am hu to nurse in some reception how the ma patients no e say a created that kind of therapeutic atmosphere more you all fall under that category na enye say wo ko ho ti the moment ade be ko you be fra mu nyina inti men ko ho ni say wo disease be spread that kind of bad cancer na men ko ho no mokora enye wadwuma enye say wo ko ho no ene bi men komo edi be say hwe free say what was the cause of sankomo ya no me ni wudi nyina on say me child Ghana 10 years.
Okay.
Me knew obi amana be supervise me da. There was no supervision. Obi ensi ho. And make me say likely say nurse and so na tie ho. Cause yenya yo teacher training mu ne fa ko ye. But what you say and like say because ho say panyi bi ba ya obeye say oba behwe say obe supervise say we ni na ekoso na. Me nka be 2 years ago. Panyi bi more national health or say obi ne ba ko kasa o menhia hospital man go from oba hospital be didi nipa kro natem obi aka that case na
oh yeah
panyi bi wo ho a
opoku mensa ne ba doctor ne case
good me sanka panyi bi wo hanka proper supervision bi ko a ko solve that problem ho but there was no proper supervision obi apa bia no ye nti I go to the sense especially with the government as a public sector no aye cancer wo honom to make you untouchable ene bio kuna ye film no ya create atmosphere bi say adwuma bi de omuhunhia the special value be to say adwuma no so ye per typical example a nursing ka ho bi ye per practical example ye and ye Friday be career day ye career day adwuma be no bi apesa ne ba ye adwuma be ne ton ho ntare wa bonten doctor nurse soldier and e commonest ntare a be hu abonten because ya create atmosphere be say adwuma we dey inti ewura ye nua man mu bi trim titi mu run nursing training a ti be kan ya there was a time and my baby now grew nursing training no major my boyfriends could they feel say what true level be a boy name fatana me say o mama ko nursing training will testify ko be na me kira de na nursing training ti ehun bebe na feel say what true level be a boy no no kwa no and satisfy no and there were a lot of unnecessary competition obi ko feel say the boy enyusu car inti obedini beja obi ko feel say boy bia ba be pem na me mpenu ba me ba ha ne de and nam say boy enyusu car inti me twama no ti eno sebi anfa omu nyina o efa mu bi na omo ayefa omo no sangofo na de omu suban ni be wura adwuma ni mu no but na enyo omo calling ebio do no se mu se ko na efrim no adwuma bi eno ho ti se ko teacher training at least nursing training we are posting da honom ti sangofo na enyo omo calling no ma ba ye cancer wo institution nim aye career opportunity na da bonte ho no anaso we are pusia ma na eno akona na nsa akona no edo duru nurse na mu enya ne calling se wo pe as a high school teacher na mo gan you nkro be bra me kire o ma de mu run nurse ma me bitim say mu say this nkro mo fata so me ya nurse for there is no way as nkro we ya nurse for but I know me nurses there was no way yes me do matemu no ko mu deserve come ko different field ko me show mu suban ya no mo de te wona o mu hia so mu ra nursing institution hono by ya form obi also protocol na de room obu ha sabi kaniti kurewu papa o maami dibianti ye de na wuram ni aye kai kuma wayo si ba 5 months we because nurse ni o chiro do control 5 years akora na doctor so prescribe 5 years e ma akora no e na akora no okọ akora no ko ni wiase bio a lot of examples of even a private hospital kra me am call kra 9:45 na lab technician meduru ye na m catch nurse was me pe manager o hwe hanom mo say ha ni manager am say panyam our friends am say me no and so my appearance now me ba be ye me be logic complain bi after mo so mba and am say administrator ko bot 10 or me adwuma and hand deserve say hospital yes say fra hospital minim say nipa na baba no mu di sim because mo say me ba be report bibi o ko lab ho no na nipa be 20 go no technician ma me ko confirm not to say me am offers last year me ye sure say ma anye ko abana ga ko na wu e da ko na ko to hospital be 2 months yes why anemic the humoje nyinare ya be na lab test e da ko confirm not 2 weeks not reporting in degree on the same G receipt na me free after the pakwa no ponam sa kwa ne to bibia to akwa na I will hold you guys responsible and so no mo prema that the name no mo free say the report na akwa komom so this is the country we come from to hwe me nsema me cheche nyina na e sha say free e soro ho no hierarchy e trainer pro There is no single institution okrumo here adwuma okrumo. But me ko okrumo the minimum hu no. For the past 8 times mako okrumo, there is no single institution effective. Until we are say do 2028 no. Year of 1456 so. Tina ye kaka da semu no. Me bo bi kroma na me ye ho a minimum. I did come in, so within 5 minutes, ambulance near you may find your comparison, but Obia Musami card be even though not me by me, Obia Musami card that second day coming like cool. But I didn't see the idea to be seen there 2025. Yeah, that's what getting a card. And no cross as a watch it. That card hospital Cocobina. Nice hospital. What you say? Wako boka but ya saw by yari, ya saw yari, ya saw me yariamo. You say be in order. As watch I know could be 6 months. We are 6 months and I can't survive what one. What about Kakara say? Ya show Banama. You must say I bind the entity say. I bind the entity say. Obia
to private hospital now walk on. The same doctors na neglect
Anybody over say Ghana ni over 40 million people say 35 anya no kura over 40 million people nya system ya so na ekura kura omo abesident no na say omo ye na system no survive no
that say we are say konanim no na nimde eba but now also find a solution to address the current situation but what you say but by here the net say we are say konanim nimde eba they still kwa na ye ko tina na ye dwene card ho no. Last me check it. Next, currently, next could be a patient 33 or you come friend Ghana. Next per patient ratio.
Okay.
Next could be a patient 33. Obeda yes, said mom na yi.
Asama wa kaminya
I think
we should allow him land until we are then we interrupt.
If you should hold on, be blame the shas free. Ya careless, no proper supervision. Ya in fact, there is no single institution who come or bit say this institution is working effectively. But I'm also on fairgrounds.
Subana yenuane yi na de no kuro mu ho ba bia wo no obetima ya sa de na de oye no wankasa wo jeje ne say
me the rough here no it was a good call but a wrongful approach ade enya you have the right to say it but approach no ko na enya mame
okay
so me call hospital na hu ade enya no me say me pa administrator ne na kasa wona me de ko chiro nim
okay
nti wa ko hu bibina say enya so wo hwe payin hierarchy no we na me we me hu ha enye to respond be free payin about na so bu how you react I will just pick a phone say nurse na be sick me the camera to na so ablasa me obi ehunu panyibo ha na technician ase wona me anka to me a me rehwe say me ko lab technician ba me say me pe administrator cause on na hye na se eyi na wo no ena me ka say ni say na wo ma na ye die na wo ka fa wo hu ana ya response or the be ma me ena me che me less lying actually but me twen phone say hey ana nurse for my yes my so report ma panyi wo
okay America so won't me just add no
you stand for your right, but what is going on? You mistake. I mistake any pan here. No, I was here trainer for your trainer so
okay.
Okay, so the thing is not yeah, it can be about emergency and the hospital and all that. Indre yana me de me back emergency here in Canada. Indre yana me feel emergency by. So me call hospital no na me ban uswa she's less than 6 months. Yeah, and na home fano until you call emergency. Until you call emergency no and you sign in yourself. And we are now call some nurse beho. None will be so reason then now by then you go to another nurse and you will be take your vitals now. What I say? And so no take your vitals ne be no who say no. The way I cried why is so bad. It one J Yimpo, when beside a health card, here, I have her health card. She didn't even ask of it. And one was, you know, she's so hot and she needs rapt attention. And one of my Tyler no, or attending to a crown and everything. Before class say, and some baby say, we card away, where do you stay? And things I say, about telephone number, or data in our puliba. Yes, before say, I call the next room now. Makobo my telephone number then my data and I know you still live here. Her dad is dead, her mom. Yeah, me say yes. And sana you okay. Sit here and sana ye be emergency room who doctor.
Okay.
This is the entrance of the emergency one.
So hold on. They make sure they get exact information.
Yes.
First aid.
Yes. Until hona they attended to yen. And sana yɛde ɛkɔ share baby say because oswane ntine ne kwan sɛ ɔfra mpanyinfo no otherwise she can get contaminated and all that. Ɛna yɛde ɛkɔ share baby and sana yɛda abɛbobɔ din sɛ yɛmbra inside who doctor nti ɛhɔ no osan so kɔ inside hɔ you go and wait before they will even come and mention your name to go to the bed. Now, that's why I train doctor no. Do you get it?
Just not just systems.
Yes. And when him say, if me kuno na kran, they were like, no, we don't need you. She can just go with the mom. So you have to wait. Her dad has to wait.
Okay.
And they are not allowing you enter.
Okay.
A door no nurse ni nipa no access. Oh yeah, then you room. I said no. I need just one person. You can't come in. And I make catch and say, oh, no, I did a surgery before I gave birth, so I'm weak. And me kuno na okita akwana or they were like, okay, sure, but me kuno ntimi ntenase. The chairs are for patients.
Quiet.
Not for people who came to escort the patient. So he will stand and patient will sit.
Okay. Straight instructions.
Yes.
Yeah, no yes, your patients no beko.
I am a health personnel.
Where you swap?
I am
the
a
next
health
available
personnel
moment.
here.
No, 911.
And then when I was
around
going to school and all that. Please, was somebody talking?
Yeah, the diagram yet you say I'm it.
Yes. Yes, say patient is always right. If a patient is being abusive, you try to avoid the patient and go and report to your supervisor. So on then Brambekasa, they have a way they'll come and talk to. You don't say, and may your health work and ye did attempting also be did in attempt. No, the person is sick. Imagine you are a nurse and you are taking care of a dementia patient. I remember one time, dementia patients be or say nurse ni bi abono. Am I afraid police aba? Police by ya. Obi some say na police ni be den wa ha. I don't see you said she was beating you and she was being abusive. I said, no, I haven't seen this nurse before. What I say? Nah, you know. Said I touch him okay. So they don't even know what they are doing. Also, when you are around the things you would do, you won't think about it.
Hallucination.
Oh yeah, health personnel.
You have competence, no assault. Oh, as a nurse, no. Well, this is America. You have the right to call the cops on them.
Yes.
So
if the person
dementia, a very foolish case. But you know what? Competent in the mind, no assault.
Even assault, you have the right to defend yourself.
To call the cops.
Now, you see,
Graham, question is who said you know as a Ghana no we can be who say we no who Ghana na ka we nurse ni a
no Ghana me also for her so sorry
enye yanko ti yanhwe say who say kwasa wo America there why let me use the word why you too conversant with the system or polish with the system but who say you know Ghana no who say adana me nurse na ka say ti am ni buafu was what we kro onwe eno no wo no wo difference
there ejuma wo abi I say ha say yembo a hospital building. I was working at the ART clinic. Let me check AIDS patients and STI near you phone. That was where I was working in Ghana, Accra. You guys, they've been mentioning the hospital name, but I won't come on.
Oh, the money they would come some crap.
When him say, when a patient, me call one or muchim say, patients ba na se ne card they don't have to pay, it's free. But na nkasa almost na she wa ya ketu anya no de obey any free masa ya jina one side do nti de no fi na mkita be 1,000 Ghana shame. Can you imagine
corruption?
Yes, that is the thing.
So our attitude na essay is
one quiet nurse o didi ubetimi de akoye nurse into when was na the next option your nurse into Okoye, the person doesn't have any compassion, any idea, or name the Okoye. He's going to be a nurse because when Chawasi and then my main person bets in a feet, Oko nurse binye. Neho alawa ewoho. You get it.
So you also as a you being the same profession, also ni pane side for no ya say nurses na wo ban be bre no ha adwen.
Yes, I agree.
And the doctors are also the problem in Ghana.
Yes.
The doctors are also the problem.
I'm not saying nurses, so they help us.
Mania. Mama yenhwe na yenkas be kasa na mesi. Edu baby mama ya appreciate Ghanaian. Edu baby.
They help
us. Edu baby mama appreciate Ghanaian nurses. Because they are overburdened. Ghanaian nurses, they are overburdened. Even Ghanaian nurses, they are overburdened and less resources.
One after the other.
I was just talking about the system here.
I mean, question and Busan. Graham. Do you sure say why? Wo ka wo mo ho no mrane ade wo yeso se ka wo nurse ni wo Ghana talk 1 minute ka say na we see ewu.
If I was a nurse in Ghana, me naturally I'm a very soft person. If a client is being abusive, I'll report to you. I'll go and tell Ubia or ye higher chain say this is what the person is doing and I don't think I can handle this patient. Because me I have said me say if a patient is being abusive, you call your supervisor and tell your supervisor that, hi Chris, Mr. Smith is being abusive and I don't think I can work with her. So can you come over or can you send another person over?
Na Ghana Kumase a hospital be or Accra, Ghana hospital no over report on my wine.
That is the thing.
Ghana nurses you what ranks in the ward where you have your nurse in charge in the ward. So you have somebody to report to all the time.
Ghana so you report.
Yes, you can report. Yes, you can report. You can report.
And the video no. Nessa come omo ye dey omo report emma so omo report ana.
Yes.
Also report to my
That is where the problem is coming from. The person should have reported.
Madam Graham, Pacho Oka Sembi, I want to say that, and yes, I say, say one pass was here, you can enter into nursing. And
it's not true. It's true.
Grace, yeah. I have your categories of
family members. I have a sister, let me tell you, my little sister. Let me be honest with my little sister didn't pass was Yamani nursing because
private nursing. Want me fan confirm
it's a private nursing.
I was just listening and I'm like, what am I mean? No one can
right.
One to me fan nursing.
It's because
nurses are very intelligent.
Less resource.
One person. The warrior government or public nursing and also private nursing.
Oh, like we've made her stop because any passion.
No. Me person who's a baby anka or be private and over public.
I don't know about the nursing system in Ghana. And
Yes.
yes,
Graham,
I don't
Graham,
know.
I
I
mean,
want to the American I say, me
make definite statement say people can
you see on
tend to this
her.
why.
Too much. And too much.
Health personnel now more ebia make us say we senior nurse wo ho ne unim de sisi e koso wo Ghana the protocol
just say obi am pass EMS
protocol no or this category of we say nursing I so be I say oh and a protocol to medical school protocol na e wo ho ne say protocol no untime nkofa bia 08 and 10
you can do it. Someone can
No,
wait dear.
I'm
telling you that
on nurses over here, but Graham, what you are saying here?
Just say so good grade, na good grade ah.
When you good grade.
Mami can say be trouble. Me and me city mates are medical nursing training. Ya ba ya ni grade nye or the protocol na ba ya term ni be wie no ko ofie.
Baba, Nya kwa validation ba na o great nya. Fi. Obu ko odwane. Nya kwa validation ba na o great nya. Obedwane.
Meba. Results from the results.
Jinya say obetimi akos nursing with fee paying bibi sa ho sa enokre.
Yes, they do fee paying.
Fee paying wo but enokre nya bad grades ah. Say you were great.
Oh, this I cannot say.
Nti ebia na ye fa to grade 8.
Question no.
Meba.
Ebia na ye fa to grade 8. No be nya grade 10. Grade 10 enya bad grade. Ubetimi to akoye fee paying. Enya dey wa failing
student no enya grade 10 enya bad grade o.
Enya bad grade ni dey koye fee paying. Ebia ye fa in the standard near grade 8 but obi nya grade 10 to ebia 18 ye good grade but this one say 8 for the doors so school na ye ma
okay
so who know nya grade 10 to 18 bet for ye fee pay anya say wa
me pacho wo
meba mami ni
aboche pa ye fa good grade average student na ye medicine average student Ghana you bet pick good grades for medicine
I'm a fan. Usuzu say yen nuan meti abroche no e denigrate Ghana system no too much ana.
Serious. Yes. Me who say sanity. Serious. The way you see kasano. Ya mana is say abroche no say one bibia right.
No. You see, the reason that you make kasano man kasere and obi interrupted. I was landing at some way. So I think I have to land. So satisfied with what I was saying.
That is it. When they one pass, nobody will pick you in lesson.
So I want to land. Okay, I want to land so that. Yes. And a BMI, me person me cancel. Emma, Ubia and Drinksy, Ibia. Yeah, what diaspora has said. The nurses are not rude and answer baby. Some nurses are racist. You will go and
with the higher, my heart did the same one.
Your crew must have
the
whole system is not working and it's affecting the health sector too. Sana Ghana na ye.
The system that is not working, and then I'm not pressure. A better health system, so people are forced to do what they don't want to do.
Okay. I am Mama Mayan Casa say.
And then I didn't land and I got interrupted. So you can't just base on
because they are checks and balances and responsibilities.
Thank you.
Right.
Maybe I'm aspiring. 1 minute. Can you organize
a whole lot of responsibilities? Yeah, any class and so necessary they are less resource.
I'm a fan.
Nneɛma
I'm a fan.
bebree wɔ hɔ a ɔmo hia de yɛ adwuma.
Why?
Nso ɔmo nya.
Fan. I aspiring 1 minute. Mami tie the okana.
Ni mom dear, the mechanic say in my wish, the Ghana nursing, a bedroom stage be we have a regulatory body, a bed checking, not just nursing, no just hospital, nina.
The regulatory body debut of Hawaii. Anything that will health directives.
Yes, I know there, but yeah,
it's not working.
Yes, we need to enforce it.
I think I think I'll say a money
I'm just going to liken the system. I mean, and you know, well, I have to, you know, within every year to be at 18 months.
Mute yourself.
Obibeba Abba inspection, health inspection. We who said Dr. Guy spoke about
from a joint commission. So they came, they come, and they are independent bodies.
Me patrol. Say me na me kasi your friend JECO, Joint Commission JECO, or the state department in nursing homes. So every year, Biano or Moba, they spend like 6 days, and based on their findings, you know, they can even extend it to 2 weeks. So until you be Biana, you do it properly. So now let's go up to grievances. Bitte said they're not rough for you. Mimi say me wo as a nursing supervisor, and I said you'll be bamming chance say or grievance say yeah. You don't even need to see supervisor. No. There is a form. You submit your grievance. Also, we should have hotlines and nipa or more patients, you know. Ebe to me afre obi kra na only hospital how make a complaint because we are sometimes yenim say bibi obo the state department that working in because they received a complaint from a patient or a family member to be bibi so to Ghana there has to be
before I know my last question to you, how do you rate or how do you feel for Ghanaian nurses and doctors?
I think so they need resourcing. So one thing I make school in Ghana, they kept telling us here improvisation. You improvise. You improvise. I hire improvise.
I know what about you, my dear?
Yes, who be that?
So we used to so na edua da ho. We say okay, my main fed duano because me nearby, something like that.
Okay.
So it's a me use cap tenting, cap tietia or me no say mini cap tenting, but me use cap tietia sir.
No sir, the requisite tools now we say equipment no. Munya. Yes sir.
Yes, you obukum so be in hospital.
I say now say I will never bend down with the bed.
But the aspiring won't say this side of the world, yes, you're lucky health workers. I don't know if you can say something about that one too. That
there's also the side of the world saying.
Like, okay, so here in Canada, like this.
There's all massive.
Okay. What mom as far as
health workers and say a honoman of Yachim. Health workers no, and yet nipa no nurse ni anase doctor no, ono na ye bibia. Enti we wa obi aye na dwuma pepepe. But ye could no de nurse ni ba ko no, ono na ye bibia. Wo ye we nurse ni ba ko pe ye say obey si utwe. Ye say
obey general nurse.
Can you want to member do? As far as why we home, that's why we
me dear, me Ghanaian nurses, I respect you guys. I know you be I'm a nurse. You can't nurse for some me yapa. What I'm saying is learn more in like improve on yourself. Which Ghana so that more money.
Okay.
So improve on yourself and no say it be more how you can't nurses for some bonia. But there are people out there we appreciate you because me say Juma me and you been na Ghana me so a woman say be at my advance me home but like I'm a fan kind the responsibilities in our so me so say me wo me Juma me you be so want a Juma let's appreciate them. They can do better. But my young can almost so then sir.
Okay, me that's why. Me that's it. Okay, I'm a fan. I do so na me see so I'm a fan yanko.
Aye. Said the name the kind of person. Ghanaians they are less resource. And you might said the name is improvising. And you might be what improvising. Even I thought there be a glass crowd but shed their year juma crano. Na daniasem. And you do a be a ukobo be vena a hardly say abuchiri ha uba coin will be vain. I want a glass. Even cry and your man. And no maybe a wing ya crab you while young coffin say we the crew monkey and sunny the bear. I has a this a glass. But a honomono. And no my a year call a year was a year no. I'll be here and you make a gloves and I say idea unya.
But improvise. I am complaining. Sir, I buy provided all this.
I buy one. The other ban a cacrabi was it managed. Nti managing no na be ma wo adwen improvise ne be mu because who manage what I say
I teacher for said you better why I send me request or you are be vigilant I send request na you dey di honkomo I mean akasa
and they are also overburdened with a whole lot of responsibilities
aye nurses na wo Ghana no
make me come to
yes, sir. You might be going not deny over park.
You might be brave. Hasi, UK, a bed, then pass a general nurse, who say, or ye searching. Even cannula, I won't will be vain. Doctors, and doc, more.
Okay, you're coming to Matthew, or you are beating the casa.
Only one so about cannula, but Ghana no. Nurse in back and your boarding so your nurse near. Be a baby hospital be a year. This is the major and a doctor, baby. Because you who say nursing in one or so way. And to be BBS here near born nurse in Isobo.
But I America, you can American nurses. As we are more depressed than even Ghanaian nurses. I didn't hear more music. I mean, because of
burnout.
I don't say a conversation fan that day.
I do be a change of environment, you know. I do be a change of environment.
Dr. Guy can tell loneliness. It's loneliness.
Only one but Ghana no dear. Oh buy hey sister near compound house. I say compound house in here. Oba obi asene there. Oba na come the wa. Oba show them di in wasu. But Ghana no so dear obi next door. Utimi call hey. Oni nkwan oni gari o mami bi. I say why na akobo no kono so akope gari. I grow when you so cry. What I say?
I understand
now the life no is not about say oh my free Ghana ma come Jessica can say Orlando be this but don't am challenge
that loneliness no enye easy that
Sika de monya ba afia sat mu so afia mo say wild
the depression here
eduru bi enye easy say awa bai pa awo bebai na nkwan wo hye wo dem na wo do na ho
I'm a fan I want to
Daniel free system no akọ mo se ye de ne na moko
I want to one
atem ni a ye di wo mo Ghana yi mete ho a mete we na ya me ya what I say ye bibia ni a na de ahye wo na wa ye bibia ni na de ahye me ba ha na se me nya nurse nkwa na ma ye adwuma fofora me hu no se eno no kra ye en wa hwe ye fe ne say ye economy ye timu a ye ma a year 1,000 cedis a day na 1,000 cedis e beti ma ye wo but I say ye adwane for and now for so just say dan a rent na ne boarding
anyway I'm for say so called loneliness be any baby e mo character mun sika na to madwene ti mo nurses no
it's not true it's not
mo na almost environment mo na mo system no
Won't pia bonten so upon them street akohu obi. Awo.
Boys especially necessary meba. Now no yeko program necessary war America. Who from krom mfi o kasa kra anye unu me yedim ni nyina. Wo mo mpad of mo mpɛ bɛma bia e wo masha da yinom ni nyina wo boa.
Yeah, asem. We asem.
Enye wo mo.
Hello, reason.
Reason. Wo kasa mo mfi boys mo kasa
hello, reason.
Open eye na ade na so wa man ka say.
Why? Next media.
Let go back to the number.
Okay, I'm a fan, but that's why. Now, are you a pretty was for
I'm a fan.
I'm fan.
Pacho, me first me de manusi na me see for me.
Okay, Graham, wo first na yakọ him out. Graham first.
Pacho, my mama no ensi na omo interrupt na e look it say there. Maybe America say if they are Ghanaian nurses, they are not trying.
That
wasn't what I was trying to say, but I was trying to say that to say once in America to say Bibiana mi juma first to say oka de yera yes is any quite so utia but obawa no magis canon because still the salary and you know we no so ye de boa bibia no said the be salary number no na ejawaye okay otiase that is my problem with the system in Ghana because I have say you know obi mbeka nche say be say ana be say because na nipa kro no yes and the catch your boss say Mr. Say that is what I've seen that we more jiska of front desk no say and one ya be do say. Can you imagine?
A private hospital. So, a private hospital.
You get it?
Yes, because government hospital you for card. Into will be a sick and jaw.
Into one not what Gino Code. I say so. You're there, bet cash. Cameras everywhere. You bet you. Into I think the system in Ghana, they don't respect the health system.
But in 10, like let's say 10 over 10. Do you? I mean, who rate your nurses and your doctors? No,
on what? It will be some infrastructure wise, and I said
there be one more. I done the idea. Man, woman, to there. One more. Working approaches in. I mean, environment. No more.
Ghanaian, I would say that Ghanaian health workers they overwork because when they come here, the kind of jobs they do, the whites they don't even do. Ghanaian health workers are hardworking. Trust me.
Yeah.
Ghana for your hunam pay juma. Bibini be ye juma broni onye.
We fool too much. We overdo things. That's our problem.
Okay, you can also put it that way. I agree with you.
That's the way they work smartly and we work hardly.
Yes, so hard. The pressure in Ghana is serious. But one say, Oba has say, make us say, Bia, do ye card, do ye say, Ghana ho, ye wo, nipa na ye ni na, but Oba han say, it's technology. You just go and type your info inside now data ba. What you say? And you know na Emma differences between your health system and the Ghana health system. No, it looks like if you I say a brophone de omuni faults and a yenya fault. No, it's the system in place.
Okay.
Right. Everything boils down to the system.
Say Ghana na me ya adwuma
I'm fun.
I'm fun.
Reason I drew me so.
That's why.
Make a last one. Make a last one.
Oh no, reason I drew me so.
For now, we phone so.
Graham, I say a last one. 30 seconds.
The wolf for na me phone so. And I'm catch him say, I should go and see a lactation consultant. And then she would take me through the necessary things. And then I was like, hey, there will be a phone. So like, there is something like that. But make us say Ghana, it will be nurse ni baako. I say we, but when we call a man, or in the office, Why you relaxed? Do I in your so show be a only no phone so.
Na
say Ghana na me ya adwuma health worker.
Catch me you are no me you are.
What the coin? Ade ye de na.
You are no me. Me kuno no me na, me kuno no me na it may be bad.
Wa ma papa na no ni na wi na be na be o kan ha.
O kan se
Ina we kra baba me that's why.
Reason a dreams.
Ghana ho na
Meba ye I'm a fan who have you.
Catch you me free so why?
You me that say you better also tena ya ai yeah ba feed won kwa bi kwa won afi no ba feed te say
oh what me wi no wa me wi no
be ma we have you I'm a fan mama 1 minute na mama nti o ne yenko
all right say the here can say Ghana nurses they overworking no Ghana na me ya adwuma wo krase na krase wana me health center. Yes, health center. Health center na me wono. Oko shifter. One akoko yi folder. What I say? Uko yi folder abetena se abeye vitals a consult nipa no. Na we wako ayi a friend is pharmacy akoyi na aduro. E de abre no. So ube detaining na wa wako akoye obi bia sete obi bia na wa detaining no. Se nyame anya wadom na wo patient bebre wo suturing any hwan nyina wo hɔ a eduru bia wo so gya nipa na omo yare no ebi so egu hɔ no akɔ suturing ni other things and just imagine say nipa no or yes I normal we nyina at the same time na say oba hɔ na wan sign fa ayi ama me say one time be me hwe obi me consult obi wo obi te akire e ka kyerem say ma che e wo patient na me hwe no na de na wabetena wo dada na me mna me hwe no e de ba ko fo de na me ye
ba say so no ono no untimi justify because ono de onim de wo ye eye wo wadwuma eti untimi nka so oni na waka ne obu afu
onim obai wo hu se obi te hɔ a me hwe no
no ba onim na that does not mean say wo no de wo mfa ho I mean eno de say wo mfa de wo ka
enti ba ko fo de na me nye ne bu afu edidi matam ba ko fo no
je ba sa o reaction be dey e ba sa na o be say na be react a kire no
se de enipa bia obeye no enu abi na mso
Dabi unya nipa bia you are in a certain position you are in a certain
explain to them
no
my explain it to
question no that's the difference between baby a Ghana ne ho no baby a wo tisesi a no so say nipa na so before say so would need justification to later other say you be mind nipa or you don't mind the person. And if you choose to say you don't even mind
it is how no
to pressure you
obeka no atum no hwe no obeka no atum no hwe no but okwa no tum so hwe no no anka hwe ankere no so a eno so ye another wahala ana make me better na make kasa na wanfi
so then say na obeka patient no na kuma be call form
and into the obeka na say onya betere na obi wo ho onpa kro no wi a waba o se da on chance say wache nipa no wo no no so ba ya onzo hia ayi medical attention on jo so be hwe no na enti nipa na wo dada no ja no nkwa na wo so be den enti we overburden Kenyan nurses.
Okay.
They are overburdened with a whole lot of responsibility. Senka aya brochiri ha anka ebi anyame na maye koye consulting obi ye consulting enyame na maye koyi folder ana maye koyi meko pharmacy obi beko pharmacy akọ so ati ase bibia
eno na emo sa omo temper na ya na e no mbofu no hwa bed no no mbofu
because ono wa bre wo ye bibia at the same time and also banner say also wa nya ni papa who the ba onto the beshia because adwuma wo ye no hu ofin say also we appreciate no ni kwa say nka wo ba na ba condemn
no hold it are you mo wo say mo hwe say public na appreciate mo na say you are there to do your job and
go no edru baby a bible cry say
a patient will never appreciate
you are not working with Bible, you are working with the profession. No, and your Bible
me can't some natural. Some kind of make. Yes, Bible na make. And your Bible na make. Me dey see some so aka. O say Yesu nyini ye. No nya nipa ni mad no nya Nyankopon so ani mado. So atiase. Enti eye nipa enso so na wo ye omu adwuma. Enti se nipa na wo ya ama no no. Wo firi wakoma mu ya ade ama wo nua. wo say e
na
wo adwuma wo
asema who can we
na
na beto aso we so
no
say mu ko ye adwuma because mu hia public endorsement and as obi member abaso
no
and now
say
dey
na
adwuma
men
no
can say we adwuma and one after the other
Reason will be some
one
rush
patient
here.
after the
yeah
other
yeah
Reason.
yeah
I
but
mean,
any
Cassie.
kwan say
Okay,
te
say
say
1 minute.
baako
After
for
1
nti
minute,
baako
wouldn't
for
let
no
do
no
4 minutes.
baako for no say ono na wo so ye bibia na foforo so aba no nso so bu afu say ono nso so o mehwe na like
okay
there oba react
okay
the
te eno na
ohun say
mate
ye
point ka say yo
so o ye abro na dwum o ye abro de wo so wo ye so but yes
okay
still na ye nhunu de wo ye
okay
nti esa
uni am that's
weekend
why
bia be ye
it's
wo
na same time we
yeah
dey
yeah
this why me that say
But your mom, good
mate
evening.
ayi dabi abofosu me pa cho why ayi
Miss
ni yedua
Nedru
mai
so.
ayi dabi ayi fidi wo
Me patra na me wa ha.
we nurse ni ana
Me patra me midwife.
we midwife okay enti video na call viral no hu de call so
Me hu ye pa,
eh
but
eh
man shouldn't
enti
yeah because it was a bit
o fa na say
it was upsetting because since oba emergency honom no. Yɛmfa ne sɛ obi wɔ hɔ a ɔntumi nhome. Wowɔ nsa na wo bleedi. Yeah. Ɛnyɛ sɛ ebi a wo ti anaa wo like biribi foforɔ a ɛyɛ so urgent. Nti sɛ ebi another patient bi wɔ hɔ a ɔntumi nhome anaa sickle cell patient bi wɔ hɔnom ɛsɛ sɛ yɛhwɛ nansa yɛaba abɛhwɛ wo. Because after triage and at the end of the day no yɛhwɛ wo yɛkyɛke wo vitals yɛkyɛke wo bibia yɛkyɛke wo conscience woyɛ okay like wotumi kasa a wotumi answer questions bi ɛne obi a ɔda hɔ a ɔntumi answer questions ɔntumi ngye n'ahome and anyone even obi a ɔnyɛ nurse ni bi hu sɛ no ɛyɛ sɛ yɛhwɛ nea ɔntumi nhome yie ansa yɛba bɛhwɛ obi a ne fingers pɛ ɛna ɔbleedi and then for that for him assaulting like staff no me I'm not okay with it because my age was Ghana since I think 2014 till 2024 I'm by US her. So I'm not okay for him assaulting and still me back Ghana I still want to work because I like my job and I like being a midwife. Even though I like I have to work as a registered nurse.
What country be?
Like for US.
Nti dia force no ebi betuma si ba bia wo ye adwuma no.
Me not sure no.
Na wo
You
hwa de
can't
na
do it
Ghana no
because
ya na ye.
I'm from down. Say na. So on say na as a bibia ye open. I go tell her no like me tena UK kakra me ba ha. Before we call hospital no like ubenya security no a bit tight. Like usuro e ferry say obeye. And I say who ko GP mpo you have to book your appointment and sawako. Emergency no so any say like security say Ghana security I hospital like we just kola like na ebia nkokrafo no motete ho as securities but say ebia police because I go tell how be man na police ni na ejina ho as security ukoye den emergency crowd ura cry emergency police ni ete ho when you see we share back one now two when their cars are outside so you dey enko jimi on ho sir you can't do that. But Ghana no bibia da ho free obi aye nea o pen enye sa o ye de nkofa phone e video obi ebusuani enye wo ebusuani why will you even do that?
Okay.
And one thing about Ghana like obi aye ne part me I like my job as I said. I remember one time na me ejuma like me person me hospital.
Go straight to the point.
Yes, that night that was around 2016. 11 deliveries. I was just there only with healthcare assistants. I have to write my report. I have to do my deliveries. Episiotomy, as I said, me na science you nipa no. As I said, me make sure see nipa ni okay. Deliveries ba na utimi koye bi wo car mu e wa abonten. Also wo clients wa abonten
one person uti a won ko uti bi abonten go inside.
Yes, your beds are full. Den to the extent that say we call general wards ne cost rempa deliveries for her.
Really?
We na we cheer yes. That night, me started leave. And me started leave is not certain time. I think I started at about 10 p.m. By 7 a.m., no, my 11 deliveries. Alone with healthcare assistant. Healthcare assistant, no, so on to me did delivery, no. Because Bibi, oh, yeah, mistake, na Bibi says, yeah, you are the one to go and defend yourself. Because it's a client who will timer. And you are the senior nurse or you are the in charge. You have to go and defend yourself.
Okay.
And to me, for me, no me my healthcare assistant and bambe bibi on my behalf.
On your name.
No, not me home me. No, I'm not going to do that. So I have to stand and do all that. Nya meet me ama na and say, oh boy me we deliver no people labor room ni mame. More make sure say maybe bia were in place so that say we yes setter. You better ration into labor or that happen. So you can imagine stress nipa ni go through. Maybe na wenya obi ebuseni ejina sorry echi edi wo nurse ni natem. It's not like you are not trying. You are trying your best. And to look at the stress you are going through. But at the end of the day, and here it comes, say, ope wejuma is communication. Into nipa no ebuseni be kase oh, de nya abotre me ye we me a me sure nipa ni say. But say ade a nipa ni pe as like on our bread da. And I say no because
you must slave queen for na ba midwifery slave queen for na
so pa client no ebuseni ka no ono so be yi ano na ebesie nsi. But some of us, no, you are afraid, like you respect yourself. And the baby are free no po. Say the be touch my all the time and all that. So you do your things right. But as I commented earlier on, you may be like you will be or your mistake woman. Or be like or your faulty. Into be a pepe. For him, for Ralph, like going to the extent of even hurting a nurse and a health worker, it's a channel.
Okay.
It's not accepted. Onya oba, onya obia like no, he's minimum sema mekambo, but like he's supposed to be arrested.
Esa samre koma channel kura sabo no.
Seriously.
Send nurse nipa nurse ni awoye hwe nurse ni awoye adwuma ni ye pia na say.
Say like have you gone through her to see how many people she has saved or she has taken care of? No. And she say went me and show na obeye ni say why will you do that? Onu nebusheni a obepene ma obi assault me sa. And me baby I meme one I'm sure that say obi assault me we me kuno ntena. No.
Cause we are fine case.
No, no. They won't accept it. So, Ghana no yenina system no I even commented say yenina obekọ market. Buyer will be akwakoto northern region 20 cities no. Or the best year car back say all ban car na jene sa buyer back 10 cities. Into no so buy or the 20 cities it also into buyer back no. Or the 50 and 60 cities. Until like obia or mistake or babia. It got to a time where I was working. Government Emma supplies. Who use gloves, cry. Who so say be our shift in the gloves in the besa. Esa client ba oh yeah ne den.
Tina said there were you su kra now that's who you use at the where eso.
Thank you. So you as I say we use to back ye bibi bia.
Wow.
Hey. You are not supposed to do that.
Cross infection.
Hey. Thank you. And I want so nurse you know and you go to a time where I was working nurse say yeah to your supplies. Yeah to your supplies from that salary no more. Into be who obi beko Accra na ono akwa syringes, wakwa gloves, wakwa oxytocin, wakwa normal saline, wakwa Macintosh, wato bibia because delivery beba no ade say we client free kra untimi nye bi nye.
And you don't want to go home infected with somebody's
No. You have kids. I have kids. That time no kra na me breastfeed my second baby.
Hey, Ghana. I
Some of
feel
us sacrifice, go to work with our kids, cry because you beja ward nekwa. I took my child to the hospital one day, edgy bed, back closer to my nursing station, eddy me bane to her. Because there was no nurse to come in my place, me bane home fano. Me met me at nefi ashe me ba no obiaba in place. I can't call off. But broche hanu you just call off.
but Ghana they won't even call you off. Hey.
Ghana is almost like UK. Kankan wo care job UK. Ghana is just almost like it.
Na when na yankro no e bonus for na chi say omo ye negligence ni afi ya on.
Sometimes I wish say omo ebusuafo ni bi beka ko join healthcare system no to feel how it is.
Fidi kasa.
So omo ebusuafo to me join healthcare system no ebe catch omo whatever they are going through now. They will see say it's not easy. Ye wo time bia obi beka say the friends are yeah you want to be or say nkofo omo abon wo
akwa bi a friend Johnny Bite as one
so whatever. Yes. Me science. I wanted to do vocational skills and my papa by or see no be in me try 8 was saying me mam on my menye science volcano me nkonkoye science. I went to a private school to do science. Me re me say nursing na me pese meye. I went to do nursing with my good result. And will you tell me, say yes, you can poor and come in your fee paying medicine, yeah, but I went to do my nursing. So will you tell me, say me failing my result into na me koye nursing?
I mean, almost the money your politics, almost the more nursing you want hospital in your politics.
I know
your political station.
I really wanted to come here. Yes. Because schools the statistics ni why na ye ni na uko license na one pass here. You go back. Share US me buy me baba throw me NCLEX exams. Me na obi crampo mo say omo throw no 11 times. But because of my education back home in Ghana, I just went once. I learned for just like 3-4 months. I wrote my NCLEX and I passed at once. I'm a Ghanaian and I'm proud of that.
Wow.
I learned very well, like back home.
Wow.
Me midwifery, I know kanya nursing straight na me midwifery in natural enclave no. And because yes, ye Ghana no, ain't a bit easier for us here.
Na ebin bebre so buy almost say as a Ghana for no I said let me use the word substandard. I says and never people who are you upgrade here. But they okay, that's a kind of
reason and no system.
Yes,
reason
Ghana no
so book ni dia omonto ye.
Ohima 30 seconds. Ohima and now say chirim na nti ohima.
Ghana there no. Because a theory no. The way we learn, we are able to absorb and keep information. So we are good at that. And now because to say much is lacking in terms of equipment, Ghana tools is not available. No, and me jumani ye den wo but do yes. One because we say the ususu ade no foundation is so strong so we betcha. But do bedru ha so afi na obehwe system no ahwe because some system no practicals no different because they have everything. And as I have practical no, it makes it more,
you are able to go.
Yes, it makes it more easy. It makes it more easy for you here. But the crofia the end day, very machine
that's how
UK Ghana nurses Ghana African nurses near ma omo ye bibia enter cannula. You training midwife for UK. This all your course ne kan once na wetimi enter cannula. But we are nurse ni from Ghana e kan ho dada. Oba UK kan ho dada.
You can do all that.
There's a Ghana no nurse for ni sua de pa.
Me can me chiro. Come on say assignment obi ho mo obi kwa na assignment man no submit. Me come
instruments ni nyama no eni na ye nye bi wo Ghana
I
entimi practice
abuzi ke say yes is the
equipment
equipment na any one in abuzi ke say equipment na any one in dia.
because Ghana bibi te say
Dr.
hoist
Guys
machine ye hu bi da ye de ntoma ne pagya nipa ye de bed sheet ne pagya nipa
oh
wow sliding sheet a rubber bra sliding sheet a rubber
oh
ye hu bi wo Ghana da sliding sheet adia me fan say they transfer nipa from bed and also the rolling nipa from bed one side to other side ye hu bi wo Ghana da a rubber o bra a rubber
me more typical example yeah they trauma about a honoma now by emergency paramedics omo the bar they will do the transfer and put in the hospital bed right Oko Ghana because say you need sadie no omo the baby o ha moja kra wo patient ne ho nurses we so na we are so sane akukuru
they bubu no kon ni more
inti na accident si Ghana ye wu no because techniques and the pagya nipa eni ho into be pagya nipa no dismounting the whole body
what say bibi e won ne ho
enso so kromo obi nya accident na obi te hwa ye mpagya no just expect be pagya
no ne ba
as I feel that anti-feed our phone is necessary. In fact, without anything, as you Ghana for next for no, you won't. I mean, yes,
I'm renting a pressure no more yes
like if you be a mensa home, like I'm not really good in tree, but mean say if you be a mensa home, they are bad nurses. But I know na any pani subaya or no need free ni fee. But so baba be who so obi wu pa na waka say ore home money pana, then you are heartless. Oba be ka say who say obi bleedy. And you don't
the reason why we are like that the black person we are not empathetic.
Auntie ohima adikronte ohun ni sa ni say when you talk of abuse no system ni nya everybody is abuse minim nipa omo temperament enye nsena abrofo omo temperament nya kra broni kitikiti na ni buofu kitikiti na ni buofu but because omo zero tolerance to abuse our hospital no omo see to it say there is no way I say accept abuse in the hospital no sa checks no wo Ghana say the current abuse system no aye kese wo Ghana na say patient a oba hospital no ono onim ne right broni oba hospital wonim ne right from head to toe.
That's right.
Said the nurse ni so nim ne right from head to toe.
Yeah.
Enti broni nim say any kwan say me offending nurses because me offending na ya ora hospital ya chere go onum zero and I will free hospital kra na ye dey kan go assume say call na wo ye no omo accept zero tolerance to abuse to their staff.
Thank you.
Enti wo ba no wa hwe wo ye e na wura hospital wo no yeah wa humble wo ho enti checks and balance on abuse no e ye adwuma e wa abrochiri me wa Ghana me ko adwuma na me shefi atare emre bi me si free kam me ko adwuma na oba ba ko di machi asema be ma ne be kan say na me dru hospital say me say di nkwasiafo na tem no ebe ye omo wanwa na maame na wo ka ho ne sreye lo and behold say na omo ba me department what you say enti me room ma me kworo me ho na me catch security ni say enye visiting na wana enipa mienu na wo ba no o make sure say omu nwram because now omu intention omu di ra hospital so omu be course enti me catch security ni say ma omu nwram enti security ni ye make attempt to say enye visiting hour enti no montwe kakra no fa Jimmy ko yentwe de ba de na motete won ma mo ya enye visiting hour na maame nurse
whoa
enti me frɛ maame no na am say mommy wo be de wa ha e no say ne ba ne da ha sei and I'm saying to wo batanya wo badaha obada hospital who supported this kind of behavior from oba boy na we do wachi no medi machi na eba ye ba o ka kire wo say obedi di nurses atem no want me an kan kire ne say for the sake of unua na oyare da ha ni ntini be careful oba ya no so na wo start say wo di atem no who support with laughing which means say wo ba ya nurse ya train be na de be man say on family so what you say and you're visiting now with all due respect, mommy, mumpie. A drew visiting now, moo roma, kutu banner for our bontain. Now, Bani Roma, when you knew no yareno. Because me any part the shame bufua. Me any part, I'm sure my transfer before ni too. Obano or dahonomono. Nti sa wo won dwene wo ba na oda ho no na wo pese me dwene ne ho ma wa na.
Okay.
No matter what, I have been trained.
Yeah.
Ya catch him say the me senior adwuma ni ye. But me nyi nipa aspect ni free me mu.
Okay.
If Baba boy ni pie, ne kotu ne fo. Mami na ni wu pa na odi ni pie ye. Omo ba no na o ma comport o se.
Ovozu ji abo, ovozu wo. Hello, ovozu.
Me wa hanum se minua.
Ovozu wo so bre mo na nurse for na dos nti o ma komo ma cheche mama.
Me mamo good evening, any good morning e wo Ghana. Nyamisha mo ne djuma pa mudi. Me de menye health worker, but many health workers be bri aye djuma.
Okay.
Minua no mo nko a for no mo health musisi. Be 2 year midwives and 2 year general nurses.
Okay.
Na asem na ye ka no be se pade kuni na haban etase ne benya asafo. So one hwe ya obeka amanapa obia ntimi nya 100%. Sani ma kosu nyina no reason busa ho say what is ade we BSc or 37 military hospital and a police hospital in Ghana. That's the first question to ask yourself.
Okay. But say BSc omo security yi to man for my bonten.
There be so there be some medical busa question into what is a BSc order.
There be na maintain.
So ko 37 military hospital ahu. Uko hono mo a. Nurse ni na wo hwe no. Wo hye soja atare. Uko police hospital police ni na wo nurse ni na wo hwe no. Wo
police ni
atare. Nti wu na soja ni na hu na bonti a besuro no. Police ni na hu na bonti a obesuro no. Oro no akoto no hospital hono. To do hono mo a do before complaint discipline no. Ewu mu na ade ewura hono.
Okay.
Thank you. To do hono irrespective of said the besi bia no.
Odo trouble be pie ba untimi fanye untimi enye nkoso ho.
2021 yes 2021 way back September o baby. So what is a journalist be free UK eba Ghana oko ofisirim no ofisirim mu ba yese am Roberts bebo on the 20 year you know.
Yeah sa case me kai pa.
Na oye me colleague anu oba Ghana inti yijana kwan before so back ene ne di nkomo na sa nema nsiye nti omo anu omo kana ho a ye bo mu tu Ghana fotu anu kan ho a ye bo ba kutu woni sirimu no eno nam so ma me ko pie ewo me ko police hospital hono but me ko eno say emergency ni respective of said ye tb a wo bana ana ho uduru anu aka to say jawni pa no ho omo di ambulance ni duru anu hono ma police hospital uduru anu aka say jano hono omba be fade akọ udi echa na yi ana wo wu osisi o mega se jano hono ko. Okay. Tinani mu hono ye hia wa ba be fro.
That's right.
You rain inside hono menye wadwuma. Enu nti na wodi abeto a wo no. Se ukọ logical se ukọ dwato a obi hono ma okudu ma won kan wasem. Dia be chere wati ase. Na ade bi yo hono mu ahụ yenti ameka se ebese panic nya haban no. Se wo ba hanum sei na se wo yare na ko hospital me kai say last year December o baby me ko hospital me say o ase me share them feel okay bi me go mo ka kire me say me book appointment o me book appointment o mo ka kire me say emergency me ko emergency enye emergency metimi anante aba ho no nko ade me ntwen inti ano chese me nyare
o yare bata me so mo so ne o mo so o ma hu de ha
but omuwo bibia everything is in place. Wofra hospital come back to say your call is being recorded for monitoring purpose. Inti ye na baby afrifi ye ni baby afrifi ye ti bia e ba be track you. But Ghana no yamani nyina kwa koye politics. NDC MPP NDC MPP NDC MPP see you politics and free your mindset in ma e wo yetiri mumpo hwe imagine say a whole cabinet ministers you akonya accident na obi penmuti make say omawu ntidie ask yourself that question. It is a tuunu ya bia na tubusu ani bia have you thought about family no me affected no Those are the things. Oh, inti adeɛ bi wɔ hɔ nom a yɛma politics ni di anim na aboro so a na eduru baabi a ne yɛ gyimi. Women to sɛ bi wɔ ho. Eduru time bi a yɛyɛ saa na afei yɛwerɛ fie ho sɛ yɛyɛ nipa na afei politics na di anim. Anya NDC MPP. Inti ade ne sɛ yɛ papa wɔ bɔne o. Yɛ deɛ ankɔ ama yɛ ne deɛ yɛmfa ho. Oh, saa nneɛma a ɛkɔ so ne nyinaa no. Nurses no oba be wura ade no mkura no okọ na the protocol na de ama no me the minimum say because many health workers be brave adwuma the minimum say nursing no your ranks be brave enroll nurse general nurse your psychiatry your nursing officer one midwife saa de kwa kusi soro and some experience in abam but nurse bi o no mo a ye posting de na kodam ngu no so won pe ho pe greater akra because o say makeup or was to be a baby into a non person na hospital bia so wo e wo the quota or hono on cut off point there ye here enrolled nurses 6 ye here general nurses 4 ye here psychiatric nurses 2 ye here midwives 4 no ma ba be ye adwuma o hanom ye here physician assistant 2 no ma be ye adwuma o hanom ti doctor ni wono mo ni physician assistant ho we ni wo ni so wi wo honom but general nurse no epese wono koye adwuma wo Accra enti ebeko no ebeduru honom no na omu di protocol na kwa kuura mo nani papa we onani eduma ko hospital no na general nurses obeko no na quota na yese general nurses ye hia 3 but general nurses omo ho ye 6 iti budansa hwan ekumi ekuro division of labor na wen hwan ekumi ekuro hwan ekotia no yonko hwan ekokire obi se adwuma we kura we na ye.
Okay.
Aha oba hanum see ya. Your phlebotomist or you will be a no sterile technician ono na ade operation you are on adwuma no ko horo ho wi a was sterilize no what you go baby egu eno anu wi na adwuma
a chip ala adwuma ni bi no a chip ala
phlebotomist ono de hia na ne se okọ a obi aba o twi ne moja okocheki eno anu wi na adwuma. Say recently I made the menu hospital na kwa no operation e kwa see ni ba ya no be ye ne de wa prepare no obi also o say me you say we wi okọ na nurse ba kwa ba no wa be cycle no okọ na we aba nipa ba kwa e be operation nurses different departments from different departments
we are not trying to report
obi aba ye ne de no okọ e bagana de no jack of all trades na yakani nyina nipa na wo ba no kra no wote wonom no hwe eduru no ye the passion ni timi ade bi on ma me se wa wu konfo anoche nurse ni te no ho ye de oxygen si ne so wo hodom no ka che nurse ne se o pese okọ private ana nurse no esu onu nkakra because no timi ho me kakra no osu onu no de no ko wi an obe fa ne phone no miamia ne phone so o miamia ne phone until so hu say me auntie ni kunu eba hu no say hey Jesus oye Jesus na an colleagues ni bibusan sa adai o say hey papa ya wo be me de ne yira ko she toilet so
kwa
yekwa na meswa na wawie I say or try say obe sorry page anom de na beto ho no the next day we inti ade no obi ho no a sa code of ethics na okowura mu na ye be kire wo mu Florence Nightingale ade odi kan ye me be ye say nurse ni a noble profession no obi wo no okowura mu ya na ne refi ti passion ni ho no passion ni ho the love for humanity no eni ho no biem it one the any fan so we nursing uniform no share scraps
many ho obi apa adwuma ye
top and down
so checks and balance
adwuma
freedom of misbehaving there should be checks and balance in the hospital
nti ade ni nyina no nti na meka say e pesipa ne ko nyina ban see yi politics ne di free mu Near Yadrin say, Sir checks and balance here, Ramakin. Sani many you know, Penini Baba Yen Juma. I didn't buy there's orders of nurses, Omunina Chimu, no Munina UK. Omunina UK. A dear Trabus answer a question. And I can say UK oppression, you want pressure or. But Omuko do a Juma Crona or your Ghana na. Ne ho chere ne gidigidi no okodu ho no adwuma kro na obeye se adwuma na bi but ye betua ne ka chen sa
yeah
do we value our nurses sa nurses yo mu kokoi how many nurses are out in some 37 military hospital how me o ma just almost ko bi because we a nurse o ya sa ka chen say we a naval officer no ye man allowance kakra nurse ni yes am allowance kakra onu wie ye na watifie no benya coins kakra no de ababa be wuram no oye adwuma but nurses tifie into onu tifie no the pressure na tifie
so your system no I mean and the okay young so the attitude
the system
yeah one na we
system ne
attitude na boy na the camera ko ho ne boys no bebre kugu ho no sa de no I mean necessary say mentia say mawura hospital na ese me ano am say me yes citizen ese me discipline me ho the omo ye ni high level of indiscipline
the attorney say my men fa no wie the attorney say
the reason
the right to mbacho me wie si asante
onu wi aye kemfo ya wi ano to wi ano
me fa say camera wo de to so ene de keka na hanom say aha obedru ba bi no se police ni no obi ya de obi tim the camera to so or right to the camera to so betim the camera to so but say bia obokako yi wonsa e de akwakobo obi ne de ka trans o ye na o say omoche no irrespective of who he is also omoche no but until am di kan say ya na the politics na wura ne ema bi mu no I say bibia ye be ne so we affiliated to color white in tino ye ko yes see the assemble ne de keka but irrespective of said yet ahanum say mayor kra police channel
obondo
mayor police be channel be channel because say sorry sir I'm sorry onu so dey assign the payroll but one thing they say a system ni ye adwuma enti kanipa no wo yes anu say camera na ekura ndi obetimi atwa indiscipline because obetimi atwa on right
no untimi ntwa
hospital say ye video
untimi ntwa I have still proud the camera ko to police bebe ufi
no recording they post it said no recording
tio dia me can say me say
then I will for hospital untimi go where the patients are kucha video say obetimi atwa
eno dey wrong eno dey wrong but the me channel say me say camera no at the end right as a citizen tina me cite example say obi twa camera police ni intimi stop no
that be where the hospital assembly we for police what do
CCTV crowd hospital
police there so na mountain where
you're wrong he needed to be arrested outright.
Minister no minister for the sector no where the church
minister
on top of the world
serious by now or say for resign
seriously obi a wa assault ni papa na wa be ha
because one party no or your
try as much as possible
na mo nyina mo ye say dia ba nurses dia na Ghana dey do nurses so
but me chia mo nyina me chia mo tif
that's why you stay
yeah unya
wakasa okay what am I what's of why
we dey me shawa if anything sa attitude ya bo we da na didi was anka ye che no kra
now why minister no call help minister no need
and American where this boy who or you sue the lapses in the institutions no against them to promote himself in terms of fame. The other is not it's not right. It doesn't make sense. Who the same guy? I quite remember when you were demonstrating. Oko blockade 37 coin. Pay coin the patients, emergency patients. 37.
Aye,
Catch
thank
almost
you.
say Ghana for ye more na ebi wu na ye den. Ben na wo di moto akobo obi. Wo di moto akobo obi o. And o pom mu ade. They should look at you at all costs. It doesn't make sense. Wo na wo di moto na akobo obi o. And na wa rushing to the facility. So to boss na nkomo hwe nipa na ma wo no. Wo san ko esa ko ye mesem wo honom. Ama no action has been taken against you. Inti ye o man na say ye den. Yes, it's true. There are lapses in our healthcare. But you can't take advantage of it and disrespect everybody in only say nipa no obia na tesana.
Ghana Registered Nurses and Midwife Council for say omuma ban 48 hours.
Yes, they should take action against the boy. The boy is misbehaving. Or misbehaving too much. Our country more. I don't know. Ade potia or who are yes in Sehuna obi ntimi kan no kran kire no.
He's being back up.
Told. Obi or ya boa owu. Ba wo dey do so dey. Who person cover up accident na incident. Wo di motor na ko boni paniti. They should look at your patient at all costs for you. Now, sorry, also you are fighting for human rights. What type of injustice is this?
Sir, Mahama ne offers here friend Joyce Bawa on any gina it. Akwa no present water.
But then what she no take advantage of the poor citizens. Yes, it's not right.
And because
he was invited there. Right.
Yes, Ghanaians are not well informed. We are taking advantage of the lapses in the institutions. And what brainwashing them say the institution is corrupt. Obey the institution, but the institution is corrupt. So do whatever you are doing. It's wrong.
Very funny.
And it doesn't mean say police for a corrupt.
One thing they don't know is
police need be corrupt. Doesn't mean say nurse is Libya bad. Every nurse in the at the facility are very bad. Oh, it's unfair treatment. It's unfair treatment. And I think that the government should take action against the police should take action against this bad guy. You're fetching out of the system. Yes, so this bad character no be destroy BBR. Okay. It's very, very bad.
Right.
It's very, very bad. There is no any developed country. There is no well developed country.
Officer will use as an evidence. I just a court
numbers
issue right to use the CCTV.
Obi phone now kasa obi I don't know. I don't mind if I see.
You see, CCTV what public areas and no yama indication say aha we run CCTV wa ha say because surveillance CCTV see e wa bruchire na wonko yi emi against obi we di sia wontimi mfa and build case wo baby a enti there eno kra na disclose say hospital has CCTV wa ha school has CCTV wa ha no issue see a court and ma order say for CCTV mra mo kra muntimi fa no akotwe camera ja koto obi so say video no bad
but I say asante man
na obi kra po da ho a order yaren pass o person obi abe wo say yare kra da ho no akotwe camera see ni so na video no it doesn't make sense me I have a palm enti na mentimi hu asema meka no the police should take action against
it asante man for the officers na yaton ha che
the reason they make an say Ghana is a serious nation and by now kwabena minta kando nkeni kwa set 12 hours prior to no office because obi edin kwasi asem say na udru wa as a health minister na wu mom eni nipa na sesre asa shikino which is say the nipa na ye no which is say you do ye badwin ba bia na wo she kire bi you are badwin ba bia na o tene ma ase no wo she kire bi because who na man go ahead so nko yes ade no what you say because there was a time na me security in Dubai one guy be onya adwenemuka kakra na yede ne ko psychiatric hospital e wo Dubai me dro hono no ade a omuma me hu ye ne say there is no way I meet me yi me phone say me person me twa bibi wo hono even call ube receive kwa fa phone to silence ne pia bonten because omuma me ya aware say abodamfo na e wo hono what you say it is a serious nation and by now minister no nko no kra ni obi na be ka tell so one resign who resign but this one say woman na kwase mu no from head to toe no yen nyina obi anya serious ni ti no ya ne nya mpanifo nso omu so nye serious omu nwini bibia ho obi a oye adwuma wɔ Rich Hospital wodu obi akɔse ɔno nkɔhwɛ obi nurse ni hwɛ no wokɔ ya ne nurse ni no so oye adwuma so wonya adwuma ɛyɛ adwuma no ɛyɛ ntubuase no so wɔde hwɛ nipa no wapira sɛ bi wɔde akokuduro kɔkɔyɛ bibi kura na ebetimi awɔ afa so ama nipa na ade ne ba no kura wawu edi sɛ okɔ ya so wɔyɛ adwuma ɔwɔ so nya abotrema no no wɔyɛ na adwuma wɔyɛ de obɛyɛ nyina awie sɛ bi ɔmo wɔ first aid wɔ hɔ ɔmo betimi di first aid asoso ano wɔsi sɛ ɔmo bɛ nyina bɛ wie ɔmo bɛba bɛyɛ ɔmo ba bɛhwɛ no na wo kɔ ya wo akɔtwe camera sɛ wodu obi aba nti no obi ɔmo ama mɛhwɛ no how dare you na nye Ghana na efo a
prepare nyina ebi afọ mo prepare nyina nurse ni a
nye Ghana na efo a problem na wo wi asepa wo de kyerɛ me African country be wo de Cote d'Ivoire neighborhood countries na bimba no Cote d'Ivoire betimi akɔ yesi wɔ hɔ the year 2016 na me wo Togo minya accident ye de me kɔ Togo Lomé government hospital omo ka kira me papa mo se me papa mo de me ba wo se omo ni right se omo gina ba bia even omo beti omo kwa hospital na bontin omo hia bibi omo be fra omo
okay
enti Ghana no ye serious then ye serious sa boy no enti ke do se nka eni kwan se nka within 1 hour na wo se nka ko pick no
Oye big. Boy, no, feel big.
Yes. Feel big.
Yes, he's really big. Say, why are there? 2 years ago, me back to our UK, the screwdriver, no, the diago, and no, the share nano. And I me back penny bed chain, and a chane, so on the pallet. Because tonight, emergency. 3 almost 4 hours.
The whole health minister.
My brain, I'm sorry for it.
Nipa no obedi kwasi asem no. Hwede ye woni ne ye. Wow, that me can say obi ti ba bia no obeka se na politics na politics na aside that for politics to nchen. Woni say your man ho adwuma nti ne do beto wo no.
Aha, gini pana manipa ne kan bibi kwa egu aso. Right.
What you say? And this one, Jimmy,
disgusting, very disgusting.
Right now, I said, "Come, serious nation be a Ralph was a court to cry. Your process be a second quarter or court. Neck and neck, ye didn't answer me beside the into your
right.
Okay.
Okay, I'm at Kakrabina Yantwasu.
You blame nurses, no. We are mimi observation. Doctors some of them are quite bad. They make the nurses nejuma too much, too much. There was a case another doctor need to sign. It's like the nurse have to chase and go look for him.
Wow.
Who say, no, obiti honomo kase no the nurses for nothing. But the doctor have to sign on it. So I'm not fixing his signature on it. But the doctor is nowhere to be found.
I once had a case like that.
Yes, I called
the doctor. My friend said, "Oh, client say. Oh, mommy, say no. I'm not letting the client go off. I'm going to give this medication, and I want him to know. I'm going to write it in my book. Say I called him at this time. Or say, oh, Fidas, you can give it. Don't worry. Let me say, Dr. Jan, I'm writing this, and I'll write it that I spoke to you on the phone at this time, so that in the morning when you come and sign it. I did that, and I saved the woman, and I wrote it. So I said, this is what I spoke to this doctor at this time, and he asked me to do this. And no cry Edrona on catch and say no, Edrona Dawson. And he met us so no mamma say, and I can say okay for that, do that. And I may and catch and say okay, so I'll give this dosage, and I'm giving it at this time. So in the morning when you come, you have to come and sign, because that time no emergency doctor anka obet me about see they be on to member now about almost 1 a.m. Me throw on my book said this is what happened. And Pampan so by he came to sign.
Yes.
And sometimes to me I will say yeah nurses ne bibi wo ho a you bet me a petty. We should just try and do it and call and let the doctors know. Because at the end of the day, no Ghana, no, they have to sign to make sure, say, whatever we are doing, they know about it. One thing, no. But so say abrochi han no ba emergency bi wo ho no wo nurse na say okobisa doctor. And say okobisa doctor no kra obedi watem kra ka. Obehwe we say I say wo nim hwio, I say wa bom bi na wo ho.
Me dey maybe say one catch them say my boy.
To ask. So you are expected to let the doctor tell you do this, do that. They say you find say Ralph ne fingers ni say. And can nurse ni bi wo ho no a onye hwe. Maybe obetimi aba na wa share ebia esi twin bi obetimi ama na wa siucha quickly na eno na efi ho. Say anke ha but Ghana no. Ese say doctor bi make sure say wa document say ye be ye bibi say ama Ralph no at this time.
Okay.
So that bibi koto chima you the nurse you must be held
accountable. Not doctor not be justified.
So at the end sometimes they have to understand all this. It's unfortunate say patients they don't understand. And sometimes nurses because I say such doctors num into ukoye bi kra boa doctor na say wo tie wa say wo cheche ne ho egu so you have to lay back
reason
and bully
reason say doctors no so mu free school ba for fra the basic job on the nurses natural when say nurses natural catheterization passing of NG2 and you marketing me say
we do it with them
madam for say no oje o mo chit no mo didi no a kire o confa no say oje o mo chit na no kire o doctors no o mo free school by a book de adwuma na ne practical no fa say and most of them nurses ni senior nurses natural doctors ni bebre adwuma so what you
say me say set line no ma average na won mami sia ni wa no level 400 or level 500 I can't be 1 years ni we medical school now crampo first year
reason mami can we
no I also kakaka ye fancy
we say me can say we say are hosem omuku me ba Ghana 2 years ago na ku omuku no okwakowo na ono so na so ye den because me catch say based on my experience I me ba me volunteer hospitals no okowo general hospital we be say confirmation but oni ni ku no ma so den dom so mo private for no let me tell you
one on the job for
one thing I'll tell you if there's an emergency something when ya ubenya senior nurse be midwife be our ward doctor in the emergency for Fanochi they are always around. You are not going to be lacking. What happened is say okoyo preeclampsia or mukwa kuchani CAE. So the blood pressure was off the roof. Instead of say administer medicine through the IV na aba form no. The dosage of it was high. Into a drop boom. That was what killed her.
Oh.
And she was at UST, pharmacy school or pharmacy in Po.
Meanwhile, a government, they would have given her another medication to counteract it.
That is what I'm saying. Now, wouldn't they have
to counteract it? So that the person raise BP, no.
Nurse, no, they are no. Doctor, no, yes, C6.
And even do it slowly.
Slowly, sister. Or kokra. Until left with the nurse. That killed my daughter.
Private hospital.
Medication.
Private hospital will be delivery. Reason. Private hospital.
It's not a place to be.
That's all they bad. Award no. Techniques back where one say. DBA, traditional birth attendants. Unko school. But when the process comes, Accra so be journey anymore, or beba. The MI who say we a skillful nurse and as a skillful midwife, say you'll be able to identify complications and treat them.
Okay.
Thank you.
And no. So we could see private hospital. On to mean to no or fan crowd fear no a training woman on the job.
Oh.
Obaye no onim say wonyem obi pi kosoro but e wo say meje wawo no onim de BP no nsunsu anso a meje na wo true na man treat a ebeye. That is what the private nurses, most of them na ya pam the same uniform ni bi ahihye wo mo no. That is the mistake I in private hospital. Me ma me koye tonsillitis ayi ni minim the tonsils ni ye inflamed e na okoye operation wo ni minim. Obi a no operation woni minim a anka aduane e wo so wodi aye ade a eye very soft and smooth no yo adura ye chiroma no suppository na nurse ni akwasa nsuo di ama ne say onom ono so wo sisi yare enti suppository empa no ho da bia mitobi koma no enti oji aduro no no say aduro we die era mama mi bia me de hye meto me fa hye me into the sheni sumi ya si no catch ni se wano because so okoka ebia na ya tia na se bibisa enti me ba no say ama aduro ye de ama me say me nom but odi nsu abesi ya me so di mama ya me de hye meto na me say mama wa anti ni ye nurse ni bia ni won mo be ma waduro we say nom enti ti na wa anti ni ye wo se nsu ni si he ye de na me say mama wa anti ni ye enti enyina ye nya te say de me nsu mi nim ni en friend nurse ni enhye. Inti mi friend nurse na me say mama say woman aduro bi e na o say aduro we na box ne da ho e na me say na wanum me kan no question o say mama ade na wanum wo mama time na pa ho nka at this time ko say me san be ma wo ba ko e na me say forget about that money biem e na me say money biem e na o de man no say mama me gina ha ya fa hye wanum na me say say suppository ade na so fan hye nanum o say mama oh no, my mom be difficult, pa. I'm saying be difficult.
Oh no.
Adroni is suppository. I was an audition at all. One no cranny, I no operation. Doctor just say right now, no, we're restricting nape us. I said the same baby and fan and noom. I feel no a bunko to your mammy, Miss Row.
Oh,
man, me pa chow. Me a private, what can be made?
Oh,
and I'm saying me the chow on soa. Maybe I'm not a serious medicine bia any panel. We hear training, we hear refresher training. Intimate me fan chow and funny say me three more than if I say me save others. Because we didn't know much say a mistake. We need the end for it's better say Bema will training ye. Now would they be save others than say me de be shame because me mammy didn't acquire suppository. Obi de bet me emergency drugs beer a befa money. Into my report talk akra. Ni nyina ye ma wo training. Say the
report akra.
Obi so emergency. And I'm reporting no. So what I say doctor na ono no obebi esa hospital no ye adwuma confirm no chi. E na wo wia cases eba ho. It wo confirm no chi. Operation na was say ye betime de 3 days ayama no. Ni a sheda de wakodi 1 month line. No wa catch us say wo pen ntem a. She am me private hospital ni akwaje obeye 8,000 Ghana cedis and I said with 20,000 Ghana cedis. In the cases, or much they booking no 1 month, 2 months, a big 6 months ahead. So better private lines, so
Charlie Uncle for be a wicked
government lines, so into no cases like private areas. In 10 tem, no matter you music bottom. Sadia is a report to ma see you and I say hospitals are kesiano there. Appointees now government na dey mobile no no. That me fan say I say ne be kan wo registrars and I say you know. The report to a case and was we dealing with the doctors no. Ye. So what I say because we buy ban kro.
CEOs no fee.
Yes, we buy ban kro no. Adwuma we say ye private government hospital no. Na bi akwansi bi e wo ho no kra na ban ni benya no. Na wa head delay case into open in tema mame. When you fibroid na wanya no emoje 2 me fibroid cases be breed manim intimate me ayo we 2 months later into open no man kwaka meti me de work me private hospital me yama within 3 days within a week 20,000 meanwhile no omo hye omo ne me ye kwan da hole space da hole we are the vulnerable people in the hospital. We don't get anything. We don't do anything. We are just being abused.
Some we are legitimate. Say nipa no evidence across the hospital. Near bo mochi na one for any doctors.
But na confirm no che kwana no. Ne ko gina surgical ward kwana no. Ne bisa ne se maame. Okoye no. Opa. Koye int ko pe obi ni ko demosle. Enko gina baby. my okoye de okoye no me koye surgery okoye doctor say nyandru mi so obedru mi so a say me pen intem de anka ne private me so me maniska enye na
Okay.
enye na obi so yo say bribery and corruption nurses yeah the last people like sikafe and some hospital sika bi am fa yensem
and some of course were health sector organa no case will be the
It's really bad.
it's as a female person be on the hospital your nurse male person be on the hospital your doctor enti say obi wo records kra na otia obi aye so your nurse eya mo mi enhwehwe mu yie min kasa min crofo ne ye ebi wo attitude ebi so ban ye
Okodia say UK krasa no UK nyina omo yes corruption was it is not only in Ghana.
Report it.
They do the same thing in UK.
UK de minim ni say we ye adwuma hospital no bi chewa de kra ntimi fa nkofi wo de koto general ward fund ntimi ni pe bi obi kwaje corruption o UK minim eye hardly so be discuss with
Okodia UK side no mutimi boss abra ne bi Okodia UK side
Labor and I had US had minim say just labor and delivery na no crampo say nipa what nipa na we you know then the person will bring like something for the whole
world flower ne card
you know the two nursing patient into say bia tax no the buy no more check no nyina mo cheche
mo call for more Ghana nurses no more Ghana them experience with them who you know in fact attitude towards patients you know is dangerous.
I know the majority no because check some on him enipa wuja nipa bia pema na wo ye de ope o wo ye de ope senka senior nurse o ho no mo no disturb obi ana say ya punish obi severe ewo abusive language
ya revoke obi license be ya to
ya revoke obi license because UK no me to me buy me ntimi am practice nursing wo UK because me hwe salary no ene emra that nursing ho a me ntimi Timi say menye
salary no crampo ye very bad. UK nursing is bad
because you go and you cry revoke your license keke wo be san kodam wo be dem wo UK enti no wo no wo wura mu ade contract Ghana ni free Ghana ba won timi practice straight from UK ni say enema na wo besua ne ye omomra majority of it ye omomra omo ethics because Ghana ethics ni UK ethics no e far different so what you say enti no wo baba besua say aha say no sa code of conduct no we be use no use ni ye wuntimi any obi enya encounter or hospital no onim ni case onim ni medical condition
okay
Ghana obi anum adran so onim yale a yare as oni ye ni right to know our medical condition and so yama madra me no
mami na mo se wo ho me da mo se china they say ya trans ye be regular current affairs issues anytime be am water na join here why
that's the reason.
Yeah, me do bibia say achina same time to our time ya no adwone your friend mode share behind the reason so me da mo nyina mo say why mo comment section now ye do bia say time no so e say this why me da mo say ye nto so another day me da so pa